Shortly, we are going to begin with the first lecture of the day. I request everyone to please be seated.
Hello. 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 ಚೇಂಜ್ ಮಾಡಿಲ್ಲ ಏನು. ಹಲೋ. ಆಗ್ತಾ ಇದೀರಲ್ಲ. ಬರ್ತಾ ಇದೆ ಬಿಡಪ್ಪ. ಇದು ಬೇರೆ.
A very good morning to one and all. A hearty welcome for everyone for the day 2 of 25th APTICON 2022. There are 4 orations or the memorial lectures and 9 lectures or talks by renowned speakers that are lined up for today. To begin with, I first welcome Dr. N. Udupa, former principal, Manipal College of Pharmacy, Manipal, to chair the first session of the day. And I also welcome Dr. Ganachari MS, Dean Faculty of Pharmacy, Belagavi, to co-chair the first session. There is nothing can be best than to learn the recent updates from the Dion of Pharmacy. So we cordially invite to start the session with Dr. B. Suresh, the Pro-Chancellor, JSS Academy of Higher Education and Research. I request the chair and co-chair to start the session. Please.
Good morning, everyone. Respected Suresh sir, it's my dream come true to share the dice with you, sir. I know I'm a very small person to introduce you, but as a responsibility of the co-chair, I've been bestowed to introduce yourself. Sir, I'll try to introduce whatever the biodata is given to me for the benefit of the all young graduates or young teachers here. Professor Suresh Bojraj, sir is currently Pro-Chancellor, JSS Academy of Higher Education and Research, Mysuru. For past 35 years, has been actively involved in uplifting the standards of pharmacy education and profession in India. He was elected in 2003 as President of Pharmacy Council of India, the statutory body regulating the pharmacy education and profession in India. He was once again re-elected as the President of Pharmacy Council of India in August 2008 and in August 2013, and broke all records by winning the PCI presidentship for the 4th time, and has unique honor being elected 4 times to his leadership position. Sir was also chairman of the scientific body of Indian Pharmacopoeia Commission from 2012 to 2017, which is responsible for setting the standards of pharmaceutical substances and formulations. The leadership provided by Dr. B. Suresh sir, the Pharmacy Council of India, has resulted in bringing about a paradigm shift in pharmacy education in India. The council had been able to bring out several path-breaking regulations that helped enhance the standards of quality of pharmacy education and profession in the country. Sir pioneered the cause of promoting pharmacy practice concept in India, and has a unique honor of having introduced postgraduate program in pharmacy practice and PharmD program in India, and continues to strive to uplift the facet of pharmacy profession by closely working with other global leaders. As a Pro-Chancellor of JSS Academy of Higher Education and Research, Mysuru, formerly known as JSS University, he has nurtured the deemed university to scale great heights in a short span of time, and was successful in helping the university be ranked 34th nationally by the NIRF MHRD in 2019, ranked number 1 by Karnataka State University Ranking Framework KSERF in 2017. Under the Young University categories, obtaining NAC A+ grade with a CGPA of 3.47 out of 4. He broke all records by making JSS Academy of Higher Education Research be ranked among top 500 universities of the world's Times Higher Education ranking, became the first deemed university in India to set this record. The university was able to forge several national and international collaborations under his dynamic leadership. Dr. Suresh sir has also the delegate member of the United States Pharmacopoeia Convention and the chairman of International Commission of Accreditation, the Council Pharmacy Education, ACPE, USA, and is executive member of the Commonwealth Pharmacists Association, CPA. Sir also will be the past president of Asian Association of School of Pharmacies, chairman of the Education Society of the Federation of Asian Pharmaceutical Association. Sir is the past president of Indian Pharmaceutical Association. Sir has to his credit several national and international publications and initiated several international collaborations through bilateral academic and research exchange programs. He has to his credit have been organized several national and international meetings and conferences in India and elsewhere, and has spearheaded the organization of the World Congress of Pharmaceutical Science in 2011, 71st International Congress of FIP. He has actively involved himself with the education initiatives of FIP and be an active member of FIP Pharmacy Education Task Force. In recognition of his invaluable services in the field of pharmaceutical education, he is a recipient of several national and international awards. To mention, in a particular of FAPA Ishad Award in 2004, International Award, Doctor of Science, D Science, honoris causa conferred by the Tamil Nadu Dr. MGR Medical University, Chennai in 2007, and by Rani Durgavati Vishwavidyalaya, Jabalpur, Madhya Pradesh in 2012. Dr. B. Suresh is also a recipient of prestigious Eminent Pharmacist Award of the Indian Pharmaceutical Association, ML Sharaf Award of Indian Hospital Pharmacists Association, and the KC Chatterjee's Award of the Indian Pharmacy Graduate Association and Fellowship of Commonwealth Pharmacist Association. He continues to provide his leadership role in his multifaceted career by serving on several national and international statutory committees, namely Drug Technical Advisory Board, National Board of Accreditation, National Committee for Clinical Establishment, and the Committee for Control and Supervision of Experiments on Animals. He is fondly liked by all his colleagues for his human approach and his excellent team leadership. This is just a gist of the sir's biodata. To herewith I present Dr. Suresh sir for this oration lectures. Thank you, sir.
Good morning, everyone. Respected Chair, Dr. Udupa, Co-Chair, Dr. Ganachari, and all my senior, dearest teacher colleagues and students. Starting first lecture in any conference is always a challenge. Again, similarly, giving a last lecture or last talk in any meeting is a challenge. I am doing both, I don't know. Yesterday I was the last speaker and today I am the first speaker. Let us see how the day goes and how things start. I am sure that all of you had a very good day yesterday, going around, meeting your friends, taking pictures, because we all are meeting after a long gap of nearly 2.5 years to 3 years. So I think all along it has been only virtual meeting. So I think getting into this physical meeting with such a big, large group is first now after the pandemic, I think in the pharmacy field, as I know. So I think it would have been a great moment to all of you. Similarly, the students who joined perhaps the B Farm or M Farm, hoping that they will have a lot of professional interaction. For 2 years, you were all on virtual mode. So really, you are attending only the virtual conferences, virtual meetings, webinars, after which you got tired even with that. So now perhaps this will be again a new experience for you all to go in person, present a poster, meet the peers in the field, and then try to see how you can shape your destiny and career. I think this is a very great occasion, and I congratulate APTI for coming forward to do such an initiative with a lot of challenges ahead. So congratulations to all the APTI leadership for doing this. I chose this topic, empowering academia for advancing pharmacy education, as the theme of the conference, along with my colleagues, with a specific purpose that pharmacy education today, I will not say it is in crossroads. It needs a lot of mentoring and it needs to go to the next level. And for that, who should be empowered? The teachers should be empowered to take to the next level the pharmacy education and the profession. As we heard yesterday also in the speech from Dr. Jain, he said the teachers can definitely shape the future of this profession and the future of the industry. So this is a very important message he gave to all of us. And when we talk of empowerment, immediately the mind will come to you is telling that I should be given powers to spend money. I should be given powers to change regulation. I should be given power to change the syllabus. I think people all think when we talk of empowerment, they all think that these are the things which bring about the change. That if somebody, let us say, gives you financial autonomy to even spend crores of rupees in your institution, what will you do with that without knowing how to spend and what for spend and what outcome is going to come with that? Even if all the power is vested to you to change the syllabus, curriculum and all that, do you know really what you want in it? Or we are just going to look around a few other places, copy something from here, copy something there and put it. When we talk of, say, empowerment to take decisions, be it regulatory or otherwise, are we capable of being responsible and take forward the efforts which we are talking? So that's why I have put the caption, with great power comes great creativity. So if you have to have the power, you have to be creative to that level. Usually you have heard with great power comes great responsibility. But I just tweaked it to make it to creativity, because unless you are not creative with the power which is given to you, I think you are just going to be there and just trying to give a like a mashup song or mashup some picture or a collage of pictures you'll make and give it. It does not become a real picture or an artistic picture. Moving on, pharmacy education at 75 is what I have put here. Like we are 75 years since independence, even the pharmacy profession in India. So we are celebrating the Amrit Mahotsav across the country of our independence. Same way, if you look at pharmacy education, we also are 75 years old now if you take after the independence. Before that, yes, historically, there were many there. So I just tried to map how do we stand in this pharmacy education. Like when we look at 75 years ago, in 1947, we had just few institutions, not many were, as I can see, there were about 3 institutions is what my data could show in 1947. Now we have got 3,680 institutions and another 1,700 applications are in the pipeline to start new colleges. So you can see, what do we call this? Exponential growth? Is it good or is it cancerous growth? We don't know. So let us analyze and take it further. If you look at it, what were the number of pharmacy teachers in 1947? We are just handful. 3 institutions, maybe 5 or 7 in each. So 20, 25 teachers would have been there. Now we are talking of 79,000 teachers in these 3,000 institutions. If you look at the industry-oriented pharmacy education, which was there, we have brought about in this 21st century shift towards clinical-oriented pharmacy education. Little bit we have moved towards that. So that's a big step we have taken. Now, if you look at the pharmaceutical industry, it was just 10 crores, like even Dr. Jain told yesterday. But today we are talking of 3 lakh crores. So how much growth has taken place? From a few pharmacy shops and chemists that were there existing, today they are telling there are about 1 million pharmacies across the country in different places. The Chemists and Drugs Association is telling at 1 million pharmacies are there across the country. Now, if you look at from a few handful pharmacists that were registered in various councils at that time, today we are talking of 1.25 million pharmacists, and this number is growing every year. So we have grown very phenomenally in the last 75 years. So definitely pharmacy profession has grown. Whereas the challenge is steering the profession in the right direction. So that is where our challenge comes. The growth has taken place, but steering this growth to get the outcomes which we want has been our challenge. This has happened because nobody was prepared that this type of growth will take place. When I joined the pharmacy education in 1982, hardly there were hundreds of colleges across the country, and there were very few private colleges in 1982 when I joined as a lecturer. Then came 90s and 2000. So suddenly this became in the 1,000 number. So 1,000 number was looking big. 1,000 pharmacy institutions, how are we going to manage? So it was a challenge even for the system, for the teachers, for the regulators, how to manage, how to approve these institutions, how to sustain quality. So everybody decided what is good and they started doing that. But ultimately that had led to a growth which is not so good in many places, but in several places it is very good also. So it has happened. So it is for us as leaders to see how we can steer it to the right direction. When we talk of empowerment, I told you it's not about financial empowerment or regulatory empowerment or the other things that matter. Now, these teachers also, they were having the power. But what was that power they had? They made the direction of the pharmacy profession to go. Let us say you would take Dr. Harkishan Singh. He was the person who talked about National Institute and see that it happened. He struggled for it for nearly 3 decades. But then National Institute of Pharmacy Education did come. Or if you look at Dr. Balla, I think he was the one who was talking about cutting edge research and talked about drug delivery systems and other things which we are looking in 90s as a big issue. I mean, a big research breakthrough which were there, and we were talking and trying to take pictures with Dr. Balla to know that here is our leader who is trying to take us in that research. So what power and regulatory powers they had? They didn't have any financial power or regulatory power, but they did bring a change in the field which we are doing. Now, if you look at Dr. Dandia, he had a very clear vision that our pharmacy profession should be considered almost equal to the medical profession. So he's very clear. So he even became a professor of pharmacology in a medical college to teach medical students. So that is the type of change he brought in his own way and doing it. If you look at Dr. Tipnis, again, the Bombay College of Pharmacy and making it as a milestone in the country as one of the very good institutes, he played an enormous role in the field. So these were all teachers, but they didn't have regulatory power, they didn't have financial power. They worked in the same framework as we are, but they're able to do forward. Now, if you move forward, these are the newer generation of teachers. Means not new, but they are a very old generation also. But they all had their own image or impact which he could bring. Like Professor Kokate, he could establish that a pharmacy teacher could become a vice chancellor. So I think that's where the whole thing started changing, that pharmacy teacher can become a vice chancellor. So Kokate established that. Similarly, if you look at Professor Chinnaswamy, he led a different direction for all the associations. He became very aggressive in every association he was associated, whether it's APTI, whether it was IPA, IPC, wherever he was there, he became very aggressive. He told this is how it has to go. And he built what you call as communities around him. He built leaders around him so they can take forward the message like that. Similarly, teachers like Professor Desai and Karvekar, they have created several other leaders in the process of their growth. So I'm just trying to tell what made these teachers, what empowerment they had. These are the 5 things they had. That is commitment to profession. They were student centric. They were always concerned about students' welfare. They wanted students to succeed, not they should succeed. Students should succeed. Then they were ethical in whatever they did. They were ethical and they were research driven. And lastly, they had that quest for knowledge that I should learn more, I should do more, I should act more. So this was that they were never satisfied. Okay, I've achieved this. I become lecturer, so fine. I become assistant professor, fine. I become professor, fine. I became principal, fine. I became PCI inspector, okay. My goal is achieved in life. I mean, that was not their level of thinking. They were looking at global vision. They looked at national vision. They didn't think about themselves. They were thinking about the profession. They were thinking about the society. They were thinking about the image of the profession across the world. So these are the efforts they put, these teachers, and that's what made them empowered teachers, I would say, that how they became. So let us see how, whether you are a senior teacher already retired like me and looking at how we can bring about a change, or you are a mid-level teacher still in service but in a leadership position and you want to do something, or you are a young teacher who has entered and looking at what change I have done, have I taken the right decision to get into academia, or it may be the young students who may be thinking, should I take teaching as a profession or not? I don't know, there is no salary here, there is no problem here. So these type of issues are there in everyone's mind. So let me take you through this journey, that these 5 traits, if you take, how you will move forward in your life, and this empowerment can make you do the difference for yourself and for the profession which we have chosen to be there. Now, if you look at these 5 forces which I call that empower academia, as I said, a committed teacher. That is, you should become teacher by choice, not because of chance or convenience. Okay, the college is near my house, so let me become a teacher. I can come and go home daily. If that is the case, then there will be no commitment. You should become, okay, I love teaching. I want to be there. So you should be a teacher by choice. I think that you should keep up in your mind. Even if you adopted teaching profession because of compulsion, but now you tell it is my choice. Like in 1982, when I joined as a lecturer, it was teaching by choice. I could have gone to industry. I could have gone to regulatory, because I felt when I was studying, my education was not delivered in the way I should have learned. So I said, let me, if I do something in the teaching profession, and if I am there, I'll bring about a change. And that's how I started. And when I established a small diploma college, it was there at Ooty. I started my career there. I said, how can I make this even diploma college become equivalent to degree? So I started putting the infrastructure. Then we looked at how do we run a college, what type of facility should be there, how we should be comparable to other institutions across, how we should be comparable to the other professions. So it led to the journey. It took 40 years, but I am proud of what the institutions stand for today. In these 40 years I have contributed. Now, if you look at student-centric, the very fact, if you go somewhere and if students throng you and they want to take picture with you, I'm not talking of general, even your own students, I'm telling you, if they come to you, they are excited to meet you. Like we keep meeting alumni here. Sir, I was student of this batch. I was student of that batch. It shows that how much concern you had for the students that he wants to come back and connect with you. If the student sees you and he goes away, that means you're not really connected with the student. You're not worried about student's future. So why should he bother about you? It's simple as that. So if you had been concerned about the student, he will come back to you and he'll come and say, sir, how can I help you? That's empowerment. He may be a regulator somewhere, or he may be in industry. He may say, okay, I'll bring a HPLC to your company from my company, sir. It is there to your company. You do your research. So it is, all this is possible. It's definitely, if you're student centric, it's a great empowerment for all of you. And they catalyze young minds. You give dreams to the students. And these students, when they go back, they remember that this dream you made me realize. And so that's why I'm successful today. And if you look at regulatory support and ethics, I'm not talking of going in approving or disapproving, not that. I'm telling you, set the standards around you. That's what I mean by regulatory control. These standards, we will comply. And you start complying these standards, people will start following that standards automatically. I can just again give one small example. Like in way back in 1988, there was a subject, even now it is there. It is the instrumental analysis for pharmaceuticals, pharmaceutical instrumental analysis. So we had trained the students to use colorimeter, spectrophotometer, pH meter, conductivity meter, all those things. And even polarography we did in 1988 to train them. And the examiner came and told, no, let them do some titration. That's enough. I will not tell the name of the teacher. He was a great teacher. He's a very great teacher even now. He's in 90s now. But I told him, sir, I have trained my students to do this. So you should allow them to do that experiment. Why are you telling them to do a titration experiment? Then what is the use of having instrumental analysis? Then he said, okay, if they fail, don't blame me. I said, I am not worried about their failure. I am worried about their knowledge, and you assess that knowledge. And then we divided, and the first time we converted that, even that teacher realized that by giving group experiments, he can evaluate, and instrumental analysis was successfully conducted. So the idea is that you have to set standards what you want to give to the students and to the society. Then it can become a regulation, it becomes a policy and takes it further. You have to have an unwavering commitment to build an organization ethically. So many things we can do unethically, we can do it. But if you have this endurance that no, we will do this ethically. Even if I have to wait 1 year, let me wait, I will do it. So then what happens is things will move further in the way you are looking at. Then next you look at, you have to be research driven. I am not talking research means only by publication and patents. There are research even how to teach, how to deliver education, what is happening. So research can be in any field. So research driven you should be there. And lastly, you have to have an unsatiable desire to keep learning, keep learning, keep learning. How much I can learn every day extra. It may be in different fields, it may be in different things, but unless you keep learning, you become saturated and then you start losing concentration, and there the empowerment loss. Because the most important thing which the government, which the industry, even your own managements cannot ignore will be your knowledge. If you are knowledgeable, nobody can throw you out. If you are just an administrator or you're just a teacher, then they say, okay, if I not that, I'll get somebody else. What is there? There's no greed. But if you are knowledgeable and you are known for your what you are standing for, I think nobody can afford to send you out. And they will say, even if you want to go, they will find ways to retain you and try to see that how you can be useful to the service. So I think these are some things we as teachers have to have, and these build indirectly into our leadership qualities and other things which I keep talking quite frequently. Now let us look at one by one these, but I will not take too much time so that I don't want to encroach into our next speaker's time here. So as I said, you should become a teacher by choice. So if you have taken just by chance or convenience, please change your mind and say that, no, I have become by choice, and try to see how you can shape yourself and do it. I can tell here, I have in the audience who was once a teacher, then he went to become a regulator, and now he has come back to become a teacher with us. So ultimately, it is what you want to do. So he could have gone to many places. He could have gone to become a consultant in industry or so many things, but he came back, no, said, I would like to get back to the teaching. I want to be there. So it is teaching by choice, not by convenience or chance or something. So I think this is something is what I was trying to tell. Now, for that, to be a committed teacher, you have to build these qualities in you. Leadership, because I said, if you keep waiting for somebody else to come and do the work for you, then you will wait there only. If you are a leader, you will try to work for yourself, see how you can bring about the change. That's what we talk about. Looking into the future. Don't look only at today, the problems, the syllabus does not have, this chemistry molecule is not there. This is not there. In pharmacognosy, they have left 2 drugs which are very important. In pharmacology, this chapter is, this experiment is not included. We all get focused into these small things. We don't look where the future is, what the future pharmacy profession needs. How do we get into that? What is the expectation of the industry? Where the world is moving? Now, let us say if this challenge was put to the pharmacy colleges, I say the drug discovery hackathon was made by the government of India. I send out that circular to almost all the institutions. We could persuade only a few of them to participate. Why? Is it the lack of confidence? Is it the lack of tools? Is it the lack of knowledge? Why we could not rise and do the performance? So this comes back to that because we never prepared ourselves to look into the future where the government will ask us to discover a drug. So we thought, that CDRI is there, CSIR labs are there, they'll be doing this, we need not do this. So I think you have to have the capacity. Let us say the government has now put out a challenge. Anybody who is willing to develop vaccines and other forms for monkeypox, they are ready to give money. Now, how many of our pharmacy institutions in the country will be able to take up this challenge and work? I mean, in collaboration with other institutes. I'm not talking independently. So I think this type of thing, we have to look into future and be ready for that. Then we have to have an international outlook that where the world is moving and are we comparable to them, whether it's in education, whether it is knowledge, whether it is quality, how our students will be able to fit into if they go and look at careers abroad, how will they find their places? I think this is something we have to look at. Then we have to inspire excellence, never accept mediocrity. If you build some chalta hai in your own institution where you are leading, then everybody will follow chalta hai. If you say, no, I am going to work with you, but let us do it the best. So then that automatically it becomes the culture in the organization that we will try to do the best and not be able to do it. And lastly, expand the horizons of the students. Don't let the students look only at the pharmaceutical industry, that okay, analysis, QA, regulatory. Ask them to look beyond. See what other fields they can go in, how they can shine in those fields. What are those fields that can easily our pharmacy students be able to take further? So I think these are some things we have to keep learning. Let us say now artificial intelligence. Now, how are we going to use this tool for our own different pharmacy educational needs or pharmacy research needs or teaching needs? How are we going to use it? So unless you don't expand the horizon of the students, how they will be the teachers of the future? How they will be teaching artificial intelligence to the next generation students? They will also then what happens is when they become board of studies member or chairman of the board, if there is artificial intelligence, they will delete it because who will teach? There is nobody in our field, they'll delete it from the syllabus. So ultimately, our level will remain there wherever we are. And if you look at the last one bad habit we all have is we don't believe in collaborating. Because we feel if we collaborate, then our knowledge will be taken away by somebody else. So he will become better. I always say is that if somebody has to shine, somebody has to become better, whether you help or not, he is going to achieve it. So why not you be the catalyst for making him that? At least he'll remember you. It is because of this I have become this success person. So collaboration is very, very important between institutions, between individuals, between organizations, with industry. I think these are the things. Now, how can teachers achieve this? Is by developing leadership qualities. Connect with your peers, whoever is there in the field. Don't run away. Be there, meet them, talk to them, find out what made them so success in their life. So it's very important. Then travel overseas. I am sure there are enough funds available. Only thing is you have to have the mind to reach out and travel overseas and get that exposure. And provide only the best to the students. You may take extra 1 hour to prepare and go, but provide only the best to the students. Take students beyond the classroom experience. Quite often, we limit them to the classroom and tell them, okay, this is the syllabus, this is the PPT, you read and come for the examination. But when does he really see what is happening in the industry? When does he see the real, say, injection filling machine working? So I think you have to go beyond the classroom and make them feel these experiences and work closely with those who are best in the field. See, quite often what happens is we try to work for convenience sake. Oh, I know this institution, so let me work with it. It is easy to collaborate. But you should try to see how we can achieve by collaborating with some big institution, which normally it's not so easy to go there and collaborate. I think this is something you have to evolve this. So this is the biggest empowerment which you can do to first do it, to be a committed teacher. Now, next is catalyzing young minds, how to make the students achieve their path or reach their growth. Now, you have to have student at the center of the education. We always look at education as not the something for the student. We look at it education as a organization, or it is a mandate, and we have to do regulatory compliance. We have to fulfill the syllabus. We have to do this. We have to do that. We look at that. We never look. The primary objective of education is the student, because if the students are not there, teachers are not there, institutions are not there. So always we should keep that in mind, student at the center of the education. And what are the aspirations and expectations of students? What is, you have to empower them, like I am talking about, you empower them, don't enable them. Give them the dreams, let them work out how to achieve it. We don't have to go and tell them, you do this and try to succeed. Then you have to be able to bring everybody in, diversity, equality, and inclusivity. Like, you know, we talk of gender discrimination, racial discrimination, and all these things are there. I think that's what, these are all the terms of past. Now, everything is possible by everyone. We have to work on that. Lifelong learning should be a way of something to be inculcated in the students. And ethics and value system. If we build ethics and value system, when they become teachers, they also will talk about ethics and value system. If we teach them shortcuts, okay, don't worry, we'll manage the examination, we'll manage this, then they will also go out and manage. And that's why they fail in the industry. Because they try to manage something and the industry throws them out, because industry does not thrive on managing. They work on accuracy and counseling and mentoring them. And these are the ways which we can use the strategies. This PowerPoint will be available, so I'll not dwell more into it. So I will ask the organizers to mail to all the registered delegates so that they can have an access to the information which is there. Next one is regulatory support and ethics. As I said, setting standards, that's what I mean by regulatory support, not by looking at the other powers which come with the position which is there. Now for that, you have to look at, always a teacher has this eternal dilemma of ethics and regulatory compliance. Okay, we have to fill the Pharmacy Council's inspection form. We have to fill the UGC's inspection, SIF. So what type of information should I provide? Because if I don't provide this information, my approval will be affected. So there is always an ethical dilemma is there. So what I suggest is we as teachers should prepare for ourselves before. Okay, we are going to have a approval in the next year. So we have to start our work earlier and tell them if we don't have this, we may lose our approval. So better let us have the staff. Better let us have these things in our place. Then don't blame me later on that why this happened to us. Then every organization, whether it is management or whether it's industry, they'll be ready to work with you and they will be able to do it. Then sometimes you have to take forced decisions, which may not be your choice, but because of the compulsion which the organization is putting on you, the compulsion which the regulatory requirements, forced decisions are one of the major challenges which you feel. Then academic freedom, intellectual integrity, and fair and respectful treatment of others. These are the major problems which again the teachers feel. Non-discrimination and fair evaluation is another challenge, which is the thing we are always looking at. And managing conflict of interest. What should I do? This is not right. How do I do it? So this is always a dilemma which all teachers exert. So for that, what I have to tell is, we have to get out of this dilemma, to be or not to be. And if you want to be, then try to be the perfect teacher and move forward. If not to be, let's get out and let's do something which we can satisfyingly do without doing injustice to the our minds. Why I am telling is, I always remind myself right from that day that if I have to leave this job, what I have to carry with me, that's all. I always remember that, okay, in this chamber, all these properties belongs to the institution. I don't have to carry. Only this laptop is mine. I'll take this laptop and go home. So once your mind is clear, and if your knowledge is there, and you have the confidence in you, don't have to worry about other things. Only when we do not have this is a challenge. So I think we have to equip ourselves to become that confident with knowledge, with the type of person we are. Then nobody can afford to throw you out. Nobody can do anything. If the question is that how strong we are in our effort, then people cannot ignore you. I can write and tell you that. I have seen this happening many times. If you are strong enough, people cannot ignore you. Only when they find there is little weakness in you, they start exploiting the weakness. And teachers will have to inculcate values and teach those to the students. Resilience is the only way. These challenges are there. So, but we should not run away from them and try to accept. So how we can resist, how we can maneuver around it, still try to do the right thing. I think these are all things which will come with experience. I think you have to look into it. And we ourselves should have a strict no tolerance policy for plagiarism. I think the major problem with now teaching community is whether it's research or whether it is writing publication books or everything, plagiarism is a bigger challenge which is there. I think we have to have no tolerance for that, and malpractices should be removed completely in our system. Whether it is there, we should not be a part of such a activity is what I would like to say. So these are all the ethics which are there. Now, when we talk of research, we always work at a very snail pace. I know if I ask the teachers here, how many of them are guiding projects relating to medicinal plants? I'm sure at least 60% of the audience will raise the hand. But is the industry working on medicinal plants? Is the world looking for drugs in medicinal plants? Is the stakeholder, that is the user of the medicine, is he looking at medicinal plants? When all these people are not looking, then why are we doing it? Because it is convenient, it is easy to pull one plant, extract and do some study in animal and give a report. Then how do we achieve this? I think if the industry is looking at biologicals, we have to look at how to handle that. There are today, let us say bioinformatics. There are so many free tools available online. We have to search, we have to learn, use those tools and train the students to use these tools to move forward. So I think we should try to get away from that fixed mindset. Let us do something and be done with that. So again, there are, these things are there, research surge, publication pride, patent possession, that, oh, I have made 4 patents, that's patents. But are those patents worth anything? It is good for NIRF, I agree, it is good for NAC, it is good for NBA. But if the objective is only to make patent for NIRF and this thing, then you are defeating the whole purpose of innovation which you want to do. Incidentally, it should be for NIRF and NBA and NAC. It should not be only for the NIRF, NBA and NAC, the patents. So we defeat our own purpose by putting something which cannot be used for anything just because of not being included in something and make a patent. I think it loses the thing. Similarly, consultancy culture, of course, it's a big challenge, and resource optimization. Again, I'm putting those lists which can be done or taken by the teachers. So I will not dwell on it again because of not taking into the time. Now, lastly is knowledge enrichment, which I feel is a very, very important thing for teacher. A teacher is known only by his knowledge. I'll very specifically and clearly tell. Without knowledge, teacher is of no value to anybody. And for that, my thing is, first I have learned in many ways is, you should be master in your subject. People should know you for that. If you are not master in that subject, whichever subject you are teaching, then it is fine. If you are not master in that, some book we are reading and trying to teach, then I think that's not going to help. Then technology. Today, technology is going to play a major role. So how many of you are tech savvy to use the tools for teaching, tools for understanding, tools for reading other things? Growth mindset. We should always have a growth mindset for ourselves and for the institution and for the students. How we can continue to grow, how we can try to achieve something in life better. Strategic design. So you keep a path for yourself where you would like to move in knowledge. So can you create what I call as a personalized learning cloud? You create your own repository in your mind or in the computer or even in the cloud space, which you continue to access always for your own resources. So now, like personalized medicine, now we have gone to the stage of personalized learning cloud. You create between a group of few of you can create a personalized learning cloud. And in that personalized learning cloud, you keep putting inputs, whatever you are doing. So you'll learn and share with each other and try to better your knowledge further and further. And lastly, competitive advantage. We always like to see how we are and try to shine and outshine ourselves, set our next benchmark very high and move forward. I think these are all the things which are required. And we have to move from learning to plan, like how to plan a lecture, how to plan. Now we have to move from planning to learn. I think you have to keep planning how I'm going to learn more. I think that's where something which you will have to look at. Lastly, the connected academics is the way forward. Like in these type of conferences, we come, we try to meet people, we try to understand, we connect with each other. Unless we don't connect with each other and we don't try to understand the progress, I think we cannot either grow ourselves, our institution, or the profession. So, and that has been my great asset till today. Wherever I go, I connect with the people, connect with the students, connect with the big organizations. He may be a top MD or CEO of the company, or it may be a technician in the industry. I'll talk to him nicely, try to find out what he is doing, learn from him. So that's the way I have been able to gain my knowledge and be able to move forward. So for that, you have to connect with everything. Don't think, oh, it's engineering, it has got nothing to do with me. Oh, it is about life sciences, it's nothing to do with me. Even there, you will be able to explore and try to learn something there. Then you have to connect everywhere, all kind of networks. So you go to CII meeting, go to a SHM meeting, go to the industry meetings, try to see what they are doing. Don't go only to the pharmaceutical industry meetings. Go to the other fields, what they are thinking, how the finance companies are thinking. Go to a ICFI meeting, find out what they are doing. So I think these type of opportunities you have to do it and connect everywhere. There is professional organization, regulatory bodies, governments, and remains connected. If you meet one, shake hands and go away, forget. You have to send a mail to him afterwards. You WhatsApp him one day after 1 week later. Ask him when are you going to come this side again, I want to talk to you. So remain connected. Only if you remain connected, he will remember and he'll come back to you and try to tell you how to move forward. And lastly, you should be connected for life. That means must meet the needs of the stakeholder for life. Like whether it's a student, you have to be connected with him for life. You should not think my job is over. I have completed my teaching. I have given, he has got his degree. So what I have got, it's not a problem. Suppose if he comes back to you, sir, I have got a problem. So whether you will be able to guide him and counsel him. So that is what I mean by connecting for life. It may be a teacher. He might have worked with you. He might have left your college and gone to another institution. And he comes back to you, sir, I have got this problem. Can you guide me? There are two ways. You can say, you get out, man. I told you to stay back. You didn't stay back here. And why should I help you? Instead of that, come, tell me what's your problem. Then he will realize, oh, here is a leader which I ignored. I should have not done this. I should have listened to him and continued my life would have been better. So I think this is where we mean when we connect with people, it should be connection for life. So many people will retire. Like yesterday also, I found my teachers coming here. So I was connected with them. Why they come? They love me and I love them. So it's a question of connecting with each other and we are able to maintain that respect for each other and be able to do it. So I think for this, we have to encourage all of you to go beyond your domain. Don't look only at the narrow spaces where we have made compartments. And for this, the learning culture helps. Keep learning. That's what I would like to say. Thank you very much.
So good morning to all the delegates.
first of all, I think we should give standing ovation to Dr. B. Suresh for his excellent opening lecture, because from morning, yesterday he was the night's watchman and he was the last batsman, and today he was the opening batsman, and as already has promised, the hall was half when he brought a lot of delegate students, and majority are volunteers only this side, but then the hall is full now, and the second lecture, you should be thankful to Dr. B. Suresh for filling the hall. So he started, Dr. Suresh, 1947, the journey from 1947 to up to 2022, that till today. And from now there are about 3,700 institutions, 80,000 teachers, and we are only 1% here. And from industry-oriented education, now it is pharmacy, clinical-oriented education. We started manufacturing before independence, about 10 crores, and now it has crossed 3 lakh crores worth of pharmaceuticals, biotechnologicals, nutraceuticals. As yesterday, our Diane keynote speaker, he told that now there are more than 1 million pharmacies, and also he mentioned about the like earlier teachers, they should be, our aim should be student centric, and he has stressed about the ethical principles, and research driven guideline and knowledge quest, and he has mentioned and told to empower this whatever this team, empowering academy for advancing pharmacy education. 5 forces are there: their knowledge and power, channelizing the resources, standard and self-regulation, and catalyzing the student power shifts towards, and also we are teacher by choice, and how important is collaboration and also experimentation, looking for the future, and the inspire and extend, and also initiate thought processing, and taking students and making them beyond classroom and empowering them, and also expression, good expression, and also empowering the students with the diversity, equity, inclusivity, and as all we teachers, for us it is lifelong learning, and we should be counseling the students very constantly. And also he brought to the notice about the social service, NSC activities, and for the students' career goals, how important it is. He has stressed upon this, and also how important this regulatory support, ethics, ethical challenges, academic freedom, and also the completion, inclusivity, and also the various, the importance of preventing plagiarism, avoiding malpractice, copying, and all these things, how important they are, and the teachers, how they should see that the students are morally and they are independent without plagiarism and all that. And also the research driven, how important, because even Dr. Harikishan, he told that as pharmacy teachers, it is not only teaching, research should be hand in hand, and he has stressed about that. And also the how important are publications, patents, consultancy, then also the various other resource mobilization, how important are the innovation, and how important are research grants, and also conducive environment. And he finally concluded that we have to, as teachers, besides learning to plan, planning to learn, how important it is. And also he has stressed upon the good teaching and of the growth, and also with about the connectivity as well as the progress and learning culture and connected for the life. The inspire, like, because our motto should be inspired by life, and for the future, how this pharmacy education is important. And for the next 50 years, he has given a plan. And we should be very grateful to Dr. B. Suresh for this JSS memorial lecture. And I thank all of you for this patient listening. And this has for this particularly for this year's our APTICON conference. He has given a very good theme as well as very good keynote address. And definitely for the next whatever the future, our APTICON, he has given a path, and let us see that all his dreams are executed, and we are all with him, Dr. B. Suresh. Though we have retired, but still we will be having, we have regenerated today. And for his great lecture, we are very grateful, and I thank all of you, and also giving organizing committee for chairing this particular lecture. Actually, chairing Dr. B. Suresh, though several, because I invited him to Manipal also for endowment lecture and many other activities as chief guest and other things. But he honored me, and also through the organizing committee. Actually, 1 month back, though I wanted to come, I told spot registration, and also I have decided the other world or any other this, I will not attend any conference by paying, but only I should be called as guest of honor or as a complimentary registration. So he fulfilled this, and I am grateful to Dr. B. Suresh, organizing committee, Dr. Pramod, and all of you for giving this opportunity. And I have decided that I am every year attending this teachers conference, and let us all attend till our death. We should attend as pharmacy teachers. We should die working as teachers. So thanks a lot, and once again I congratulate Dr. B. Suresh and congratulate JSS University for excellent arrangements and all these things. Thank you very much. Thank you.
Thank you, sir. I now request the chair and the co-chair to honor the speaker by presenting the memento. Thank you, sir. I invite Dr. Salimullah Khan, Principal, PA College of Pharmacy, Mangalore, to present the mementos for the chair and co-chair. Please, sir.
Okay.
Now moving with the second lecture of the day, it's SP Srivatsava Memorial Lecture. The lecture will be delivered by Dr. Sanjay K. Jain, Professor, Department of Pharmaceutical Sciences, Dr. Hari Singh Gaur, Central University, Sagar. The session will be chaired by Dr. Milinjay Umekar, President APTI, and co-chaired by Dr. G. K. Rao, Principal, Goa College of Pharmacy. I invite the chair and co-chair to take out the dais.
ಒಂದು ನಿಮಿಷ ಹೇಳ್ತೀನಿ. आपका है अभी?
I request the chair and co-chair to start the session.
Good morning to all. Today's session began by the Professor Sanjay K. Jain. He is a professor of pharmaceutics in the Department of Pharmaceutical Sciences at Dr. Hari Singh Gaur, Central University, Sagar. He is the President Director, Planning and Resource Generation of the University and Chairman, Council for the Industry and Higher Education Collaboration and Chairman of University IPR Cell. He is the former HOD of Pharmaceutical Sciences and former Dean of School of Engineering and Technology at Dr. H.S. Gaur, Vishwavidyalaya, Sagar, MP. Sir have total 33 years of experience and he's around 195 research publication with the H index 68 and I index 309 with the 18,000 citation index. Sir has received many awards, mainly the National Teacher Excellence Award in 2012 by Honorable Governor of Madhya Pradesh, the Pharma Recognition Award by Pharmalok and Nirali Publications. Sir guided around 27 PhD students and more than 150 students. And sir completed 8 major research projects funded by the various national agencies. So I request Dr. Sanjay Jain sir to please deliver his session.
Thank you. Is it okay? Hello.
Thank you, Dr. Ambedkar, for giving a brief introduction of my 33 years service. Before I start my this deliberations, first of all, I would like to thank Professor V. Suresh for inviting me and giving me a chance to share my views, especially share my experience of 33 years of research. When I received an invitation from Professor Suresh, then I was thinking, because he has given me freedom, you select your own topic for deliberation. So he is giving me freedom, so that wise I was a little bit relaxed. And when I actually, it is difficult to say anything after the deliberation of B. Suresh, but I will try to give something different, because it is not related with the education, but it is related with the research. And the research on which I received Visitors Award by Honorable President of India, Shri Ramnath Ji Kovind, on 2nd May 2018. And this is the gist of my research on which I received the President Award. Actually, I am working on the field of developing drug delivery systems for delivering drugs to those organs of the body where the delivering of the drug is difficult. Especially the delivering drug to the colon. Colon is, is the last part of the gastrointestinal tract. It is not simply take a pill and it will deliver effective concentration to the last part of the colon, because when you take a pill from the oral route, it will get, most of the drug will get absorbed from the upper part of the GIT. Very little amount of the drug will reach to the colon. So it is a difficult task, and for the treatment of the diseases associated with the colon is very difficult, because either drug will be delivered to the colon after getting the absorption from the upper part of the GIT, then it will go to the systemic circulation, and from systemic circulation it will be delivered to the colon. Or if you want to deliver effective concentration of the drug to the colon, you are required to increase the dose of the drug, oral dose of the drug, so that some of the drug will be remaining unabsorbed and will reach to the colon. So these are the ways, and if we use these ways, these are the conventional way of delivering the drug to the colon. And if you use these ways, that will lead to increase the toxicity of the drug, side effect of the drug, and cost of the drug delivery system is increased. Say where we are working, right? Say we are working at T0 level. At the research institute, we are working at the T0 level, right? So here is the way, what we do, that is the basic research. And nowadays, how will you transfer, as Professor B. Suresh very rightly said, how will you transfer your research to the community? It is not, because we are working many years on for the development of any product or any pharmaceutical product, and after say developing many products, we get success, only one or two products successful. So that is why it's a really very hard work. And after getting the successful product, after getting approval from the clinical studies, we will we transfer it to the clinical studies, that is the T1, T2, T3. Only then product will come into the property. If we get the success at level 2, T2 or T3, then it will be transferred to the community. That will be beneficial for the community. So we are working at this level, at T0 level, and here for getting the good product, for getting a pharmaceutical product that is beneficial to the community, then you should have, being the research scientist or being the pharmaceutical science, you should have experience of biology, you should have experience of the material science, you should have knowledge of the chemistry, you should only then you can get a pharmaceutical products. Because it's by these integrated knowledge, only you will be able to develop a successful product. So these are the challenges which we face during the development of drug delivery systems. First of all, that is the most prominent challenge, that is the prevention of drug from biological degradation. It's really a difficult task because after getting the drug molecule will be the foreign molecules, it will be thrown out from the body by the body protection action. So a drug may degrade during the path of reaching to the target site. And next challenge will be the product life extension, that is related with the shelf life of the product, because it is directly related with the cost of the products. So this is another challenge. Then maximize drug utilization. This is after taking the drug, say if you take the drug, say 500 milligram drug, and after taking the 500 milligram drug, only say few microgram or nanogram drug is utilized, remaining drug will be the wastage. So if you develop such delivery system which will utilize the completely, the whatever you have administered, if you utilize the complete drug, then that will be the most promising drug delivery system. Then this you can achieve by effective targeting. The maximum utilization you can achieve by effective targeting. Effective targeting means whatever, where you want to deliver drug, it will reach to that target. Then patient compliance. This is the most important factor, because we are developing drug delivery system for the patient, for the treatment of particular disease, for getting relief from the disease. So the patient compliance is important one. And lastly, the cost effectiveness, that whatever product you develop, it should be the cheaper one. Being the Indian citizen, we know that the treatment of any disease is a very costly affair. So we must have to develop such delivery system which is cost effective one. This is figure you might have seen in most of the textbook of biopharmaceutics. And here it is how it will gauge the onset of action, how much time it will remain through biological system. But being the pharmacy scientist, your intention is to keep drug concentration in this therapeutic window. Therapeutic window means the drug concentration above the effective minimum effective concentration and below the maximum safe level. So the being the formulation development scientist, you must have to keep drug concentration in this therapeutic window, right? And you have to develop such delivery system which will keep drug concentration in this therapeutic window for a longer period of time. And this, whatever delivery system you will develop, it should immediately cross the minimum effective concentration. Minimum effective, if the drug concentration in the biological system crosses the minimum effective concentration, you will get first onset of action. So our intention is to keep drug concentration in this therapeutic window, and drug should deliver immediately to this therapeutic window. This is what targeting, as you know, you are aware about that targeting is select and effective localization of drug to the vicinity of target organ. Target organ means the disease organs. And why targeting is required? Because for exclusive delivery to specific pre-identify organs of the body, reducing drug access by other irrelevant non-target cells, reduces drug toxicity, because whatever drug we deliver, it will deliver to the target organ. It will not be delivered to the irrelevant organs. Maximize intrinsic activity of the drug. So now come to back for the development of colon targeting drug delivery systems. As I told you, you should have knowledge of the biology, you should have knowledge of material science, you should have knowledge of chemistry. If you have knowledge of all these three science, then you can easily develop a delivery system. You can manipulate with the materials, and you can develop a new drug delivery system or effective drug delivery system. So as you know, colon is the last part of the intestine, gastrointestine. It extends from ileocecal junction to the anus, and lower part is that is rectum, 5 inches, and it is having many layers. If you see the colonic membrane, it is totally different from the gastrointestinal membrane of the upper intestine, that is the stomach or small intestine. It is having mucosal layers, some mucosal layers, circular muscular layer, longitudinal muscular layer, and serosa. So that is a long, there is a number of layers. If you want to deliver drug to the systemic circulation from the colon, it's a long way. The colon is the potential site for the drug delivery. Why it is the potential site for the drug delivery? Because it has low hostile environment. Because if you see the environment of stomach or small intestine, it is full of a lot of change in the pH, lot of enzymes are released, and it's the most prominent organ of the body where the meal or diet content are digested. So it's having no hostile environment. Colon is a low hostile environment. Long colonic transit time means if you want to deliver drug to the colon, and if you want to play with the drug delivery system in the colon, then this is the most prominent factor, that the drug things will remain in the colon for a longer period of time, so we can play with it. Unique microflora, and when we see in our next slide, the colon is having the unique microbial flora. It's a number of microorganisms. Our colon or large intestine is full of microorganisms. If you compare with the microorganisms present in the upper part of the GIT, then you will find that only few microorganisms present in the upper part of GIT, but colon is full of microorganisms, and the release of the enzyme from these microorganisms can be used for triggering the drug release from the developed colon specific drug delivery system. highly responsive to absorption enhancers. The colonic membrane, as I told, it is having the number of the muscular layers. So crossing this colon membrane is difficult task. And this colon targeting, delivering drug to the colon, we can achieve either by through the oral route or through the rectal route. So administration of the drug through the rectal is a difficult task. Most convenient route is the oral administration. So this is the variation in the pH. If you see the pH of the different part of the GIT, then you will find that stomach is having pH 1.5 to 2, and residence time of the stomach is 1 to 3 hours, and the small intestine having lot of variation pH in the pH, that is 4.5 to 5 duodenum, that is the pH of the duodenum, and jejunum having pH 5 to 6.5 and ileum 6 to 7.5. And total residence time is of small intestine 3 to 5 hours. Then the content will reach into the ascending colon, right? And there is a certain drop in the pH from 7.5 to 6.5. That is because of the fermentation of the polysaccharides by the enzymes released by the colonic bacteria. So the polysaccharides, say lactose, is fermented into the lactic acid, and you will, the pH will drop. And then when we go ahead towards the transverse colon or descending colon or sigmoid colon, then you will find that the pH is gradually increasing. It will be reaching to the 8. As I was telling you about the microbial flora, our colon is full of micro. You can see the long list of the microorganisms present, and 30% of the dry weight of the feces consists of microorganisms which are coming from the colon, and only 7 microorganisms are present in the upper part of the IG, that is stomach or small intestine. So you can see that these are all beneficial microorganisms. These are used for digesting the undigested food which is coming into the colon. And if you see the microbial count, then you will find that colon is, as I told you, it's full of microorganisms, 10 to the power 11 or 10 to the power 12 colony forming unit per ml. And if you compare with the microorganisms present in the stomach, it is only 10 to the power 3 colony forming units. So our colon is full of microorganisms. And these microorganisms releases reducing enzyme, hydrolytic, number of reducing enzyme, hydrolytic enzyme, and these enzymes we can use for digesting the material of the drug delivery system which we use for delivering drug to the colon. Metabolic reactions carried by these enzymes, that are hydrolysis, decarboxylation, dehalogenation, acetylation, reduction, dealkylation, emission, or esterification. These reactions are taking place by the bacteria, by the enzymes released by the bacteria. Generally, for the development of the colon-specific drug delivery system, we use azoreductase enzyme, which is released by the azobacter present in the colon. Or polysaccharidase, different polysaccharidase enzymes are released by the colonic bacteria, and these are used for digesting the polysaccharides, or different gums which we use for developing the colon-specific drug delivery system. As I told you, delivering drug from the colon to systemic circulation is very difficult because of presence of number of barriers, the small surface area, specific, non-specific binding with the dietary factor, high viscosity of the colonic content, muscular layer, say, mucus layer that is in the colon, it is having a thick mucus layer, and which retards the reaching the drug to the epithelial surface for the absorption. Unsterile water, that is a special layer present in the colonic membrane, just below the epithelial membrane, that is the unsterile water. This is another barrier for the lipophilic drug. And the colonic membrane is having the colonocyte occluding junction complex, so that paracellular transfer from the colonic membrane is difficult because of there is a limited space between the cells of the colonic membrane and then the epithelial surface, that is a lipophilic nature, so it is another barrier for hydrophilic drug. So if you compare the conventional drug delivery system with the colon targeted drug delivery system, then you will find it's a very well-known example. For the treatment of ambiasis, we used to take metronidazole, and you know the dose of the metronidazole is 500 milligram 3 to 4 times a day. You have to take for 5 days. And you can you imagine that for killing such a teeny amoeba, you will require such a large amount of the drug, that is 1.5 gram to 2 gram per day. And have you ever thought that can we reduce this dose of the metronidazole? Yes, you can reduce the dose of the metronidazole if you incorporate metronidazole in colon-specific drug delivery system. If you deliver metronidazole exclusively to the colon, then you can reduce this, and you can reduce the side, because the metronidazole which we take through the oral route in 500 milligram 3 times a day, it will get absorbed from the upper part of the GIT, then it will reach to the colon through the blood circulation, and drug will be released in the colon. But or some of the unabsorbed metronidazole, because of increasing the dose of the metronidazole, some of the metronidazole will remain unabsorbed and will reach to the colon directly. So if you, for killing the amoeba, if you deliver drug through the colon-specific drug delivery system, then we can reduce the dose, we can reduce the toxicity of the metronidazole. These are the drug candidates which we can use especially for designing the colon-specific drug delivery system or delivering to the colon. Those drugs which are having the poor bioavailability from the upper part of the GIT, like peptidal drugs, or those drugs which are having a deleterious effect on gastric mucosa, like non-steroidal anti-inflammatory drug, that we can deliver through the colon-specific drug delivery system, or especially for the treatment of the diseases associated with the colon. For the treatment of these diseases, you will require to deliver drug in effective concentration to the colon, right? So for the treatment of ambiasis, for the treatment of colon cancer, for the treatment of ulcerative colitis or inflammatory bowel disease, you will require to deliver drug to the colon, right? So developing colon-specific drug delivery system of the drug which are required for the treatment of disease will be the best. Say the sulfasalazine. Sulfasalazine is the prodrug of the 5-aminosalicylic acid, and it is widely used for the treatment of the inflammatory bowel disease, and it is in the skeleton of this prodrug, it is having the azo bond, and that will be exclusively cleaved in the colon, right? So these drugs, sulfasalazine, ipsalazine, valsalazine, are used for topical action for the treatment of inflammatory bowel disease, Crohn's disease, irritable bowel disease. 5-aminosalicylic acid we can use for delivering drug to the colon for the treatment of colorectal cancer. Non-steroidal anti-inflammatory drug we can use. Typhoid insulin we can use. These are the characteristics of the colon-specific drug delivery system that will be exclusively releasing drug to the colon. It will not release drug to the upper part of the GIT. And it increases the colonic mobility of the drug, enhance therapeutic efficacy by localizing drug to the colon, reducing systematic adverse effect by reducing the absorption of drug from the upper part of the intestine, and maximize drug utilization because it will be exclusively delivering drug to the colon, reducing dose of the drug and maximize drug retention time in the colon. These are the different emergent technology which we use for the development of the colon-specific drug delivery system. The prodrug approach, we can use size-dependent drug delivery system. We can develop surface charge depending drug delivery system. We can develop, especially for the treatment of the inflammatory bowel disease. pH-dependent drug delivery system, biodegradable drug delivery system, redox drug delivery system, nanocomposite-based drug delivery system. Dendrivers we can use for the development of colon targeting and time release system, just delaying the release of the drug, say 5 to 6 hours by the time your delivery system will reach into the colon. So first is the prodrug approach. We can use azobon prodrug. Say this is then an example of the sulfasalazine. And it's a prodrug of 5-aminosalicylic acid. They are conjugated with the sulfaparidine with the help of azoaromatic bond. And this azoaromatic bond is closely cleaved in the colon by azoreductase bond. So you get the one molecule of 5-aminosalicylic acid and the sulfaparidine. The toxicity of the sulfaparidine is because of the sulfasalazine, because of this sulfaparidine. So you can replace sulfaparidine with some biologically friendly molecule like amino acids, or the most prominent is the osalazine, where 2 molecules of 5-aminosalicylic acid are conjugated with the help of azobon. So you get the osalazine. This is the glycoside prodrug. So glycosidase enzyme will cleave this prodrug and will get the drug released in the colon only, because these galactosidase enzyme are exclusively released in the colon. Cyclodextrin, as you know, the cyclodextrin is widely used for the development of the just enhancing the solubility of the water insoluble drug by making the inclusion complex. But at the surface of the beta cyclodextrin, if you attach the drug molecule, it will become a colon-specific one. Dextran we can use for the making of the prodrug. And size depending on the delivery system means if you reduce the size, it will increase the residence time. So by entrapping that more drug with the colonic membrane, and we can increase its residence times. And in case of the inflammatory bowel disease, the colonic membrane, both cationic and anionic colon delivery system can be used, or nano delivery system can be used, because both are having the good adhesion property with the colonic membrane. So if you see the adherence power, it will be negatively charged particles are more adherent as compared to the neutral one or positive cationic charge particle. pH dependent is by the variation of the pH we can use for delivering the drug. So if you use polymers which are dissolved at the pH more than 6.5, then you can make delivery of the drug to the colon, because at that pH, by the time the polymer will dissolve, your delivery system will reach into the colon. Biodegradable drug delivery system we can use. The azoreductase and polysaccharide. So we can synthesize polymer, aromatic polymer, or we can have polysaccharides. And these delivery system will be degraded by these azoreductase polymer, adulterated enzyme or polysaccharidase. So this is the copolymer we synthesize using the hemine styrene using the divinyl azobenzene as a cross-linker. So skeleton of the copolymer will be having the azobond, number of azobond, and that azobond will be cleaved by the azodirected enzyme, which is exclusively released in the colon. Pectin we can use as a biodegradable polymer. We develop calcium pectinate microspheres containing the methotrexate, right, for the treatment of the colorectal cancer. This is the same photograph of the calcium pectinate microsphere without drug and with the drug. Then we perform different in vitro studies just to ascertain that whether the drug is releasing in the colon or not. So we find that if you incorporate drug into the calcium pectinate microspheres, and if it is further coated with the pH sensitive polymer, then it will exclusively release drug into the colon. Maximum amount of the drug will be released in colonic fluid. And we also perform studies in different part of the in vivo studies, and we estimated drug concentration that is released in the different part of the GIT. After the 8 hours, we will find the maximum amount of the drug in the colon. Guar gum we can use for developing the colon-specific drug delivery system. So we prepare guar gum microspheres by dispersing guar gum in the castor oil, having the SPAN 80 and anti-foaming agent, and cross-link the guar gum globules by glutaldehyde. We get the hard particle of the guar gum microspheres. So these are the same photograph. And again, we perform different studies. We also perform which enzyme will be cleaving the digesting this guar gum. So we induce guar gum by administering the guar gum continuously for 5 days. And when this polysaccharidase enzyme will be induced, that secum content will be used and mixed with the in vitro GIT, in vitro drug releasing fluid, and we perform different studies. Redox drug delivery system we can use, because especially in case of the inflamed bowel disease, reactive oxygen species content is increased, and that will be used for releasing the drug for oxidizing this thiaketal polymer. This is the approach on which we received the President Award by selecting by developing ectotarget independent nanodegradable system. In this case, we conjugated the ligand with the liposomes. First, we prepare liposomes. Inside the liposomes, we incorporated anti-cancer drug, and surface of the liposomes are modified by attaching the folic acid, right, by using the carbamide chemistry. These are the 10 photographs of the liposomes, uncoupled liposomes and coupled liposomes, and then we incorporated these liposomes and mobilized in the alginate beads, right? And these beads were further coated. So all the possibility, we have considered all the possibility which will release the drug in the upper part of the GIT. So we prevented its release in the upper part of GIT by then further coating with the pH sensitive polymer. So this is the, we can use multi-particulate system, right? This is how we quote it and perform different studies in different fluid, gastrointestinal fluid, and colonic fluid containing the red cecal content. This is the new approach that we develop new composite, nanocomposites, for the treatment of the influent bowel disease, we use Montmorillonite light and we prepare a nanocomposite, layer nanocomposite. And it is Montmorillonite light is the earth matter and is used for the reducing the inflammation. So this is very effective for the treatment of influent bowel disease. Dendrimers in the skeleton of dendrimers, if you have the azobond, then we can make it colon specific one. That this is the time example of time release system. Pulsing cap is the example of the time release system. And here in this pulsing cap, the drug release is delayed to 5 to 6 hours, and by manipulating the length of the cap, that red one cap, if you manipulate the length of this cap of the hydrogel, we can manipulate the release of the drug. So thank you very much.
Thank you, Professor Jain sir.
Thank you. Thank you.
Good morning, everyone, and I'm sure that you all had a wonderful session on colon-specific drug delivery systems. And I don't have to say that again, that he has received the President's Award not just because of his ability to indulge in appropriate scientific activities, but also is a wonderful teacher. He has, in fact, given you the insight into the drug delivery systems, layer by layer. We have been exposed to not only the pharmaceutics part of it, but also the human anatomy and physiology. He has given you all the details about the microbial flora there in the colon and how do we go about it. And I'm sure this lecture has been highly technical and especially useful for those who are really keen into getting into the colon drug delivery systems and targeted drug delivery systems. In fact, he started with a wonderful background. He talked about translation research, and then he went on giving the significance of targeted drug delivery. Means his lecture was perfect. W's, why, what, when, and how, and what else. What else? Means he touched upon the background. He gave the details about the drug delivery systems and distinct advantages one could have with these drug delivery, platforms, and then specifically colon drug delivery. And then he gave you the details about various methodologies that are available for us and what else we could do. That also he has touched upon. And lastly, he also has given very clear insight about the nanocomposites and various other emerging trends in colon specific drug delivery systems. I am sure the organizers are very happy about inviting the President's Awards recipient, Professor S.K. Jain, who has proved again his mettle and his ability to, enlighten the audience with appropriate technical specifications and all the possible detailing. And I feel it is my privilege to be a part of this wonderful event and his lecture. And I sincerely thank the organizing committee, Dr. B. Suresh, Dr. Balamuralidhara, Dr. Pramod Kumar, and of course, Mahalakshmi, also my student, and for giving me an opportunity to be here. And not to forget APTI President and Secretary for asking me to co-chair this session. And it was my proud privilege. And I'm very happy that Professor Jain is here and he has shared his immense knowledge with you all. And I'm sure you have a take-home message from his research activities, and many more young minds, will get into the research front in this field. With this few words, I conclude my remarks on this wonderful lecture session. Thank you so much. God bless you all.
I, on behalf of local organizing committee, thank the speaker Sanjay K. Jain for delivering GP Srivatsava Memorial Lecture. Thank you, sir. I now request the chair and co-chair to honor the speaker by presenting the memento. I now request Dr. Murugan V, Principal, Dayanand Sagar College of Pharmacy, to felicitate the chair and co-chair for the session. We are now moving with the plenary lectures. The topic of the lectures is accreditation and ranking, which is very important and the need of the hour for today. To chair the sessions, I request Dr. B. Jaikar, Registrar, Vinayaka Missions Research Foundation, Salem, to please come on to dais. And the co-chair for the session, I invite Dr. Sanjay S. Tosniwal, Director, Vidarbha Institute of Pharmacy, Maharashtra, Central Council Member, PCI, and Director, Marathwada Pharma Cluster, Aurangabad. Please, sir. The first speaker in the plenary lecture session is Dr. S. Rangaswamy. I request the chair and co-chair to take over the sessions. The chair and co-chair to start the session. The first speaker of the lecture series is Dr. S. Rangaswamy, sir.
This is the third session of the scientific program of 25th Annual Convention of APTICON. First of all, I thank Dr. B. Suresh and the organizing committee who have invited me to be associated with this APTICON. So I once again thank the organizing committee. So now the session is on the topic accreditation and ranking. So now in this 21st century, apart from starting the institutions, getting affiliated with various universities, or starting the deemed universities and the private universities, awarding the degree is not only sufficient, but the every institution has to think more than that about the quality of education that we are rendering to the students, and we have to see based on the quality of education, each and every institution and the universities are ranked or it is accredited. In India, we have two types of rankings are there. One is about NAC. This NAC is accrediting the universities and as well as the institutions. And second one is the NIRF. So to highlight about this NAC ranking at its importance and what are the benefits we are going to achieve through NAC accreditation and as well as the NIRF ranking. And apart from that, we have one more session on international ranking. We have three resource persons for this series. First, the speaker of is Dr. S. Rangasamy. He is going to talk on NAC revised accreditation framework and overview. I request my co-chair, Dr. Sanjay S. Toshniwal, to introduce Dr. S. Rangasamy. Thank you very much.
Thank you, sir. Good morning, all. After having inspiring two lectures in the morning in this energy hall, I'm happy to introduce Dr. Subramaniam Rangasamy, sir. He is Professor of Eminence in Medical Education and former Vice Chancellor, Shri Ramachandra Institute of Higher Education and Research, Porur, Chennai. He is qualified as MBBS, MS Ortho. He has completed training in management and trauma, spinal surgery and pediatric orthopedics from UK. He is MCH Ortho, completed from University of Liverpool, UK. He has a rich experience to his credit. He has worked at several positions in reputed hospitals, not only in India, in United Kingdom. He is Vice Chancellor, Shri Ramachandra Institute of Higher Education and Research, Chennai. His major achievements includes lungs as a gas exchanger and in the area of clinical reasoning. He is associated with NAC activities. He has a rich experience and was instrumental for NAC proposals and advancements there. He has several publications and published books and chapters with several reputed publications. To his credit, he is a recipient of several awards, which includes Gold Medal in Surgery, Norman Roberts Gold Medal, Kaznifer Gold Medal, and Professor K.I. George Endowment Award. With this brief introduction, I request Dr. Subramaniam Rangasamy, sir, to take the charge of dais.
Good morning, everybody. It would be dishonest on my part to pretend that I'm not nervous. I'm very nervous because I'm facing a large group of professionals, teachers and researchers of the pharmacy discipline whose language I hardly can understand. My nervousness started about a few days ago when Professor Suresh called me on the phone one day and said, why don't you come and participate in APTICON 22 and give a talk on accreditation? Of course, when Professor Suresh asks me something, I cannot say no. I hold him in great regard. I consider him as an exemplar in many ways. An exemplar teacher of mentors and mentor of teachers. So I said yes. I thank Dr. Suresh for asking me to participate in this conference. Respected chairperson and co-chairperson and delegates and my colleagues. Again, to venture and talk after two scholarly orations and lectures is no mean task. I learned about it only yesterday, and today, of course, all the more I learned. But this morning I had an additional dose of calcium channel blockers. So to some extent I'm okay, I think. Regarding accreditation, we are all familiar. I'm sure most of you would have become very familiar with the manuals for health sciences institutions, universities and colleges. What is accreditation? We are all familiar. It's a quality assurance process. Basically, it means a checking of quality check. Of course, we are all familiar with quality, but when you need a stamping or an accreditation, you need an external agency to look at the quality standards and certify it so you get stamped. It's an external recognition. And the external agencies, it's not only just to meet with certain defined standards, but also like Professor Suresh was saying, it is futuristic. It should also allow for excellence to continue, and your quality standards should exceed what is defined as the basic minimum standards. And therefore, whatever self-assessment the institution has carried out is going to be verified by an external agency, and this NAC has defined as the peer team. They are not inspectors, they are peers who will look at the quality of educational standards. Of course, when we talk about accreditation, we talk not only about institutional accreditation, but also program accreditation. NAC, of course, is involved only in institutional accreditation, whereas NBA and AGMCT, other agencies are involved in program accreditation. But why do we need accreditation? Is it only to get a stamp so we can sell better? Of course, accreditation we have learned from industries, from business practice and industrial practices to ensure that the product is of high quality. So it's a quality assurance which we learn from industries, and its identification of strength. It also helps whenever we look at ourselves, it helps us to identify the strength and gaps, if any, in our programs and processes. Of course, in this process, of self-assessment and assessment by other agencies. It promotes a lot of communication amongst us, between us, and also with various agencies. Of course, it teaches us how to collect, validate, and document data. This is a very important factor, as I recognize. The more we get involved with the accreditation process, we learn how important it is to document. And of course, at the end of the day, as we have heard, it's a fostering of a culture of quality, an institutional culture of quality. It should become a second nature to us, just like getting up from bed at a time and brushing your teeth or following discipline in everything. It instills and inculcates a culture of quality in the institution. I would like to, quite often, I think this is a good method of remembering the steps of accreditation: structure, process, and product. It eases our thinking. And this is how NAC and many other agencies also proceed. What does structure means? The input, or as far as educational institutions is concerned, the structure means the institutional facilities, your laboratories, your classrooms, your research facilities, etc., etc. The processes are equally important. In fact, in the NAC accreditation process, it is the processes which are given prime importance. It's all right to have a nice looking building, a huge hospital with 1,500 beds, etc. But how exactly are the quality processes administered and managed? So it's more, I would say that a lot of assessment is process oriented. And in the process, of course, as far as education is concerned, we are familiar with the knowledge, skill, attitude, that chain we are all familiar. As teachers, we are familiar, you know. And finally, the product. What is the product of an educational institution? The product is the graduate. The product is the graduate. That is why many institutions, NAC also encourages institutions to define the graduate's attributes. When you look at an industrial product, you look at certain qualities in that products. When you look at an educational product, you look more at attributes. That's why if you wonder why questions are asked about graduate attributes in the product. So this is the same a structure, process, product, model. The product here is are the graduates. We are familiar with all this in the industrial practices. When you go to buy a car, you don't have to think twice if you have enough money to look at the big brand values. Their product is stamped with quality. Of course, as Edward Deming say, the product doesn't materialize just like that. It is a very rigorous process of quality process where everybody is involved. So I would like to re-emphasize the fact that in the case of institutional accreditation by NAC, every person in the institution is very equally important. It's not just for the coordinator of the IQAC or the dean or the vice chancellor to sit in their offices and get the stamp. No, every single person, including the students in the new manual, are important players in the process. I'll just briefly describe the revised accreditation framework. Many of you will be very familiar with it. I don't think I would have to labor on this a lot. It represents a paradigm shift. Why is it a paradigm shift? It's because many qualitative and quantitative aspects. It's a data-driven approach. The University Grants Commission and the Ministry of Ministry of Human Resource Development, they wanted more of quantitative assessment incorporated in the assessment process. That is why from 2018 and 19, we were busy preparing the NAC assessment manual for health science institutions. So, in fact, NAC wanted 70-30%, 70:30. The value for the quantitative assessment must be 70 and the qualitative 30. But however much we tried hard in health sciences institutions, we found it extremely difficult to reach out into that 70-30. So it has eventually ended up for universities as 65 and 35, and for colleges, something like 62 and 38. It's an automated evaluation process model with system generated score and data validation by a special team of data, DVV team. They will also be looking at the quality aspects of the products. Some of the new things which have been, I said it's a paradigm shift. Why is it a paradigm shift? Because in the new framework, we have alumni engagement, which is given importance. Because NAC felt that many famous institutions across the world, like Johns Hopkins or Mayo Clinic, they have achieved great value because alumni contributions have significantly defined their performance today. So to some extent, this has been introduced. Similarly, focus on innovation ecosystem, research-oriented innovation ecosystem, future orientation, equipment and laboratory learning resources has been introduced in criterion 4.2. We had to introduce hospital facilities, clinical learning facilities, etc. And the other important thing which NAC felt necessary was, in the initial SSR, first NAC will go through your SSR, and only when 30% compliance is obtained with the quantitative matrices, you will be qualified for the peer team assessment. If not, can be reapplied. You can apply again. I just make a mention for the colleges. So far, a lot of it I was talking about universities. For the colleges, we had to sit. It was very, very difficult to prepare manuals that suits Ayurveda learning, dental learning, medicine, nursing, pharmacy, etc. Eventually, we ended up with a manual which has two components, section A with 900 weightage and B with 100 weightage, whereas section A is a generic one applicable to all types of colleges of health sciences institutions, whereas B was specifically targeting with 100 weightages for individual institutions, disciplines. It's applicable to all sections. I just want to just give you an idea. It was not just a few people sitting and scratching their head and preparing a manual. No. The draft was sent to many institutions for feedback, and many institutions participated, gave feedback, and the draft was accordingly modified before it was uploaded in the NAC website. So what the product you see in the form of manuals has been vetted by several education institutions. The core working group has also worked on this. You are familiar with the 7 criteria, and under each of these criteria, you have key indicators. And now under each of these key indicators, you have matrices, qualitative and quantitative. The quantitative matrices are entirely assessed by the computer to produce the system generated score. It is the qualitative matrices which the visiting peer team members will be assessing during their campus visits. I just included as a note to universities, if a university has more than 60% of its faculties dealing with health sciences education, they are eligible or they can apply through the health sciences manual. If not, they have to go through the general universities manual. You have to be familiar with this BVV process also, the standard operating procedures. At the end of the manual, both online and in the printed manual, you will see the SOPs, which will help institutions to identify which are the appropriate things to be entered in the various sections. And ultimately, the score is generated, which is a combination of input from peer team assessment, like I said, 35% or 38%, and a system generated score of quantitative manuals plus student satisfaction survey. This is an important additional information NAC has. These two together form the grade of the institution. The pre-qualifiers I have already mentioned, that 30% at least the institution must score in the quantitative parameters in their SSR. Only then they qualify for peer team members to visit. The student satisfaction survey is unique. It carries a lot of weightage, and the students are encouraged to online respond to defined quality markers about their experience, educational experience, teaching learning processes, teachers' qualities, etc. They are asked questions, and the institution doesn't participate in this. But the institution can tell the students that this is an important, they cannot consider this. They have to be serious about responding online to the NAC student satisfaction questionnaire. This is prepared in the form of Likert type of questionnaire, 0 to 4 questionnaire. The students can quickly fill in. The questionnaires are prepared specially for universities and colleges, and the analysis of the survey will be carried out online during software, and separate questionnaires have been prepared for universities and colleges. Now, this is for us, for our own staff and faculty in the colleges and universities. We have to make sure that we read the manuals fully and understand. Read the STEM in each of the metric. Get familiar with the language in the metrics. What is actually asked for? I have seen many QLMs, the answers wander here, there, and everywhere without answering what has been asked for. And in the process, you lose some great strength of the institution. So make sure, get familiar with the language in the metrics. Get familiar with the SOPs, which help you to understand the QNMs and the templates, how the templates have to be filled, data templates, I mean. And read the appendices, glossary, notes and abbreviations, etc. at the end of the manual. I just added, as an example, in the case of pharmacy college, the part B, I was talking about part A and B. In the case of pharmacy college, part B for 100 weightages have 11 matrices. I haven't included all the 11. This is just, these are all busy slides. I don't want to spend time. The point is, out of the 11 matrices, 7 are quantitative and 4 are qualitative matrices. For example, competency-based curriculum enrichment as per AICT recommendations, etc., maintenance equipment, laboratory equipment, what new equipment has been added, etc., etc. Now, these are busy slides. I don't want you to strain through that. Basically, you remember, I was talking about read the matrices carefully. There are various things which we have to understand. Some of them ask for just percentage. No big deal, percentage. So many numbers divided by a total number into 100. Fair enough. No big deal. Some of the others, average number. Total number during the last 5 years divided by 5. Okay, a little more complicated. Then we get percentage. Then we get average percentage. This is something, the two-stage formula. We have to read very carefully. Average percentage means first you have to calculate percentage for each year and then divide it by 5. A sigma formula comes. A little more. So read carefully what is asked for. Is it number, percentage, average percentage, or what has been asked for before we understand and answer. So accordingly, we have the universities and health sciences colleges. They have all 7 criteria I just given. I have already spoken. Key indicators obviously are more for universities. Metrics, the quantitative metrics are more for universities. Again, 1,100 weightage points. And accordingly, universities and colleges are given grades. We are all very familiar with numbers. Everybody wants to get A++ or A+. So this is one of the most complex accreditation process in the world. I had experienced program accreditation abroad, but nothing like what NAC has done. It's one of the most complex, and we are so fixed with achieving the grades and numbers here. Why? Why are we so obsessed with the ranking and grades? In program accreditation abroad, either an institution is accredited or not, that's all. It's not whether you are grade A++ or A+ or anything. Why are we in this country? This is institutional accreditation because it has obvious benefits. Benefits to students because they can apply for various research positions, postgraduate courses, jobs, greater opportunities, etc. For the institution, of course, it's a stamp of approval, recognition, and you get more research funded projects. Funding agencies are looking for your grade, obviously. Even UGC is looking for your grade. So ranking and grading make a lot of sense in our environment, in Indian scenario. This is why we have to look very carefully at the quality indicators and getting the stamp of approval, ensuring that the processes are all in place. Talking about, I'm almost coming to an end, talking about the numbers or fixity to numbers. I always remember Goodhart's law. Charles Goodhart was a professor in the London School of Economics. He is the one who made a famous statement, when a measure becomes a target, it ceases to be a measure. The metrics themselves become the target. In our obsession with numbers and grades, we forget the quality. The quality somehow escapes from our hands. So the ideal principle of accreditation is to ensure the processes and ensure a very good product. And can the product be measured by a tape measure? Can you measure the sweetness of an apple by measuring its dimensions with a tape? You cannot. But at the end of the day, on a global or national scale, for a comparative assessment, we need to depend upon a certain methodology to assess the structure, the process, and the product of educational institutions as much as we have learned from industrial establishments. That is in short the message here. And this is my last slide, I think. This is nothing new. quality of a product and stamping a stamp of approval is nothing new. 300 and odd years ago, Rembrandt's famous painting, Syndics of the Drapers Guild in Amsterdam, they used to bring at the end of every week or month or something, a team of people used to sit and look at the fabrics of the drapers. They prepared fabrics of different types and they scrutinized the quality and they stamped 4 different stamps depending upon the quality of the drapes which the drapers produce. Very famous painting of Rembrandt. In fact, I was so touched with that, I made a copy and framed it and presented it to the director of NAC. It's there in his office. That is the obsession with quality. It's nothing new. Only the educational institutions, we have learned it. And we have learned to apply the various processes which make our product better. Again, William Blake, the famous poet and philosopher, his painting, he didn't like Newton at all. He thought Newton had no mind, he had no heart. He had only brains. He only tried to measure the world. So he made a caricature that big. They are all serious looking. You see here also in the Drapers Guild, they are all serious looking. I hope our new peer team members won't look so serious. Whereas Blake, look at him, a giant size Newton sitting with a compass measuring the world. So there are enough noises right from ancient times against measuring quality. Measuring quality is not always very easy, we know that. Especially measuring educational quality, all we can do is to follow Dr. Suresh's words that as teachers, let us learn how to be better teachers, let us learn how to be better researchers and learn for lifelong learning. And automatically quality will follow rather than chasing a number of A++ or A+. If we, the previous speakers, if we take them seriously and follow their advice, I'm sure we'll reach quality. So the NAC process, I just summarized. It's a very elaborate process. In 20 minutes, you cannot summarize it. But once you read the NAC manual, it's self-explanatory. Make sure that we read it and understand. And by no means is this NAC manual the final one. NAC itself has made this observation that over a period of next 2 or 3 years, we will get more feedback and it's a dynamic process. Matrices will need changes. We will have to add new changes as newer trends in education, technology, and research programs and quality assessment changes over the years. Thank you.
Thank you, sir. Thank you very much, Dr. Subramaniam Rangasamy, sir, for his lecture on this NAC revised accreditation framework and overview. So, yes, in a short time, yes, what is the importance of this NAC accreditation? But he has not given about overall the picture. He has given mainly on this revised accreditation framework. What are the changes they have made? What are the points to be noted? What are the 7 criteria are there? What are the key indicators that you have to be gone through in each criteria? Then talking about this quantitative metrics and the qualitative metrics, 65% the quantitative metrics and 35% is the qualitative metrics. How to go about it, how to achieve this NAC accreditation, what are the various types of NAC accreditation is there. Is A double plus, A plus, B double plus, B plus and B. Then finally he has concluded with that what are the benefits for the students, that the students can get an easy placement. By following all these metrics in day-to-day activities of the institution, the students will get a quality education. Wherever the students from accredited institutions, they will go, they are respected well, not only in India and as well as abroad. At each institution and the university, now it becomes based on the national education policy. This accreditation, before it was not mandatory, now it has been mandatory for each and every institution, especially for the grants, research grants. If you want to avail, you have to, at least you have to be NAC A or A plus grade is very much essential to get the research grants from the government of India and from other sources. So these are the salient features that we have to follow. He mainly elaborated about the health sciences manual because the pharmacy is coming a branch of health sciences. He has elaborate way he has discussed about this NAC manual, and also in NAC process, finally this quality mandate of UGC, the mentoring of the institutions, the universities or the institutions those who have got A plus, A double plus accreditation, that universities and the institutions are eligible to mentor the other institutions, those who are going for the accreditation process. So this is one of the guidance we can take the institutions who are not gone for accreditation. In the beginning it will be, if you see that it will be a big Himalayan task. Once you go through the manual, once, twice, thrice, and if you take the advice from the experts and as well as from the mentoring institution, it will become very easy for getting this accreditation. So I wish all the institutions and the universities, those who are not gone to the accreditation, you can try and get the accreditation so that the fruits will be there in the future for the students and as well as the organizations. I once again thank the resource person, Dr. S. Rangaswamy sir, for his lecture on this NAC revised accreditation process. Thank you very much.
I, on behalf of local organizing committee, thank Dr. S. Rangaswamy sir for delivering the lecture on NAC revised accreditation framework. I now request the chair and co-chair to felicitate the speaker. Please. JSS Academy of Higher Education and Research. I request sir to please come onto stage, who has been the pillar of support for us for all the activities. Okay. We have with us Dr. B. Manjunatha, Registrar, JSS Academy of Higher Education and Research. I request sir to please come onto stage. Sir has been the pillar of support for all our activities that we plan at JSS. the local organizing committee of APTICON 2022 extend heartfelt thanks for your guidance and support, sir. I request Dr. TMP and Dr. TM Pramod Kumar and Dr. Balamuralidhara to felicitate Dr. B. Manjunatha, sir. Thank you, sir. We are now moving with the next talk of the plenary lecture series. The speaker for the talk is Shri Maheshwar Peri, the founder and CEO, Career 360 Pathfinder Publishing Private Limited, New Delhi. I request the speaker to please come on to stage. I request the chair and co-chair to take over the session, please.
Welcome, sir. Have your seat. So the second lecture on impact on quality and stakeholder expectations. So once again, this lecture is on student-centric. So on behalf of this APTICON, sir, we welcome Shri Maheshwar Peri for this lecture. I request our co-chair to introduce Shri Maheshwar Peri.
Next to Dr. Yandachari sir, we have here Shri Maheshwar Peri ji with us. He is the founder and CEO, Career 360, Pathfinder Publishing Private Limited from New Delhi. Mahesh ji is chairman, founder, thinker, entrepreneur, dreamer, worker, a passionate entrepreneur. Mahesh ji is qualified as CA, CMA and ACA. He started his career as an investment banker with SEBI Capital Markets. He was associated with Outlook Group for 17 years and headed it for more than 10 years. Mahesh believes that the demographic dividend India seeks can turn into a nightmare if youth are not shown in the right direction to maximize their capabilities. Career 360 is the result of his deep understanding of student issues and the information gaps that need to be filled to help students take an informed career decision. With this brief introduction, I request Shri Mahesh to take the charge of dais.
Now, can you hear me now? Yeah. So thank you so much, Professor Suresh, for inviting me. It's always a dicey thing when someone who's supposed to be ranking institutions starts getting into how the ranking should be done and how the ranking can be improved. And I also feel particularly small speaking after Dr. Rangaswamy sir, because what you spoke just now about NAC is something very objective, very precise, and extremely important for the institutions. In fact, I had argued with the ministry many a time of why you must have a separate ranking when you have a fantastic rating. Because ranking doesn't improve every year. Academic institutions are not supposed to be judged every single year, at least by the government. That's my belief system. But having said that, it is there and it is doing its own job, so we should just live with that. The conversation is about, and by the way, I'm sorry about my dress sense. You know, all startup founders want to look young, even if they're 60. So that's where I am. When you look at the ranking, you know, from our perspective, and I was told to speak about the importance of ranking and the credibility of rankings in that space. You have typically about 4 good rankings at this point in time. NRF is right up there. And NRF is right up there because it's done by the institution, which means that there is no malice, there is no bias, or or so to say, there's not supposed to be any bias. Then you have two international rankings which are very, very good, THE and QS. And of course, we as Career City also do rankings. And the NIRF ranking is actually giving a lot of empowerment and autonomy based on the kind of ranks that you get. Like the top 100 institutions now can give online degrees. I met the UGC chairman about 3-4 weeks back, and they're talking of empowering institutions in the top 100 to get dual degree training programs, right? So increasingly, based on the ranking or the NAC score, the autonomy, the freedom, the space, the collaborations, the partnerships, everything is going to be decided for the institution and the kind of collaboration that they'll have to grow the institution. I also have a bit of a, it's an oxymoron for me, right? If you look at institutions of eminence, which are the top 10 private institutions and top 10 public institutions, they say that these are institutions which have the potential to be globally big and rank in the top 100 global institutions. So we give them freedom. What it also means is that the lack of freedom is inhibiting institutions from attaining global eminence. And this oxymoron has not been settled by any, right? We are a socialistic society, so there needs to be a lot of regulation, a lot of control over the education, because education drives a lot of dreams and aspirations in the country. But that's what we are. I'll quickly take you through the kind of what rankings essentially mean, and then maybe we can jump onto the questions if any. So rankings typically attribute a unique value to every function, because a lot of people think that they are the institution. It can be academics on one side, or marketing on one side, or admissions on one side, or placements on one side. What rankings do is they attribute a significant value to each of the functions of the institution. A proper weightage is given, and to that extent, every function within the university or the institution has a place to make the institution great. And ranking is based on very concrete evidence. It is backed by statistical tools. So when you talk of research, you have Scopus, Web of Sciences and all. We'll come to that later. Rankings also ensure that every function of is judged, assessed. And by the way, a lot of people, institutions who don't get ranked come around and say, oh, listen, rankings, they're corrupted, they're sold and all that. It is true, as we are a part of the society, there will be rankings which are bad. There'll be rankings that are sold, but you have to decide for yourself whether you want to be benchmarked or not. And I can tell you that institutions which have not been benchmarked, in my experience, and I know a few very good institutions that have not been themselves benchmarked, have started seeing the slide because they don't want to be judged. And to that extent, they're not even benchmarking on specific functions which can inspire them, trigger them, instigate them to improve. And that is a challenge that one needs to be dealing with always. They help institutions pursue efficiency in terms of where to invest money, how to invest money, how to invest scarce resources. It can be the bandwidth of the faculty or the academics or the registrar. So they help all those things. They help identify weak areas. They also help, benchmarking for improvement. Rankings give clarity to the direction of the institution. So, you can very safely say that, okay, this institution wants to be a medical sciences institution because you now have about 8 or 9 categories of, institution ranking. It can be law or pharmacy or medical or dental or management or engineering. So you actually have different categories of ranking. So at some point in time, you say, listen, I want to be ranked #1 in engineering. I want to be ranked #1 in pharmacy, and you can start pursuing that dream, right? Rankings help institutions differentiate. Someone is an engineering institution only, someone is an overall multidisciplinary university, and something can be just a pharmacy institution. It all works out well for everyone. And between the institution also, there can be a competitive benchmarking to ensure that you start competitively working for betterment of the institution. Now, the thing is, what is the important ranking parameters that one deals with? Dr. Rangaswamy dealt with the NAC part of the process. I'll now deal with the typical parameters that are judged by broadly the bigger ranking agencies in the country or the world. We deal with student quality, and that comes from the cutoffs. So this, by the way, is done by Career 360. It's not done by others. We do deal with the cutoff because many a time we say that this is the best institution. Like for example, if I were to take an example, BITS plan this year as a university also is 35-40 or something. But you go through the student, demand, BITS plan would be 3 or 4 or 5. Even as an engineering institution, you have universities like Chandigarh University and all topping them. No, when you deal with your child, you put him in BITS Pilani as compared to another university. So what we try to do is to actually look at the student quality so that we give a reasonable score for that, because students are demanding that institution. You take the current bunch of universities that came in Amravati, VIT or SRM and all, they are more in demand than the best institutions that are ranked better somewhere else. And that is something that one needs to keep looking at, because you can say that I'm the number one in the world, but if the student says, I want to go to this institution, you need to start looking at that very closely of why the student is preferring that. And trust me when I say this, students prefer institutions based on their outcome, which is placements. You can always say that I am a research institution, fantastic, and all those things, and you need to pursue that, but not at the cost of giving up those larger, outcome-based learnings that you will deal with. We deal with the teaching quality, which is the core faculty, the PhD faculty, non-PhD faculty and all. And I remember 10 years back when we started ranking, we started dealing with PhD faculty and all. Now, even Government of India has come up with a regulation, NRF is looking at that, NAC is looking at that. So it's important to have the kind of faculty that you have. The student-faculty ratio. I remember again, 15 years back, the student-faculty ratio is 1:30 also at times. Now, because of AICTE regulations, because of NRF, the way they judge and all, it's now coming down to about 1:18, and it will come down to 1:15, which is a benchmark that the government wants. It starts dealing with diversity, because one of the things that you must remember is education is not about what is taught in the classroom, but what is taught around the classroom also. How do you deal with a person who is not as rich as you? How do you deal with a person who is not as intelligent as you? How do you deal with a society that you're going to live in? So the economic diversity, the gender diversity, how do you deal with a lady on the other side or the gent on the other side? Now, this diversity is extremely important. You can become a very local college because you want to pursue only score, or you can actually create a human being which understands, empathizes with the world around them. And that is where diversity is very important. You deal with research scholars and graduates. The living infrastructure, of course, is important. So we value that. The accreditations and engagements. So if someone is NAC accredited versus non-NAC accredited, we do give a score for that. And now there is an inbuilt weightage within that, we work on that. The placement in ROI is becoming important, so which is what in NRF is called graduation outcome. So this is becoming bigger. The research output, because ultimately academic institutions are not supposed to be placement agencies, but placement is measured. So and if you look at the placement stats of some of the colleges and universities you have, some of the startups that are sitting in Bangalore and Hyderabad are placing better at a higher salary. And would you call them an academic institution? So to a certain extent, placement is important, but you need to measure it along with all the other things that you build around the student life and the learning part of it. And the alumni, of course. So research, I'll come to each of them separately. So this is the 4 rankings that we have and the kind of score that you have. If you look at NRF, they give teaching, learning and resources a 30 score. THE does 30. Careers does 21.88. And QS, by the way, talks of academic reputation, which means it's peer group survey. Now, I actually have a question mark whenever a perception study comes in, by the way. I'm more happy when a quantitative data analyzed stuff comes in, because it cannot be manipulated or influenced. But the moment you bring in perception and moment you bring in a survey, it creates a problem. Like for me, NAC is so much sacrosanct because there's a peer group that is visiting the college for 5 days and then judging everything. Now, everything can be, questioned about whether it is still right, whether it's still honest and all. But broadly, I would go with NAC than any other of these things, because many of these things are where you submit the data yourself and it is not prone for checks, because these agencies don't have the wherewithal or the resources to even check the data that is submitted, including NIRF. You look at the current NIRF ranking, I've always said that NIRF is one of the most unbiased, clear, honest rankings. They might make mistakes, but it is honest. This year ranking had a question mark on it because of the kind of institutions that came up. And I'm sorry if I'm being honest about the whole thing, but that's what my opinion. I'm speaking here, so I speak my mind and nothing else, right? So you have 30 score for everything. QS has 40 for academic reputation, which means it also has an inbuilt survey, which is peer group survey that is inbuilt. Then you have research and professional practice has 30 for NRF, 30 for THE, 15.63, which is where we do IPRs basically. Because IPR we do, Indian Patent Office, World Patent Office and all, and we start getting data. The difference should be patents applied for and patents granted. NRF does only patents applied for. They don't do patents granted, which means you can pass by the patent office, file 1,000 patents, and you'll start getting a score out of that. And that's a question mark. I'm sure they'll improve on that as they move along. And you have, on the QS, you have employer reputation. Then you have graduation outcome, which is the pass, the kind of students that you have, the quality of students, the pass percentages, and the placements of them. THE has, of course, it's not everything is like to like, by the way. And then outreach and inclusivity is 10. Now, this is extremely important, which is the, what kind of students study in your classroom. A classroom is made of the rich and the poor, the wise and the unwise, the intelligent and unintelligent. If you make a classroom of a similar set of people, what you're creating is a ghetto. And that's the worst thing that you can do to a child, because he comes out and thinks that development means, aerial towers and flyovers, which is not what development is all about. So it is extremely important for all of us as institutions to ensure that there is great diversity in the classroom, because that's where the learning is. And then the perception is only 10 in NRF, which is the best thing to happen. Right. Now, if you look at THE, teaching is 30, research is 30, citations is 30, international outlook, which means the faculty's exchange, student exchange, international is what is 7.5, or people coming in, and the industry outcome, which is the placements part of it, is 2.5. Careers is learning and engagement is 21.88. IPR, patents and all is 15.63. Publication count is 12.5. Citation impact is 12.5. Research productivity is 6.25. And excellence in eminences, which is instead of eminence, SNAC, the rating and accreditation that you have, all those things, we take it as 31.25, because they factor in everything else that we are unable to measure by ourselves. Then you have QS, which is reputation, which is survey. Employer reputation, again, is survey. Faculty student ratio, which is actual data. Citations per faculty, actual data. International faculty ratio 5 and international student ratio 5. Now, which is where the Indian institutions always have a problem, because they say that, listen, if we are unable to employ a foreign faculty, we are penalized, which is true and fair, and which is where Indian institutions don't figure in many of these rankings. They've struggled to figure in, but that's where we are at this point in time. Now, this is a teaching, learning, and engagement that you have. NRF has 30, as I said. THE has 30. Careers has 21.88. Now, what are the broad parameters you have? Student including PhDs. How many PhD students are coming in? What is the student-faculty ratio? What are the PhD faculties that are teaching the students? What are the financials in terms of the money that you're spending for the student welfare and student learning out of the total income that you earn? The online resources that you give to the students so that they can learn beyond the classroom also. That's what NRF is measuring. Now, THE, they do reputation survey, 15 of the 30 points. Then you have student faculty ratio, which is absolute data, the PhD faculty ratio, the financials, and the PhD awarded to UG degree ratio, right? Careers does learning, including student, exactly this almost similar thing. Ignore the weights for the moment. Core and PhD faculty ratio, residential and infrastructure. Because one of the things that we measure is, if it's a residential campus, then possibly there's a greater learning because people study in the nights in teams and all. So there is something that we value that. And the accreditation that they give. QS has international students, student faculty ratio, and international faculty. Now the research weights, this big thing, by the way, many Indian institutions fail here, because initially when we started the research thing, a lot of people started publishing a lot of papers in unaccredited or unrecognized journals also. Now you have a huge amount of quantity, but it's not creating any quality, right? So which is where increasingly the Scopus and Web of Sciences are being more, accessed, and the data is available. So people like us, we have subscribed to it and we download data of what's the kind of research that each of the institution does, and we go through that. So the publication count, which is quantity, is 10.5 in NRF. Citations is 10.5. So if your research is good, it is cited. Otherwise, it's never cited. The IPR published and granted is 4.5, and the projects is 4.5. THE, LCO reputation survey, they do 18. Citations 30, productivity 6, research income 6. And then Career 60 does 12.5 and 12.5, which is the H index and the citation. And productivity is 6.25. And IPR published, granted, WIPO and IP activity is what we see, where we give 15.60, because we are very closely monitoring not just the research, but how many patents have resulted of the research and what exactly is the impact of that research. Now, QS again has come back to the reputation part of it, which is a question mark for me always. And then you have citations per faculty. Now, citation per faculty, what it does is, for a larger university, it penalizes them because the smaller the thing, it can deal with that whole thing, right? Now, this is a perception. The overall for NRF is 10, THE is 33, because they actually have surveys inbuilt between the thing. But THE has a much more robust, peer group survey mechanism where they write about many professors around the globe, get a response from them, and then start working on that. But what happens in that is the top of the mind recall takes over. And there are also question marks of whether that list of people who are answering THE is out with some people. So there's a question mark on that, because then you can start dealing with 100 people, because all it takes is 20 faculty members to say this is a great university, it will pop up straight away. Right. And careers, we don't do any perception because we don't believe in perception. So we just step out of that. And QS, the overall 50% weightage, because it's there in academic, in employer reputation, everywhere there's this, perception that's built in. So it's almost 50%, close to 50%. Now, what is the impact of ranking? You can actually do international partnerships. If you want to talk to any university outside, the first thing you will say is that I'm NAC so-and-so rated, I'm ranked so-and-so in NRF, I'm ranked so-and-so in the country, or I am in QS and THE we are ranked. So it helps build a conversation straight away. Otherwise, you need to explain a lot for yourself, and the Senate will sit over it to understand what is the kind of university. It becomes a more difficult conversation. And I can tell you, like, the government of India now says that they're inviting every university which is in the top 100 or top 500 to come and set up campuses in India. Now, which means that they're not taking any view, but taking a view from what comes out of ranking. And I'm sure many other governments also, and many other senates also will have a similar thing, that top 100 of any country can come and collaborate with you. And as I told you, very soon you will actually have dual degree programs, twinning programs all opening up. So if you are not ranked, you'll get into a problem. So it's far important for you to deal with that. It attracts better faculty because faculty wants to go to a place which believes in academic credibility. And academic credibility is inbuilt in the kind of ranking that you have. So it works for that. Attracting better quality of students. Students go for the best university if they get a college in admission. The faculty student exchange works for that. The research collaborations work for that. They increase your student visibility, because in all rankings, if your name is there, it invariably comes in top of mind. Someone is filtering, okay, what are the top universities in India, and it pops up by itself. So you don't need to market yourself, it just pops up. So it creates visibility, and it helps you, enables you to benchmark to the best standards. What is the impact of ranking on the other stuff? The national policy decision making. For example, you look at Institute of Eminence, IOEs, right? The top 10 in private and top 10 in public. The better institutions which are not in the QS or THE were ignored. So Ashoka and all did not find place because they were not ranked by THE and QS, because of one of the clauses that was there, which the screening committee talked of, is that we did not consider the following universities because they were not a part of any of the international rankings. And because the objective is to push universities and empower them to be a part of the global ranking, we wanted it to be the first basic criteria or the filter. Right? It helps you benchmark for improvement. Decision making is at an institution level, because a lot of people, I noticed that, initially when I used to go to universities and I visited a lot of campuses, right? They would say that we are good, but they don't understand that. We do well, but they don't understand that. Now there's a benchmarking possible. If you're good or not, there is a benchmarking that is possible, and that helps people, improve better. Attracts external agencies to provide funding for research. So you can go to an industry body and talk of research grants based on the kind of ranking that you have, because you have a better reputation. Commercialization of IPRs and focusing on opportunities and gaps. Now, I'll just skip these things because I think we're running behind time, but research publications, we consider Scopus and Web of Sciences. NRF also considers Scopus and Web of Sciences, but for the last 3 years. We also do it for the last 3 years. TSC considers only Scopus data, and QS uses Scopus Web of Sciences, and they came up with International Research Network, which is, I think, owned by them. So that is where there is an issue out there. But they use these three. The research productivity denotes the number of publications count per faculty. average annual publication produced by faculties, provides a research output of each faculty, and publication in the high impact factor journal. So the better the quality of journal, the better the impact, the better the citation, the better the H index, and it all adds back. So it is important to for you to understand which journal you're publishing yourself into. If you publish anywhere, it doesn't matter. But if you publish at the right places, it matters. So it's not about whether you publish 10 papers in unknown journals to maybe 1 in 2 years in a known journal or 1 in 5 years in a known journal. That's far more important. The IPR, patents filed and granted, WIPO applications, some of the institutes file maximum number of patents but granted very less. I can name names here, but I don't want to at this point in time. But people have filed 500 applications with not a single patent granted. So those are challenges there. So one needs to deal with that. Some other institutes use the same name for the patent office. So you actually have 10 universities, but they only give one name. So all the patents come into one name. And this happens to multi-location universities or multi-location colleges. Right? Seriously considered the patents filed and granted by the IPO. So we give different weights for both so that there is some kind of a logic. IP activity at the campus, incubation cell, technology incubators, and generator ranges for the incubators, right? This is the H index I told you about this, so I'll just skip this for a moment. Student and faculty, the student quality, application to intake ratio is very important. Now, by the way, Stanford kind of colleges are now hitting back at this ratio, so we might also have to relook at this whole thing, because it's not necessary that a student who can never get into a college should apply to the college, right? So that needs to be corrected, and we're correcting that. The cutoffs for the top quartile are very important. So how did the top colleges get students is important. The faculties, the core to regular faculties at campus, the teaching experience, and of course the faculty shortage. Some of the universities do have a faculty shortage. This is the essential infrastructure. We take the Aisha report, the All India School, higher education report. And there you actually have data of the students, the infrastructure and all those things, and we take all the data from there, right? By the way, we also filed 20,000 RTIs to ensure that all of you file data. So if you don't file data, we still get it. We'll get it because we'll go to the Pharmacy Council of India, we'll go to the Ministry of Health, we'll go to Ministry of Education, but we'll ensure that the data is coming to us, right? For both faculties and students, it helps students to engage with faculties, incubation centers at the campus, and all those things that you talk of, right? Then we look at these accreditations. It can be NAC, NBA, EQUAS, AMBA, SACS, that's for management institutes, and Association of Indian Universities, because they do give an equalization certificate for some of the qualifications. So if they're given something, it means that they've assessed, measured, and have empowered you. So we also look at that. Diversity, I talked about it earlier. Now, how these parameters help? Like as I told you, when we started this ranking exercise 15 years back, we also saw student-faculty ratio of 1:35 in a class, and now it's come down to about 18, and I'm hoping it will come down to 15 as we move along. So that's what it is. Thank you so much. Happy to take questions.
Thank you, Bhaji. Now the session is open for question and answer. If you have one or two queries quickly, we can go ahead. Queries from the audio side? Sir.
My name is Guru and I'm working as a principal in College of Pharmaceutical Sciences, Dhanaswara University. So nowadays, the university insists on paid journal and unpaid journal. And generally they say that don't go for paid journal. Is it correct?
That's absolutely correct. See, it's like this. I heard one of the keynote speakers talking of, you don't pay to be a part of a conversation, right? If someone values you, they call you over, right? So invariably, the good journals will pay you to be published, right?
So now the issue is most of the journals, as per my knowledge, goes 90% of the journals, they're asking for the payment. So
yeah,
that is
so go for the 10%.
Okay, right.
Thank you, sir. Any more questions from the audience? One more, please. There.
See, this thing about quantity, when you say journals, there are millions of journals, right? But there are some very credible journals who created a business out of it. The subscription is valued, and people like your university would be paying to subscribe to those journals, right? The business model is that the quality of research that they publish in the journals is such that people pay for that research. That's the business model. The business model is not that I'll create a book where people pay to write and I'll distribute. That's not the business model. Any business model that drives on the second part, ignore. Any business model which is driven by people wanting to read what is published in the journal, you must value that more. Yeah. Yes, sir.
Yeah. Good afternoon, gentlemen. I'm Dr. Datta Kumar. And the question is about the NIRF rankings this time. Because I get a real feeling that there has been a lot of manipulation at the universities level to bump up a lot of research and publications. And in akin to what you said, I was also a hard believer that NIRF is a very definitive score. But this time when the rankings were out, we saw quite a few colleges which are not up to that mark as far as we know in terms of perception, but they have gone up. So is it losing its, is NIRF losing its credibility is the question.
So as I told you, I would want to believe that NIRF cannot be influenced, biased, or doesn't have a malice. But I also noticed a few sore thumbs popping up in the NIRF ranking this time around. Earlier when they came up, it was because of the kind of data or the kind of participation that it had. Now, what is happening is NIRF, you're forcing people to participate because you're giving greater autonomy and freedom based on the NIRF rank. And then you have this, it creates a serious issue, right? But as academic institution, you need to give yourself some more space because this will self-correct itself. Academic institutions don't rely on 1 year and 2 years. Of course, there'll be a heartburn for a person who's heading an organization at that point in time because suddenly your ranking has fallen or grown, right? But be a bit more patient because since NIRF started, it came a long way. If you look at the first ranking that NIRF did, it was atrocious. It was so atrocious that people like me wrote such critical things that some people attributed that she was removed as a study minister because of the columns that people like us wrote, right? It is not about that. Academic institutions have a longer lifespan. A few years here or there, it doesn't matter, which is where I said, NAC is over for 5 years, NIRF is for 1 year. What would you do in 1 year that will improve your ranking from, say, 100 to 40? It's not possible. And that is where the trending comes in. When people like us do it, we do the trending part of it. And just be patient, it will correct itself. I know there are issues, but they'll be correcting ourselves.
Is that many institutions, they're also trying to get into a kind of manipulative arena.
No, that's right.
And that's a sad part of it because a lot of integrity is lost.
Sir, NIRF, the investigators have NIRF and institutions are all a part of the society. So what you see there is what you see amongst us. But you just be patient. All I'm saying is that don't disranking because you've seen some anomalies. Because when you're disrankings, you will be hurting yourself because within your institution, no one is going to benchmark themselves for betterment. So use all these rankings and the data that is sourced from the rankings for your own betterment. Because if you critique in front of all your faculty and all, they'll also give up and there is no benchmarking and then it starts a slide. So don't do that.
With this, I request our chairperson to please concluding the session.
So we thank Shri Mageshwar Peri. He is the founder and CEO of Careers 360 company, New Delhi. So he has very good comparative study on various accreditation process like NIRF, Times Higher Education Ranking, Careers 360, then Clears ranking. So it has given a very good highlights and it gives a very good idea about applying and going for these various type of accreditations. And he also elaborated about the benefits what due to this ranking, because now as I told you earlier, the government of India and as well as the international organizations and universities, they are very particular about these various rankings. So based upon the rankings, they have an admissions they are doing and they are giving collaborative research activities, students exchange and faculty exchange programs. They are very much asking for these rankings. So he has given a very good inputs for going for these rankings. But the issue is, as one of our the audience, the delegate has asked about this authentication of the data submitted by the institutions. That is still the debate is going on. Various organizations also have they have commented on this institution ranking system of NIRF because certain parameters are they are validating, but not all the parameters very strictly. When comparing with the NAC is having a 30% weightage on qualitative metrics. There is a peer team visit, and once again they are verifying that by qualitative metrics they are verifying parameters and the functioning of the institution, and they are having interactions with the students, faculty and alumni and all. But the government also can take some steps on this issue, that the parameters which has been submitted by the institutions can be thoroughly verified before declaring this issue. The APT can also take the steps on writing to the government of India against this issue also. Okay, once again, I thank Mageshwar Peri for his wonderful talk on these various ranking systems. Thank you very much.
Thank you, sir. On behalf of Local Organizing Committee, I thank Shri Maheshwar Peri, the founder and CEO, for delivering the talk on impact of quality and stakeholder expectation. I now request the chair and co-chair to honor the speaker. Thank you, sir. I take proud privilege in inviting the next speaker of the plenary lecture series, Dr. Nilani P., the Deputy Director, Bureau of Quality and Statistics, JSS Academy of Higher Education and Research, to deliver talk on international ranking ratings, a step in the direction of globalization of education. Please, ma'am. I request the chair and co-chair to start the session.
Go ahead.
I take this opportunity to introduce Dr. Nilani P. after Mahesh Periji's session. Dr. Nilani P. is Deputy Director, Bureau of Quality and Statistics, JSS Academy of Higher Education and Research, Mysore. She is graduated from JSS College of Pharmacy and obtained doctorate in Pharmaceutical Engineering and Technology. She has huge 20 years of teaching and research experience with 8 years of administrative experience as a Deputy Director. Dr. Nilani ji served as a scientific advisor for Indian Patent Office. She has published around 30 research papers in national and international scientific journals and presented nearly 25 research papers in various national and international conferences and symposia. She has compiled 3 volumes of Medicinal Plant Research Compendium for JSS Academy of Higher Education and Research and a handbook of medicinal plants for Medicinal Plants Promoters Society, Nilgiris. She has formulated and edited JSS AHER Compendium on Sustainable Development Goals. Dr. Nilani has 3 patents to her credit as a main inventor and recipient of Indian Association of Biomedical Sciences IABMS Best Patent Award. Madam empowers and motivates women and children through various training and skill development program for the betterment of society. And she, as administrator, continuing the professional services to the organization for improving quality at all levels. May I request Dr. Nilani ji to take the charge of dais.
Check it. It's checked. Respected dignitaries on the dais, my dear colleagues and friends, it's a great privilege for me to be here to discuss on the international rankings and ratings, a step in the direction of globalization of education, which is a burning topic nowadays for most of the Indian higher education institutions, because globalization is what that is tapping on our doors. Tapping on our doors every day for us to move forward with collaborations. And to move forward, so here I'm very thankful to my previous speakers, eminent speakers who had already discussed about the scenario and the parameters and the importance of the ranking. And I'll be happy to take you all through our journey, a case study of JSS Academy of Higher Education Research, that how we worked and how we could reach the level that we have reached today. And to begin, I quote, "Rank does not confer privilege or gives power. It imposes responsibility." Peter F. Drucker, I unquote. So when it comes to our experience working with these rankings and ratings for the last 1 decade, it has not given us a power and privilege, though it is being widely spoken, but it has given us a great responsibility. Every year our responsibility increases, and we are happy with this responsibility. Not only the leaders, not the authorities, but every individual of this institution is responsible for what we are today. So that gave the credibility of the responsibility for the organization. We will be today talking about or discussing on the effect of globalization, and the dear eminent speakers have already discussed about it, and we'll be having a slight glance so we can skip this most of the slides and I can go to the case study. Then origin of the international rankings, the diversification, then challenges, what we face, then the strategies that could help us to go into the internationalization through this, using this platform, international rankings. So globalization and internationalization is encouraging every higher education, especially in India and abroad, to prepare and to participate in this international or global rankings. In turn, the international rankings are also helping the globalization and internationalization. So this is working in hand. So this we cannot say that Globalization is not leading to ranking and ranking is not leading to globalization. We will see how it works in the next slides. And I also like to say that internationalization, that is international competition or international comparison, does have challenges, and we have to walk through the challenges. We should, as the previous speaker said, we should have patience. We should go through the challenges, face the challenges, then we can come into the ranking board. The origin of the ranking, if you see, it is not now. It was in 1900. And 1900, where we get our best men, was a report which was published in UK. And there it was compared with those alumni from the famous alumni from which institutions they are, got their degree. And that is how it was, the report was made. And this came and gave an idea about ranking the institution. Then later it came in 1980, then it was going on, the ranking was slowly evolving in its own space, in its international level. Coming to 1983, the very famous US News and World Report title, that is still, it is famous, America's Best Colleges, is being published. And here, for the first time in the history of the world, this report was open to the public. Every parent and every student could go through this report to choose the colleges. So this was given public view for the first time. And next, in 1990s, it's a golden era for the global rankings. Number of rankings came in. And among them, you can see one of the Good University Guide, which was published by the Times magazine in UK. That was in 1993, which was an eye-opener. And it was done because of the request for the British Parliament. Next, we go on to the next part. When it comes to 2000 and 2014, what happened is the giant, or the most respectable ranking everyone considers nowadays, is the academic ranking of World University, that is ARWU. We call it as Shanghai ranking because it was introduced by Shanghai University, where in 2004. And it was mainly on the research basis. We'll be seeing that deep about it later. Next came the World University ranking of two, again, eminent ranking agencies. One is THE, one is QS. Earlier, TH and QS were working together. When the THE, that is Times Higher Education, hired QS, which was a consulting agency for academics, they both came together with an agreement and they published the Times Higher Education by QS World University ranking in 2004. So it was a joint venture. And later what happened is, in around 2005, this employer reputation survey was introduced. And the earlier speaker told what are the difficulties in this employer reputation parameters, because institutions like us, we do have some issues with that, which we'll be discussing later. And later when it went on till 2000, from 2004 to 2009, both these ranking agencies were working together and they were giving one World University ranking. When later in 2009, THE parted away from QS and they had a partnership with Thomson Reuters, and they got the data, especially the publication data, resources from them, and they started publishing their own ranking, which is called as Times Higher Education World University Ranking, for the first time in 2010. Then, since the patent intellectual property rights of the methodology was with QS, QS continued its own methodology. So it did not partner with any of the agency. So they went ahead with their World University ranking. And in 2009, they introduced QS regional ranking, Asia ranking. And later, they recently, they also introduced QS subject ranking. So whereas in QS, if you are not featured under World University ranking, you have an opportunity to be ranked under subject ranking as well as your regional ranking. But that is not possible when it comes to Times Higher Education, THE ranking, because if you are not qualified in the World University ranking, you will not be featured in the subject ranking or in the regional ranking. So we'll see what are the different rankings are there internationally. So we are not talking here about The national ranking, sir had spoken already about it. So we'll let's go on to the international rankings. The well-renowned international ranking that most of the institutions like from Harvard to Oxford and NUS are being featured. One is the Shanghai ranking, ARWU, next Times Higher Education. So you see the parameters, you already explained to us, the previous speaker, what are they focusing on? So ARWU is a more standard because they focus on the field medalists, Nobel Prize winners, and publications in nature and science. So the requirement is much higher. Then next to the THC, there are 5 parameters right from the research to internationalization. Next, QS ranking, again, from here, there are more weightages for reputation, as already discussed. Then you come to some of the Saudi-based countries, they come out with their own ranking, where Asian universities are also participating, which as a whole, academic as well as research. Coming to, there are business-based, school-based rankings, which will not be going further. And then Leiden ranking, which is very famous, which is because it is mainly concentrating on the research outcome of the university in the Web of Science. So they have an agreement with Thomson Reuters, they get your publication and then they'll rank you. And these are the criteria they will be looking into. Then coming to the next one, the Thomson Reuters itself, they have the Reuters World Top Innovation Ranking. This innovation ranking is once again is completely based on patents. The patent, it is not here as earlier spoken. We just file a patent, and also earlier Pro-Chancellor mentioned that we just file a patent for the sake of NIRF, for the sake of NAC. No, it doesn't work here. So this is one of the renowned ranking for patent. They measure the outcome of the patent. How much is commercialized? How is the outreach? How much it has helped the public? Okay, when it's a health-based institution. So these are the things that they will be observing under this Reuters ranking. Coming to the Chicago institutional ranking, which is very common to us. We would have seen is Shimoga institutional ranking and is JI, that is journal ranking. Most of us will be very familiar because this is one agency which ranks the journal. And they ask generally, are you in SJI index journal? Because they rank it. So they also go by various parameters under certain categories which are listed here. Then multi-rank, again, a Belgium-based. Coming to the next, we already discussed about US News World Report on the best US colleges. Then come to there is a cybermetric related rank is also available, which we do not submit any of the data here. It is purely on what is available in your website, what is available in the institution's social media, and what is available about the institution in the national portal, the government portal. Either it's a rank or accreditation. So they take it from the online way of accessing the data. So here we do not, they do not ask any data. And same with the Shimoga institution ranking also, they do not ask any of the data. It's completely by themselves. So here now we are coming into the parameters which is already discussed. So how do we choose to participate in international ranking for us to get into the global view, international view? That is what we need to look into. So this is what is the topic is about. So when it comes to Times Higher Education World University Ranking and QS World University Ranking, here we took a choice. So our work at JSS AHER started in 2014. And when the 2014, our leaders, our visionary leaders, including Dr. B. Suresh and our authorities from the MVP, Mahavidyapita, they all decided for which are the prominent or accessible parameters that we could be featured in or we can work further. So when we look into the parameter, citation was always our strength. We had wonderful publication and our researchers and academicians were publishing in excellent journals with a high impact factor and it cited well. So that was her strength. Next, teaching and learning was also her strength. Coming to the research income, that was also a strength. But when you compared with QS, the academic reputation we could achieve, but coming to the employer's reputation, being a health science-based institution, running a course which is related to medicine and dentistry, where maximum of the outcome is on, the graduate outcome is on self-employment, this employer's reputation will be difficult for us to participate. And we need to work. We have only pharmacy and life sciences left. So looking into all the challenges, we stood back and we gave the priority to THE, where we can achieve the ranking in another 4 to 5 years. It was not a one day's work, it was not overnight work. So 2014, the meeting was conducted, the deans and the principals were called, and the nodal officers were taken. And by the time NIRF came in, so we knew about the parameters, and we all sat together and we took, that was our strategy, to have this ranking by another 4 or 5 years. Fortunately, we were ranked in 2018 by one of the top 500 institutions in the world. So this is how we work. Coming to next, Shanghai. So this is the parameters, that which has been required. And now, when we look into Shanghai, it is achievable. Yes, it could be achievable for JSS-HER, but we need a couple of more years to get the Nobel Prize winners as a adjunct faculty or a faculty, and alumni to reach that level. And next is field medals. We do not have mathematics and physicists with us. Next is citation and Web of Science, and we also concentrate in Web of Sciences because we are focused more on the Scopus. So comparing to this again, which was a challenge earlier, QS, we opted for QS. After achieving the goal of THE, we moved to QS. And when we moved to QS, it was achievable by us because we already prepared ourselves. Then when did we get QS ranking? Again, by 2020, Asia, that is regional ranking, we were able to get. So it is a matter of nearly 5 to 7 years of hard work is what JSS-HER is being featured now in the World University ranking. It needs a lot of policies, a lot of strategies, but none of them are being a paid ranking. And we do not pay for our ranking, we do not pay for our publication. So that is a policy of our management. So we go by that and we achieved it. Coming to the globalization, already spoken, so I skip few of this national effort. If we want our university to be globalized, then national effort, and there is a major criteria. And thanks to NIRF, when in 2000, when the government took a decision that why none of the HEIs or the universities from India is in the top 100. That's the time MHRD brought in and UGC sat together. They brought in this framework, NIRF, so that to strengthen the data of the Indian institution. So we did not know how to go in about data collection, data processing, data validation. So government took an initiative, NIRF came in to strengthen our data. So now we are happy. What is NIRF doing? What is being asked in the thing? I'm not coming to that, but at least we are happy we have our data. A prominent data with every institution, we have our data with us. So this is what the government did. And thanks to the national education policy, they connected again to the globalization, either coming to integrating teaching, innovation research, or digitization. All this came in the education policy, and definitely, apart from that, quality assurance. In every institution, if we keep up this quality assurance, as the first speaker spoke here, and that is NAC. When we are going to keep up the quality assurance, reaching the international ranking and making use of this ladder to go into the globalization is not a bigger challenge for any Indian institution, and especially those institutions which are having a pharmacy based in a college or institution. Why? Because we are, as a pharmacist or a person working in a pharmacy college or institution with a pharmacy education, we are aware of NAC. We are aware of NBA. We are also aware of, we have been working with NABL, NABH. Then we also have ISO certification, most of us. So when all these are being given to us, and we've been working, I myself, when I was a teacher, I was given the privilege of working with all this. Maybe I found it difficult that time, but I feel good now because I'm able to handle data. I'm able to understand the parameters. I'm able to understand the requirement of the accrediting agencies and ranking agencies. So everyone who's here as a teacher, who's been put into this role of handling this data system, I can see many of you are smiling, is the most challenging job. And it's a very difficult job. People don't volunteer it, but if you take it, definitely your future is bright. And I thank my teachers for training me into this. So my teachers who have trained me into this, and here I am helping the university, and in turn, the university is helping me with all the knowledge. So I just skip because all this, so what are the challenges? The challenges is the methodology, as already spoken. The methodology in the sense demographical or it's a geographical or cultural differences. What is the parameter suits the European country or USA will not suit Africa or Asia. This is one issue that we are facing it. And we have written, as I said, like we have been communicating to the international agencies in many ways, and they are kind enough at least to accept partial requirement from our end. Not only we, most of the institutions together who have been ranked, we have been representing to the ranking agencies from India. Thanks to the Indian government, they are also very supportive, and especially NBA and NIRF. Then coming to Shanghai ranking, it's a high profile. Leiden ranking, again, Web of Science it is focused. Then coming to QS World University ranking, Web of Science, but again, the publication threshold is not given in the methodology. Coming to THE, though we are ranked, it's a very difficult task because again, the publication threshold to be featured in the ranking is not given to us in the methodology. So every time we have to check with them, analyze, are we eligible? So this is a continuous process. And coming to our case study, yes, ranking matters. It was a difficult task. It was a very difficult task for us. 4 years, 6 years, we did work. But today, if you see, if you open, or those who are having already for the phone, you can see into your Google search, JSS, HER and QS. There we are in the QS top universities. Not only we also have all our constituent colleges and department. This has been now wide open to the public. Globally, here the globalization starts. But we worked for this globalization. It did not happen within a day. What did happen? It helped us benchmark who are standard with the universities which is higher us. Then understanding the strengths and challenges, whose challenge, our challenge. JSSHR challenges, improving the performance, our performance. The competition was with us, not with the other universities. We set benchmark. We worked hard to improve our standards so that we could reach that. Then understanding the reputation. Always it's been said, reputation is one parameter could not be considered. But when we worked on to the reputation, here we are visible globally. So this is what happened to us. So again, as I said, don't come out of ranking. You like it or not, participate. It takes a lot of time. It is not one day's job. But when you do it, here we are successful. Coming to THE, please log into JSSHR, THE portal. There we are. All our ranking is there. All our details are there. And what happened? Our teaching and learning, all this for our research, perception, graduate outcome, internalization, outreach, collaboration. Right from Harvard, we have collaboration now. We have international students all around the world. How? Because we are projected in the international portal. Here the globalization starts. So this is not a reachable task. It is a reachable task by every higher education institution. And when it comes to ranking agencies, it is not with, you give the numbers, it is not the number that counts. There are many things. They have number of publications. We are featured, and all our good work that we are doing, we'll always publish in their newsletters. For an example, QS newsletters or THE newsletters. Here we are visible once again. Here the globalization comes through the ranking. Next, coming to our benchmark. Where did we set our benchmark? We knew, we participated in the THE impact ranking and innovation ranking. Our strength was SDG 3, good health and well-being. So we worked, and it is completely, this ranking is on qualitative data. There is no quantitative data. So it was very difficult for us to initially start. Now still all the constituent colleges are helping us, departments are helping us. We take the qualitative data, we submit it, and here we are. We set the benchmark. JSSHR is in the 20th rank in the world, which equal par with the other leading international organizations and the higher education institution. So this also took a long time. For this, we worked about 5 years to understand the parameters, to collect the data and qualitative data. And they were telling about the compendium. Every institution here, they are making a compendium on SDGs. That's all is helping us to be featured here. Coming to the next, this I would like to project with happiness here. And it's also a pride movement for JSS Academy of Education Research. It is a case study. So when we do it, all the heads sitting here, all the teachers sitting here, it is possible by your institution also. This is what I would like to say on behalf of our institution. What happened? I started the slide telling our strength was citation. We understood. Our visionary leaders knew our strength was citation. Our publications are excellent. We have got it to Scopus. Right from the time of the inception of this organization, all the pharmacy colleges and medical and dental and all the other departments, they started the publication. So citation was a strength. So when we took that as a challenge in 2020, you can also view this. It is available, open to public. Our citation from 2019 to 20 reached 100. And we are in the top 400 in the world. And compared to Harvard, they are top 2 in the world. When it comes to Times Higher Education, World University Ranking, we are very happy that our citation is comparable with Harvard University. The outcome was that we have collaboration with Harvard University now. Here the globalization continues. So we took a time, yes, it was a difficult task. We put ourselves, we identified the team, everyone cooperated, every individual in the organization cooperated, and we are proudly saying this today. It is achievable by everyone who's sitting here, and I wish and hope on behalf of our organization, JSS Academy for Education Research and JSS Mahavidyapita, that we wish all the institution, pharmacy institution, will go ahead with this international ranking and will be featured. Why? Because there's a possibility. You can see here, subject pharmacy pharmacology. It is near to us. We featured for the first time in subject ranking pharmacy colleges. JSS Pharmacy College, Mysore, and JSS Pharmacy College, Ooty, is not only topping in the top 10 in NIRF nationally, they are also topping in the world. They are in the first 150 institution in the world. So how did we achieve this? Again, participation in the ranking. When university went in, slowly they brought the other disciplines, other institutions along with us, other constitution colleges along with us. We have already medical and already pharmacy being featured. We are looking forward in near future for dentistry and also life sciences to be featured in near future. For that, again, we are working. We have a team to work with. The team is not in the university. The team is in the constituent colleges and the department. They work along with us, and we try to improve the performance. So this is where it is. When JSS Academy for Education Research can feature in pharmacy and pharmacology, and when we are in top 150, it is possible by every pharmacy college sitting over here. So this is what we could give a takeaway message from our end, and this is what our Pro-Chancellor asked me to convey also during this speech. So this is his vision, and this is direction that I am presenting. And what did we achieve? This was already beautifully said by our previous speaker. Categories, upgradation by UGC. We got it because we are top 500. We are in top 50 in NIRF. Our pharmacy colleges, dental, medical, everyone is in top 50 and they are in top 10. So we got the status upgraded, category upgraded. Academic programs, they developed, and international programs came in. Online teaching and learning, there's a remarkable growth. Research, publication, patent innovation, international collaboration comes in. Admissions, where whatever you see the admission, we have a number of now international admissions coming into us. Though NEET came in, it was a big shock for us, a big challenge for us, because health sciences based institution, we could not take the international students. But here it helped. Life sciences, pharmacy, now the international students are joining, and we have international faculty, adjunct faculty, international students coming along and joining us. Then quality of the staff, students increase, outreach and sustainable practices improved. Finally, good governance and leadership, that which improved through all this ranking, because they trained us, they told us what exactly is required. So this is how the whole of the process, the case study, I end here. So this is the references that you can use it for, because whatever is available, and with my whatever the experience that I have for 1 decade, I've shared it. And I thank the APTICON 2020, the organizers, for giving us this opportunity for showcasing our case study here, so that every institution will be inspired to move forward, so that we show the world that we are worth it. Next, I would also like to thank JSS Academy for Education Research for not only me, all my colleagues, for giving us an opportunity to become the leader, to become the administrator from the pharmacy colleges. And we stand here proudly because we worked with NAC, NBA, NABA, NABH, everything. That was a difficult time, but they gave us an opportunity. So I thank all the leaders of JSS Academy for Education Research for giving us an opportunity and helping us to take the university to the next level. And to end, say we worked for 4 years or 5 years, but this automatically, if you see why we have put there, the 6 months, what the seed you put in, and we worked for 4 to 5 years, automatically comes now. So this is what is needed, that you have patience, work. Definitely we all will achieve. All the pharmacy colleges will achieve this one day, and all the universities present will also achieve this one day. And many institutions are higher than us in NARF and THE. And we don't have an unhealthy competition. We'll take them as our leader. We'll take them as our role model. And we see what goodness is happening. We learn from them. This is one more thing that good about the teaching profession is that we always learn the good from everyone. So we learned it, and then we always feel ranking matters. You like it or not, ranking matters for the survival of higher education institutions, especially in India. Thank you for the opportunity. Thank you.
So Dr. P. Nilani, so no introduction is required. She is known to all very well. Started as a faculty in JSS College of Pharmacy. Due to his funding and interest to go into administrative side, and especially to working for this ranking. One of the important aspect is that her interest to work on this and get the various type of rankings. So in the first slide and the last slide, so when I have seen now the JSS University, apart from the logo, there is a line of rankings: NAC, NIRF, NBA, QS, I Square. So there are various type of rankings with a great effort of Dr. Nilani and the leaders of JSS University. They have achieved a lot. So today's this lecture, Nilani has given not the data, how to arrive the data, but she has given a roadmap. She has given a roadmap how to go about these rankings and what are the benefits for the organization because of this ranking. The institution or the university from national level to international globalization. Recently, the University Grant Commission has issued a letter notification that 20% of the intake can be the supernumerary intake. Admissions can be made in the universities from the international students. So like that, one communication UGC has made in this academic year, we can take 25% of the supernumerary seats in various faculties. So this and all will, these rankings and all will benefit to attract the more international students, and as well as we can provide the quality education. So here I want to quote that failure is an experience and finally it leads to success. So where we have to start, that is very important. So now it was that here lecture and other Mageshwar Peri and that Rangasamy, they have given very highlighted various ranking systems. So it has, I hope
for all the institutions and the universities that we can go for a ranking, and our JSS University is there to hand holding with you, and you know that the generosity to help on all aspects for achieving excellence in the education. So I request all the institutions, those who are not started working on the ranking system, so you can start working on that. I also had a experience in this ranking system in my university, Vinayaga Mission Research Foundation. We have completed the second cycle of NAC and we have got the A grade. First cycle we got A, B double plus, but after that we have increased our benchmarking and we worked. We identified our strengths and weakness and we worked on that. And the second cycle we have achieved A grade. Now we have started working in another 5 years period of time. We want to go to next level, A plus and A double plus. We have started from beginning now itself to achieve A double plus. The same way NIRF ranking also. So we have in the 2 years back we were nowhere between 150 to 200. Now we have moved to 101 to 150 ranking. And next year we are all working for coming below 100. So as because of this NAC accreditation and NIRF accreditation in India, as we told that we have research grants we can get, admissions we can get various level we can move to start these dual programs and innovative programs, autonomy for the institutions. These are various benefits we can get due to this ranking system. So we thank Dr. Nilani for his wonderful presentation here about this various international ranking system. Thank you very much.
Thank you, sir. On behalf of local organizing committee, I extend thanks to Dr. Nilani ma'am. I request the chair and co-chair to felicitate the speaker. I now request Dr. Bangaru Raju, Professor, JSS College of Pharmacy, to felicitate the chair and co-chair. Please, sir. Thank you, sir. Before we move on to the next series of the plenary lecture series, I now request Dr. Rohit Datta, Dean School of Medical and Allied Sciences, Goenka University, and Dr. Dipender Singh, Member PCI and Assistant Professor, University Institute of Pharmacy, Pandit Ravishankar Shukla University, to release the practical manuals for the Diploma in Pharmacy as per the new Education Regulations 2020. Please, sir. are available in the Nirali publications. The books are authored by and Dr. Shailesh sir. Exhibition Expo, the books are available. Thank you, sir. We are moving with the next plenary lecture series. The topic for the plenary lecture series is teacher quality and student support. And to do the same, I request Dr. Raman Dang, Principal, Kripanidhi College of Pharmacy, Bangalore, and Dr. Anil Pite, Principal, Datta Mege College of Pharmacy, Nagpur, to chair and co-chair the sessions respectively. I invite the first speaker of the session, Dr. S.P. Dhanapal, the Principal, JSS College of Pharmacy, Ooty. Sir, please, sir. I request the chair and co-chair to take on the session.
Yeah, good afternoon, friends. The session is slightly delayed, but I think it's going to be worth it, because our friend and learned person, Dr. Dhanapal, is making the beginning for the theme Teacher Quality and Student Support. So I'll request our co-chair, Anil Petty to introduce Dhanapal ji.
Thank you, Dr. Raman, sir. Very good afternoon to you all. It's indeed a moment of pleasure for me to introduce the first speaker for this session, Professor Dr. S.P. Dhanapal. Sir is having 130 presentation across the globe in conferences, workshop and seminars. He published 127 peer-reviewed articles and they were well cited. Of note is booklet on 350 medicinal plant being used by tribal people of Nilgiris Hills and giving guidelines for the preparation of household remedies was well received by community. He served as an executive council member in numerous apex bodies, both at national as well as international level. Selectively, Hudia Advisory Committee, Department of Science and Technology, Republic of South Africa, Indian Pharmaceutical Association, Indian Pharmacognostical Association Society, APTI. Sir has received a research grant of more than 1.5 crores from DST, DBT, ICMR, Ayush. With this, he already guided more than 16 PhD students. With this brief introduction, I request Professor Dhanapal sir to deliver his talk. Over to you, sir.
Change this one? Yeah. Very pleasant good afternoon. I submit my pranams to the Lotus feet of His Holiness Swamiji of Suturmat. Respected dignitaries, the chairpersons on the dais, fellow colleagues, distinguished delegates, once again, good afternoon to you all. Thanks the chairpersons for the nice introduction. And I'd like to extend my heartfelt thanks to the authorities and the organizing committee of the APTICON 2020 for giving me this great opportunity to share my views and thoughts on the topic, students support the missing elements. I bring greetings from the staff and students of JSS College of Pharmacy, Ooty, the off-campus college of the affiliating University JSS Academy of Higher Education and Research, the host of this great event. Yeah. It's a formal disclaimer that the presentation is prepared based on the resources available in the public domain and also based on my personal interpretations and experiences. So neither the presenter nor the institution shall be held responsible for any consequences. It's not moving. Yeah. The next 15 minutes of the time, because I don't want to take much of the time, as already we are lacking behind about more than 1 hour. I'll be discussing about what is meant by the student support services and what is the present status of the student support services in the higher education institutions and what is the present context of the missing elements in the support services. And finally, I'll be discussing about the important neglected elements in the student support services being offered by the educational institutions. It's okay. Today, every country is striving to enhance the higher education, both qualitatively and quantitatively, because the economy of a country is directly influenced by the intellectual capital for the particular country. An important factor that affects both the quality and quantity of the higher education is the student support or the facilities being provided by an institution to the students. So, a comprehensive and consolidated student support services has become vitally important for the academic, career, social, welfare, development and growth of the students in the higher education institutions. So what is student support services? It's a support or the facility extended by an educational institution or the higher educational universities to their students. Of late, it has become a key function or the crucial aspect, not only for the success of the students, also for the success of the institution and also the success of the program. By providing the quality student support services, the intellectual, physical, moral and social development of the students, and this facilitates the students' focus on their education. So the greater efforts are needed to facilitate the students in their cognitive as well as the emotional growth. The higher education institutions must act as a local parentage for all the development of the students. The quality of the higher education depends on the services provided in various modes. If the institutions are deficient in providing the student support services to the students, then it does not serve the purpose of the education, just merely distribution of the degrees only. Higher education institutions in India. Higher education institutions are considered as the gatekeepers, disseminators, and the creators of the knowledge. The most important pillars of the higher education institutions are the teaching, research, and student support. Although many institutions offer a wide variety of the services, they are not very well developed or adapted to the needs of the students that are in constant growth and diversification. The students have the different needs that demand the satisfaction, like learning needs, survival needs, counseling needs, and entertainment needs. The rapid increase in the enrollment as well as the diversity of the students, competition among the institutions to attract the more number of the students, and focus on the students' retention force the higher education institutions to provide the student support services to their satisfaction and expectation. The term student services or support is not new one to the higher education institutions in the country. If you see the present scenario in the Indian context, the student support services being provided by the education institutions are treated as having shrunk, and these are all considered as the requirements for the statutory bodies. But frankly, if you see, these are the requirements of the affiliating, approving, accrediting, and the ranking agencies like Pharmacy Council of India, All India Council for Technical Education, National Board of Accreditation, NAC, UGC, NARF, etc., etc. So some of the most common student support services, which are generic, which have been claimed by all the higher education institutions as per the requirement of the statutory bodies, are the Anti-Ragging Committee, Internal Compliance Committee, Grievance Redressal Committee, Students Counseling Cell, and Placement Cell. So my objective of presentation will be on discussing the missing elements in student support services and the neglected elements in the student support services, and also beyond the services extended apart from this list. I would like to categorize the missing elements of the student support services into 5 headings. Complete student life cycle is not supported. There is no laid-down policies and procedures. Students are not well informed about their services offered by an institution. No systematic feedback on the services, and outcomes of the services are not assessed properly. The first one, this is the typical model of providing or offering the student support services to cover the entire life cycle of the students from the pre-entry, during the progression of the course, and during the exit of the course, and after becoming graduation and becoming alumni. At the time of the pre-entry, the students should be supported, the prospective students should be supported by giving the support to select a right course and also right institution, and induct the students, after taking the admission, induct the students to the systems of the institution, and by providing the 360-degree orientation program, it may be of the short-term or the long-term orientation activities. During the progression of the course, various supports or the services like academic support, library facilities, performance monitoring, feedback systems, job readiness, industry linkages, life skills, counseling, health and wellness, and the personnel also should be provided through their referrals. And at the phase of the exit, the students should be engaged with the soft skill development programs and also career counseling programs to pursue their higher studies. to take up the employment, self-empowerment, work placement, and also finally, after graduation, the alumni members should be properly helped, properly tracked, and also mutually helped. Thus, the student support services should be the comprehensive program implemented by the higher education institutions from the pre-entry to post-entry life cycle of the students. So there are three typical level of the student support services. As we move up in this pyramid, the tier 3 needs intensive or the individualized support for the students. This may be required only for the few selected students. If you see at the bottom in the tier 1, we are giving the full support or the service to the commonly for all the students as like the library services. The tier 2 support is given or the service is given only to the selected group of the students, like for the poor performance, we will be conducting the tutorial classes, and third tier 3 we will be giving the assistance or the support only to the very, very few selected students, like counseling for the needy students. Thus, identifying the student subgroups across the life cycle and offering the appropriate services is the very vital for the success of the entire program. There is no, each and every student support services should have the policy, guidelines, and SOPs with clearly defined purpose of the services provided, scope, policy, procedure for the implementation and outcome assessment, and the team and key contacts of the individual responsible for extending the service with their email ID, mobile phones, and toll-free number. It's not only important to frame the guidelines or the SOPs, and it should be compiled as a handbook of the student support services, and it should be widely circulated to make aware of all the students through the proper circulars, and also it should be made available in the web portal in the particular institutions. This is very, very important missing component, that is the feedback process. Until otherwise, we collect the feedback, the further improvement and strengthening the services being provided to the students by an education institutions is very much limited. So the collection of the feedback of the services provided is very, very important component. And the information technology, which is a modern mean of the knowledge and communication, is to be embraced in the feedback system, and so that the quality of the student services being given by the IT-related assessment system to cover the quality of the teaching, research facility, campus infrastructure available, and the facilities given to the students like sports facility and ICT facility, and also to cover the co-curricular and extracurricular support. So there are good number of web tools are available nowadays to get the feedback surveys through surveys and also polls. So these are the 17 representative list of the tools which is available, and there are good number of, other than these 17 representative still, there are other tools also available. The individual institutions can explore the possibilities of having the more number of the tools to collect the feedback, and after the collection of the feedback, it should be analyzed properly, and the reflections on the feedbacks collected for the are essential for the successful implementation of the student support services. In continuation to the collection of the feedback, it's important to assess the whatever the data gathered from the feedback system. The assessment is a continuous and cyclic process that should comply with the professional standard. When I mention the professional standard, the minimum benchmark of the other top institutions where the 100% satisfaction level of the students is there. That should be compared. And each university and institution has its own strategic plan. It may be of the long-term strategic plan and short-term strategic plan. And these strategic plan accomplishments and the student learning outcomes also should be assessed along with the assessment of the feedback. And this is the typical assessment process. The established outcome based on the unit goals and identify or develop the measures, gather the data, analyze the data, interpret the results, and use these results for the further enhancement or the improvement of the services provided to the students. So these are some of the missed elements given in the last 5 domains. And let us move on to the neglected elements of these student support services. And generally, these neglected elements or this type of the supports are available. They are not really missing, but some of the aspects of these elements are not taken into serious and they are not being followed and they have been neglected. But they are available only on the paper or the signboards just to satisfy the regulatory bodies. Let us see one by one. The first one is the identifying the human resource. Generally, the faculty members are considered or delegated with the additional responsibilities of providing the services based on their experiences and as an additional responsibility to support the students in various aspects. But sometimes, except the few of the faculty members, some of them are not really interested and they don't want to share their time and also they don't want to share their expertise. And the faculty members must be encouraged to take up this additional responsibility apart from their academic workload. And sometimes whenever the faculty members are actively involved in the student support services, their workload also to be considered to have the minimum number of the workload per week and also engage them fully to give the services to the satisfaction of the students. As I told you, the IT should be embraced for the collection of the feedback. Similarly, the IT-related integrated student support services where some of the elements are neglected or there is dedicated IT professionals at the institution or outsourced experts should be available, which is not very commonly available in most of the institutions. Online registration, payment, certificate, etc. will ease the life of the students. Online procedures for the compliance, handling and resolving any difficulties or disputes. Video guidelines or procedure for various services. Auto-generated emails, messages as reminders to students on various aspects. 24/7 online student services and technical help desk services. And policies on the bring your own devices, including mobile, small screen devices. So some of these elements are not available. These have been neglected. And the third one is the pedagogical support. The students to be clearly informed about the pedagogic support they will receive in each course. It may be of pedagogic techniques or the pedagogic approach. The use of the asynchronous and synchronous online tools like email, forum, chat, video conference, etc., and access to recordings of the synchronous sessions. And fourth one is the support of the e-learning and online courses. So after this pandemic, so in the last 2 years, the term e-learning and online courses have become very popular one, and the universities and the institutions are started providing the various online courses and also the e-learning facilities as a part of their curriculum. But still, some of the elements are missing here, like orientation and training on the e-learning skills, well-designed online guides, web pages, video tutorials for the IT tools required for the students' e-learning studies, information about the institution, faculties, degrees, courses, registration procedures, academic and assessment calendars with easy and clear navigation, full description of its learning objectives, credits, content, requirements, learning and assessment methods for each study of the course, advice and counseling over choice of the courses and progression through a program is to be provided. Library services is another important component, as the library is the integral part of an education institution. The online library resources are available 24/7 to all the students, and training to students in digital information literacy and equivalent library service for its learning and its campus-based students. Last one is the student groups and clubs. Every institution has the small groups or the clubs like music group, cultural groups, sports group, etc., etc. And some of the neglected elements here are the proper functioning of the students group clubs via social media, blog discussion, forums, which is to be encouraged and also ensured. Support learning, interaction between the individuals and within the groups, social interaction between the students and feedback on students' experiences of their program to be provided. A clear statement about the code of the behavior and etiquette that applies to the students on external social media also to be given. Formal and informal online mentoring and peer-to-peer help and learning to be encouraged, and the social media to be used to offer dynamic interactions with the students in order to give them relevant or interesting information, as well as to engage and motivate the students. So these are some of the neglected elements of these student support services. And these are some of the references for further reading. To conclude, the higher education institutions should provide these student support services as a program, not just as a service, just to satisfy the regulatory bodies. Thank you for the patient hearing.
Thank you, Professor Dambal sir, for delivering this first session. Now I request our chair to summarize the session.
Yeah, first appreciation is that you kept the time precisely exactly 20 minutes. I think we should applaud for that. A good speaker always keeps up the time you have done. And this presentation and your description is excellent, sir. As a chair, because I'm integrally involved in student development programs and I'm very much interested. All the aspects you have covered. The best what I appreciate is the feedback system. We may have so many things which are documented, like maybe internal complaint committee, anti-ragging, mentor-mentee. Seriously, the staff has to take. There needs to be trained, that neglected element. They are not trained. They are not professionally aware what exactly is expected. Okay, personal profile. Okay, what the students needs, and pass it on to principal or higher authorities. But they have to know, and you have covered that canteen also. They have to see toilets or anything to do with element that totally concerns the student development is very, very appreciable. And those support systems are necessary. It's not only teaching learning. These days we have to groom them, counsel them, take them to next level. We see at home itself, it is not easy. We need to listen to them first. And these concerns are very, very important that you have dealt very nicely. And I take home myself such kind of message through your presentation. Another thing interested what you told about HR planning, training of trainers that I have already, and e-learning is very much happening thing, because e-learning is a real connect globally, how the things are, clubs formation, recreation. In a semester system, I think all of us principal teachers face these challenges. To integrate and develop a foolproof system will bring about the overall personality development of the child. So skill development was a challenge. Now this student support is also a very, very big thing that you have dealt nicely. Library, everything precisely done. So apart from appreciation, I will not have any question for my friend, but in the audience, if anybody has any question for sir, free to ask. Very, very burning topic he has dealt. Okay. If not, then we will conclude the session. Thank you, sir.
Thank you.
On behalf of Local Organizing Committee, I thank Dr. S.P. Dhanbal, sir. I now request the chair and co-chair to felicitate Dr. Dhanbal. I now invite the next speaker for the session, Dr. Sohan Chitlange, the Principal, Dr. D.Y. Patil Institute of Pharmaceutical Sciences and Research, Pune. Please, sir. I request the chair and co-chair to take all the session.
I request Dr. Raman to introduce Dr. Sohan Chitlange.
Sohan Chitlange is another popular figure, and he will be talking on this theme. He is the principal of Dr. D.Y. Patil Institute of Pharmaceutical Sciences and Research, Pimpri, Pune. Dr. Sohan Chitlange is presently working in the same institute. He is a recipient of G.B. Singh Gold Medal Award, Hussaini Award, and many more awards through Nagpur and other universities. He has 24 years of professional experience and has more than 100 research papers in very impactful journals, 6 books, 12 monographs in reference book, and 10 published patents to his credit, and is actively associated with various professional bodies. Round of applause for sir. Presently, sir is the Vice President, APTI National, Chairman, Brewers Pharmaceutical Chemistry, SPPU, Member Academic Council, SPPU, Member Research and Recognition Committee, SPPU, and Nanded University. Member Brewers, Amravati University, KL University, Dipsru University, MIT University. He is the recipient of Best Principal Award 2018 by Oriental University, Indore, and Best Principal Award 2019 by Savitribai Phule, Pune University, and the professional category. And yesterday he received the APTI IPR Best Principal Award, which was due from 2020 at national level. And he is a very enterprising gentleman and the best human being I have met. Sir, over to you.
No. Very good afternoon to all of you. Yeah. So I'll be talking about faculty development. As we all gurus are gathered here. So first I want to start with Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma Tasmai Shri Guruve Namaha. So my greetings to all the gurus present over here. These are some of the hard facts. Before I start with my session, we all know all these facts, that the most important stakeholder of any of the institution are students. And they are the reason for the existence of the institution. All institutions, they strive their best to provide best quality educations to their student. Whatever the time and investment they are doing, we have to return that in a best possible way. Progress of any community, state, country or region, it totally depends upon the standard of the education. And who delivers this education? They are the teachers and professors. So any institution is a good or bad institution depends upon the teachers of the institution. So teachers has that moral responsibility to see to it that they are delivering to the best of their abilities. Now, Dhanbal sir has already given a nice presentation about the student support system. So what is student support? And he, in his presentation, he has highlighted also that other than teaching and conducting the practicals, the teacher need to do lot many other activities. So whether it is a counseling, whether it is a mentoring, so this all load is with the teachers only. So if there are good quality teachers available, the good quality will be delivered. So good quality teaching practices are directly supporting to the good support system. So coming to my point, teachers, quality teachers improvement program or teachers development. So what is expected from a teacher? So we all know these are the important things which we expect from a teacher, that he should be passionate. If a teacher is passionate, then only he can produce the passionate students. He should have respect for his own profession, for the teaching community, and he should be respectful for the students. Integrity, that is the most important parameter. that is honesty. Then he should motivate his students, his colleagues, society at large, and he should have ability to create self-learning environment. And ultimately, the teacher is one who is responsible for developing the leadership amongst the students. A best quote from Albert Einstein: I never teach my pupils, I only attempt to provide the condition in which they can learn. And we need to think on this line that how much we provide these opportunities to our students. So there are so many difficulties, as now we have discussed, like the teacher don't have to play, he don't have to conduct the theory and practical, but there are lot many things the teacher need to do. So that from teacher's point of view, teacher is a counselor, teacher is a mentor, teacher has to conduct exam, teacher has to do lot many other things, and he is involved in lot many institutional activities. So whether nowadays, now we all know that all institutions are running behind ranking, and there is NIRF, there is NAC, there is NBA, a lot of documentation work is there. So teachers are involved in that. So how much time teacher is devoting for actual teaching, that is a point of discussion. Then with respect to the changing trend in the curriculum and the changing trend in the student perspective, like there are technologies coming up, new things coming up, students' expectations are different. So with respect to that, what teacher need to do, and ultimately the teacher's aim is finally to produce a lifelong learner. The student should be a lifelong learner. And there are other issues also with respect to teachers, that is inclusivity. Like the teachers in our education systems are coming from a different socio-economical background, race, ethnicity. Then there are some teachers who are introvert, need some different kind of trainings. Then the compensation which are being offered to the teachers, we are talking about teachers' quality, but the compensation throughout the country which is being offered to the teachers, not only to the pharmacy teachers, take any teachers. So that point need to be discussed. Then the expectations from the teachers are widely increased. Whoever is there, like whether the doctor is there, or engineer is there, or a lawyer is there, teachers are producing all these engineers, doctors, lawyers, but the teachers, what about the teachers' expectation and salaries? And this is overall impacting the teachers' emotional quotient. So we need to ask, as a pharmacy teachers, like what we are delivering to our students. There are a lot many changes in the curriculum happening all over the globe. The new technologies, the upcoming technologies are playing important role over there. So are our teachers are ready for that, and are they delivering to the student as per the market expectation? Right now the scenario is, though we are changing the syllabus, like every 4 years the university are asking to change the syllabus, but there are so many new areas, developed areas which need to be addressed. So now AI has come, precision medicine has come, our majority of students are working with pharmacovigilance, with medical coding. These are not there in our syllabus. So the core pharmacy syllabus is different, and what we are delivering is different. So we need to work on this also. And this is what the expectations of the industry is. And to deliver this, there is a famous quote again, it goes without saying that no man can teach successfully who is not at the same time a student. So we as a teacher need to be a learner first, and then only we can deliver to our students. So a modern quality pharmacy guru, what is expected from the guru is not, he is not only well versed with the theoretical and the practical concept of the subject, but he should be ready to deliver the right content at right time confidently. He should know what students want. Then he should be well versed with the advanced technologies, and that's a challenge which need to be dealt with. And what's the way out for this? Now here in this 20-minute talk, a simple, we all know that there are quality improvement programs being conducted by majority of the institution, and there are sponsored QIP programs are also available. But how many of teachers participate into all these quality improvement program? How many of teachers are being deputed for this quality improvement program or faculty development program? That we need to think upon. And there I am proposing this TQIP concept, that is Teacher Quality Improvement Program. And if we go with this Teacher Quality Improvement Program, definitely will be able to improve the teaching learning process, and which will ultimately produce the more productive and satisfying student that will give more satisfaction to the teachers also. Some of the steps which can be followed while developing a quality improvement program: a set of the objectives should be there. Then we need to select appropriate teaching methods, training methods and resources. We need to assess for attainment of learning and training objective, follow up of the reflective practices, allow teachers to experiment with new knowledge and skill, and give them more time, efforts and resources to come out with the best version of their self. So a phase-wise approach is required, wherein a teacher should be a learner, teacher as an adopter, teacher as a co-learner, teacher as a reformer or rejecter, and teacher as a leader. So first is teacher as a learner. So every teacher has said, like, if we have to deliver, we should know first. So we should be the learner first, and then only we'll be able to deliver. So the first and important step in any teaching is information gathering, then learning to bridge gap between the teaching and technology. So there are new technologies coming up, and the best teaching learning practices need to be followed by the teachers. Then teacher as an adopter in the next stage. So once the learning part is done, the teacher need to experiment with the technology. Different type of advanced technology teacher should use while delivering the content. He should work in the lab with the students, with the peers, and actually he should imbibe all those qualities which he is expecting from his student, and then only he'll be able to deliver that. Then teacher as a co-learner. So teacher should work with his colleagues also. It is not like I know everything, so there is no need to interact with the others, or no need to work with the others. So teacher need to work with, so they learning to bridge the gap between curriculum and technology, more focus on using technology to enhance the instructions, imparting discussion-based learning, and student feedback can be useful at this particular stage, that whatever I am delivering, whether that they are able to understand or they are not able to understand that particular part. And teachers as a reformer or rejecter. So in the fourth stage, the instructor either affirms or rejects certain technological methods. So in the third stage, he has seen that there are various different methods which can be used to deliver the content. But in the fourth stage, not necessary that the same technology is applicable to all the students. Like not all students are from one particular background or one particular set. So not necessary that same methods can be used. So he should be in a position to see to it that if it is not working, he should reject that also. And then she should assess the impact of technology in the using. And teacher as a leader. So once if a teacher goes through all these 5 steps as a learner, adopter, co-learner and rejecter, then ultimately he produces someone, he becomes someone who can deliver to the expectation and who can produce the future leaders. So this QIP model which I am proposing is, there are 3, it should have 3 models, that is model 1, 2 and 3. Either it should be conducted in a 3 weeks or 3 months, depends upon the institution and the slots available, wherein the first model should be face-to-face mentoring for professional and interpersonal skill. So as now in the previous slides, I have discussed that teachers are coming from a variety of background. So some teachers, they have the language barriers, language issues, some they have difficulties in using the technologies. So that is first is face-to-face mentoring for professional and interpersonal skill. Even the soft skills which are required, the variety of skill as a teacher we need to perform at every layer. So that is the first module wherein one can work. The second is, after completing this for a period, at least for a week time, they should be given. And then second is to go on, to move on hands-on approach, wherein whether now we conduct QIP programs, many of our faculty participate in QIP program. All these QIP programs are technical QIP program, subject related QIP program. Nobody teaches with respect to the delivery of, as a teacher, what is expected from you. So that way we can plan this thing. Then emphasis on the individualization of the instruction, whatever the instruction methods you want to use, then infusion of technology into the curriculum and research. So depending upon your subject, your specialization, your research interest, there you need to work on. And the third module, developing a learning community, mentoring, sharing, and increasing level of motivation to teach with confidence. So what we do, like now this gathering, today's gathering is there. It is like we are sharing, we are sharing with each other the good practices, the practices which are being followed at our institution, how a teacher should deliver the content. So, and that not necessary. So this is whether every institution can go with this concept, or as per the requirement of the institution, they can modify this thing, because there are institutions in the metro cities, institution in the city, and institution in the rural area, and different, the faculties are from different background, different expertise, and their focus are also different, and the students are also from different areas, different expertise and different background. So this can be worked out. And this will lead to the complete development of a teacher. So the professional development, the development in the instructional, the teaching methodology, the way the teacher is going to deliver, personal development and organizational development. So the personal development is, as I said in the module 1, if we go with the module 1, that will develop an interpersonal skill, will lead to the career development of that particular faculty. Then instructional development, because the faculty will be exposed to the new technologies, new teaching methodologies. So there will be the advancement in the uses of those technologies, and faculty can play important role in the curriculum design and development. Professional development, so teacher will have his own individual image improvement, and he will be well versed with what is expected as a teacher from him. He will be able to work on the attributes which are being required. Then these are the professional improvement on the part of teacher. Then organizational, if the teacher is delivering best to his capacity, automatically the organizational improvement, organizational performance improvement will be there. And this will help to build the improved institutional environment to support better and teaching learning practices. What is the roadblock for this right now? So in case of professional education, it is not mandatory, or there is no policy with respect to the teachers training. In case of elementary, primary or secondary school teachers, there are D.Ed programs are there, B.Ed programs are there. Teacher need to first, even one is a postgraduate, or he has to take that additional degree or expertise, and that then only he become a teacher. What about the technical institution? Like at our institution, like directly after completing M.Pharm, we are appointing student as an assistant professor without any exposure to the teaching, without any guidance to the teaching. They are directly being forced, and they stand before the student and start delivering from the first day. So there it comes that we as an institution, we as a if we want to build a teacher's quality, so we have to come up with some policies or some structured framework to develop good quality of the teachers. And in what can be done? So from my point of view, these are my concluding remarks. The faculty development is very important component in pharmacy education, and it is directly related with the end user, that is student, because the quality of teaching will decide the quality of the student going out from your institution. Like your output will directly depend upon the input you are giving. And first is encouragement towards academic advancement. So evidence suggests that teachers who have earned advanced degrees have a positive impact on his or her teaching. So I am not saying that a 3-week program will bring a big change in the delivery. It is a continuous process. So as an institute also, if there are 20, 25, 40 faculty, 50 faculty available in the institution, and over every year or every alternate year, if we plan for some structured module for the development of the teacher. In that case, the advancement will be there, teachers advancement will be there. Then the institution should support teachers for the faculty development program. They should depute teachers for all these activities. So whether it is like giving them the leave of absence or travel grant, there are agencies. I know that I'm not talking something new. This is there. Even the PCI's continuous education program is also there. But how many teachers are taking advantage of this, or how many teachers are being trained on this line, or the structured effort by the institution in the teachers' development? That I am talking about. And for that, if suppose we go with this concrete framework, as every institution can come up with good quality of teachers, then as one of the agenda of APTI is establishment of Teacher Training Institute. Yes, see, I am with APTI since last 10 years, and now we have land available, and this body we have started working, like for funds we are working on. So I have a different opinion on this. Yes, Teachers Training Institute should be there. One Teachers Training Institute, a headquarters will be there. But what if we go with the regional, state-wise training centers? There are good institutions available. If we recognize those good institutions as a regional center, and if a complete framework is given that this is how the faculty development program should be conducted, and from that particular region, from that particular area, if the teachers are coming and taking training over there, this will automatically start. And then for advanced training, yes, Teachers Training Center at one place, okay, the headquarters is at Bangalore. So the student, the faculty member can come to the Bangalore for the advanced training. But the basic training as a teacher which is required can be delivered at various institutions if we go with the regional center. So whether it is a state-wise center, region-wise center, that can be worked out, and it depends upon the implementation. So that is a point of discussions also. Then because we are talking about teachers' quality, and if we want good quality teachers, definitely need to pay good, and for that regulator has to work. And if the regulator comes with the good policies, the recruitment and promotion policies and the code of conduct for the teachers, then only we can come up with the good quality teachers, and overall professional upliftment will be there. Then the revival of fellowship and travel grant, then recognition and encouragement to the teachers, and incorporation of technology in pharmacy education to upgrade the teachers. And what at the end, what I want to say is, now majority of the institution, they are having fresh MPharm graduates as their teachers. So if we catch them young, so while doing master's program only, if we are giving them training that as an assistant professor, as a teacher, what is expected from you and what you are supposed to deliver after joining that particular institution, where we will have a ready good quality manpower teaching force available to deliver. And that my topic was how to, like, quintessential enigma. It is very difficult to give something concrete plan of work for the teachers development, because though our intentions are good and we want to deliver, but there are lot many issues and there is no concrete solution for that. Only thing is, faculty development is a continuous process, and this should continue at the institute level first. Don't expect that any of the organization, any of the professional bodies attending those programs will lead to the quality improvement and the quality. At the institute level, first quality improvement program should be implemented. It should be for every faculty, whether a senior or a junior, the freshly joined or working from last 15 years, because there are drastic shifts in the technologies which are being used, and everybody need to get acquainted with all that. Coming to the end of my slide, teaching is a walk in the park, if that park is a Jurassic Park. Thank you.
Thank you very much, Dr. Sohan Chitlange sir, for your excellent deliberation on the topic faculty development, quintessential enigma. I think as a teacher, this is the most important aspect
that teachers needs to be trained and educated. As you have already mentioned that when our teachers are, when our faculty member, we are recruiting at our institute, they are only MPharm graduates, and during their graduation or post-graduation, they were never taught about how to teach. If you see about the humanities courses, they have the specialization that is Bachelor of Education, B.Ed or D.Ed or M.Ed program. We don't have such type of programs, and that's why the need of the training of the teachers is very essential. And you have touched the right chord, though we have, it was an injustice on you that giving only 15 minutes time for such a topic. When I spoke on a similar topic at your institute, you gave me more than 2 hours. So you covered the most important thing, that is you proposed that about the TQIP program. I think this is the good initiative that on behalf of APTI, we should think about this model where you have proposed about the phase-wise approach for this TQIP, that is teacher as a learner, adopter, then co-learner, leader, and benefits of the TQIP program. So I think it was excellent deliberation from your side. Very nice of you, sir. Thank you very much. If any teacher or any student, if they are having any question on this topic, they are most welcome. We'll take only one question. So I think there is no question. Thank you very
so
much,
much.
sir.
I want to thank JSS for giving me this opportunity and APTI for platform. Thank you so much.
Sir, on behalf of local organizing committee, I extend warmest thank you to you, sir. I now request the chair and co-chair to felicitate Dr. Sohan Chitlange, sir. Thank you, sir. I'm honored to invite the next speaker of the session, Dr. Bala Prabhakar, Dean Shobhaban Pratibha Bai Patil School of Pharmacy and Technology Management. Please, ma'am.
Till Madam walks up, we have the pleasure of having Dr. Nagavi here. Dr. Nagavi has done many teachers training program through Rajiv Gandhi University of Health Sciences. He was also the editor of IGPR. So I think, sir, he has done justice to the topic. You will appreciate. Yeah. So nice word of appreciation from Dr. Nagavi. I'll request my co-chairperson, Dr. Anil Pete, to please introduce Dr. Bala.
Yes, ma'am. It's a moment of indeed pride and pleasure for me to introduce my ex-boss. She is Dr. Bala, colleague, Dr. Bala Prabhakar. She is Dean at Shobhaben Pratap Bhai Patel School of Pharmacy and Technology Management, NMIMS University at Mumbai campus. Ma'am, she has done her PhD from SNDT University, B.Pharm and M.Pharm from Andhra University. She is having more than 38 years of experience. She work at various eminent institute like Directorate of Health Services, Andaman Nicobar Administration. Then she work at AICT as advisor to CU Shah College of Pharmacy, SNDT, KM Kundanani College of Pharmacy, Mumbai. Under her leadership, all the programs at school received approvals by Pharmacy Council of India and AICT. B.Pharm is accredited by National Board of Accreditation since 2014. Then Empalm Pharmaceutics and Pharmacology accredited by National Board of Accreditation for 3 years. School has also received Rajiv Gandhi National Quality Award by Bureau of Indian Standard. In recent NIRF ranking, the school has received 11th position at national level. Ma'am has guided more than 15 PhD, 16 PhD student and having more than 18 publication. She has received several awards. Like one such award is topmost global healthcare leader award by the World Health and Wellness Congress. Fabulous global healthcare leader award in the 4th edition of World Health and Wellness Congress. The list is, yeah. So with this brief introduction, I request Professor Bala Prabhakar to deliver her talk.
Thank you. Thank you. I'll try to be brief. I know I've got 10 to 15 minutes. I'll try to be brief. Hello. I hope everyone's able to hear me. Can someone from the back just acknowledge, raise your hand or something that you're able to hear me? Thank you so much, ma'am. Thank you for that. Now moving on to my presentation. First of all, I'd like to thank the organizers of APTI, Dr. Milind Umekar sir, who's sitting here, and Dr. B. Suresh sir, Dr. Pramod Kumar sir, and all my chair and co-chair for inviting me and allowing me to share this platform with you all. And also, I know that I am between you and the lunch, much awaited lunch, and you all are hungry. And the topic is also, you would find that it is kind of repetitive because the theme is empowering faculty. You're not able to hear? All right. The theme is empowering faculty and in the pharmacy education. But what I have chosen is empowering faculty, the change agents, the part of that theme that I had taken. And some of the points you might find repetitive because from Dr. Suresh sir's lecture, whoever has attended in the morning, and also the two eminent speakers who had spoken before me, because the points would remain the same. I would like to just one or two points and highlight them and give them as a takeaway, which I have experienced in my career. So moving ahead with my presentation, the topic is empowering academia, the change agents. It's not. Slide is not changing, no? No. I'm sorry about that. I know it's just adding to the delay or the time. So while he's getting that, maybe I can just continue without that. I know what I have put in the slides. So when I'm saying empowering academia, the definition of academia is that the environment like JSS University or any other university where there are faculty as well as the students of undergrad, students of postgrad, students of PhD. So these are the scholars who are actually consisting of this academia, and all these institutions are the academe. So that is why I have taken essentially what we want to empower is the faculty as well as the students, which the others have spoken about as how we can get better faculty, how we can improve upon them. And most importantly, Dr. Sohan has just now said that we just get MPharm students, recruit them after they finish their degree and throw them in front of the class, which is very true. We have actually followed that. We have done, and I have also done this. Most of us, we have had the similar kind of an experience. We never had any training. So then what was it that has helped us? The thing that has helped us is for children, they will imitate the parents. Whereas the students, or when I become a teacher, I would imitate my teacher, because I would have observed that over during my training period in the school. So I would imitate my teachers. My teachers had used chalk and board method and they were very much connected to us. Whereas over a period of time, we started with chalk and board and then we moved on to the OHP method of presentations. And then we used to write on the slides and then we used to present them. Then we had moved on to the other overhead projectors and we could use PowerPoint presentations. Now we use smart boards and we are also using virtual classrooms. So that's how we have moved on. And all this I could do only while I have been on the job. So this is actually what I had was an on the job training. So I would require the slide. Slide move karna hai. Yeah, give it to me, please. Oh, it's not happening with my. Huh? Oh. So I would have to keep telling. Anyway, so I'll have to keep telling you, right? So you will be alert, keep listening to me because I want to move quick also. I hope I'm not too fast because as earlier teachers had mentioned when they were speaking, feedback is essential and my feedback always had that, ma'am, you're a little fast. So I always try to correct it, but because the time is less here, I might go fast. So in case you have anything that you would want me to go slow or anything, please let me know. So I would like to take the feedback. I move on. Yeah. Yeah, thanks so much. So I had already covered this slide, academia, which is the higher education environment that we have got, whether it is Harvard, Oxford, JSS or NMIMS or any other organization where we are working. And we, the professors, the postgraduate students, researchers, all of us are part of this academia. And what exactly are we doing? We are doing research, teaching and management. Management where you have set a big list of things that the teacher has to do so many things. The students are involved in so many things. So these are all the activities we have been conducting. And the higher education essentially is, since yesterday Mr. Jain also has mentioned that we started as a $30 billion industry and then we have gone off to $120 to $130 and we want it to be 300 to 400. That is big money we are talking about. And we faculty members are the reason that that money is getting generated. However I'm doing, however I'm struggling, I am doing it. Does the country recognize that? So somewhere we have to see that the country recognizes our contribution as to the economy by developing the manpower, by developing skilled manpower, which is globally getting so much of acclamation across the world. So it is actually we are creating impact, especially on healthcare. They talked about vaccines. They talked about India being pharmacy hub. So essentially it is we are the ones who are creating that kind of money for the country through the skill set that we are developing in our students. And that is what is getting money for the whole world. So it's a business and we are doing a big contribution to the society. But when we are doing that activity, whatever we are doing has to be relevant and updated. But still, that is where we have a lot of problem, which other teachers have talked about. The curriculum is what is being changed 4 to 5 years. But the technology is changing. The science is changing much faster than that. So are we keeping up with that? That is another challenge. So we have to give relevant and updated knowledge. And here, who will be able to do that? The faculty. The faculty will be able to do that. And the faculty are the ones who are actually creating the nation. We are always saluting the soldiers. We are sending great messages. But why aren't we sending messages about our teachers who are facing challenges every day? Not when the Pakistan attacks us, but we are facing challenges, different types of challenges every day. So my salute to all the teachers who are facing these challenges, still surviving in the organizations. And also most of the time, the salary is the biggest issue. The teacher is not comfortable. There is no job security. And Corona has made it worse. So amongst all these challenges, every day the teacher is still working, still doing, till getting NIRF ranking, still doing everything that they talked about and still taking the institutions ahead. So all these slides which the earlier members also have spoken about, the teachers are having all these things. So all said and done, the medicine produced in India is high quality medicine. That is the reason the other countries are purchasing our medicine. And how is that possible? Because of what you have taught them in the schools, with all the constraints and border restrictions that we have got. So that is the reason I call the faculty as well as the other students, research scholars and other things, that they are the change agents. They are the ones who can bring about the change that is required in the country. How are they bringing about that? Their energy and commitment. I can see the energy and commitment. So many of you are there. I was worried the hall is totally empty. Who am I going to talk to? But I'm happy to see that at least half of the hall is full. So that is again commitment from your side. Thank you so much for that. And the intellect and the innovation. Why is it our Indians are all in the top positions in US? 131 Indians are there in top positions. Many are in Stanford. Many are across the world. Our people are there. Why? Because this innovation and because of this intellect. And who is giving that? You, the faculty members, are giving that to those people. And similarly, transdisciplinary and collaboration. Everybody has talked about collaboration, but I want to add is that we should not consider ourselves as only pharmacy teachers, pharmacy education. We are now healthcare professionals. And when they are telling us that you need AI, so tomorrow AI is also going to be in the education. Tomorrow deep learning, machine learning is already there in pharma industry now. So are we going to get that into education? When are we going to get it? How quickly are we going to get it? Who is going to teach this to our faculty members? These are the challenges that we are having. So we are transdisciplinary, because one product, if you want to get into the market, you need statisticians, you need doctors, you need nurses, you need all kinds of people other than a formulation person. Even within pharmacy also, we are living in silos, pharmacognosy, pharmaceutics, pharmacology, chemistry. Unless we come together, break those, integrate the education, we cannot really teach the student how to make one product only. So the transdisciplinary approach is very much required. And then emotional intelligence and well-being already has been spoken about, and reflection and action. What I am doing, how that is impacting. Am I able to bring about the change in the society? Because faculty are the ones who are building the nation. Faculty are the ones who are bringing about the change. Sohan also has said about Guru Brahma, Guru Vishnu, Guru Deva Maheshwaraha. So he's talked about Brahma, Vishnu and Maheshwar, which says that Brahma is the creator, Vishnu is the one who maintains, and Maheshwar is the one who destroys. Whereas a faculty member is the one who creates also, maintains also, destroys also. If he doesn't teach well, then he's destroying it also. So that is why that particular poem says Guru is everything, right? So in that context, the key capacity that are required by the teachers, these are the ones. And this is the vital role. I'm not going to dwell much on this slide because many people have already talked about it. Academic, they have to do pedagogical, they have to play multifaceted role in that. And the quality, competence and character of the teachers, that helps in the national development. So essentially teachers are the backbone, and teachers or faculty members are the ones who are creating even other faculty members also. So I'll be coming to that point. These are all the attributes of the ideal faculty that many people have already spoken about. Mastery is one thing Dr. Suresh has mentioned in the qualifications. Our qualification, when we are getting one qualification, we are always thinking of the examination which we have to pass. If I have to do MPharm, what should I get? The percentage, what I should get. Dissertation, what I should write. Viva, how do I face? So the student is always thinking from the perspective of the examination. Whereas once it goes into PhD also, his perception remains the same, and he's thinking of only how many papers I have to publish, how do I complete the requirements that are there. But actually once he becomes a faculty member, then he starts actually studying. Then he starts studying only those subjects which are pharmacy subjects and which he is teaching, because he's given a copy of syllabus and he's told this is the textbook, this is the syllabus. So he'll read only that. Even then he's not integrating that particular subject. So that is why first of all getting our credentials, then learning and mastery, that becomes very, very important for us. Then the rest of the characteristics, it is too many characteristics if you see all of them, and the practices that you have to bring. If you look at all these characteristics, you feel ye to teacher nahi hai, ye to bhagwan hi hai. Itna acha characteristics are required. An ideal teacher is as good as a god. How is it possible to have all these characteristics, and how much of commitment is required by the teacher, by the faculty member to become this? And how do we practice this? This also Sohan has covered. Healthy interaction with the students, discussions, improving, adapting, lifelong learning. So the teacher's life is never over. He can never relax because it's already changing. Now I'm at the end of my career. Now everybody is telling me you should learn deep learning, you should learn machine learning, you should learn artificial intelligence, you should learn coding. Without that, there is no future in pharma. So now I have to start learning all those things, starting afresh, and I have to find teachers to do that and make our faculty capable of doing this particular activity. So the learning is never getting over. And then value added learning. Ultimately, whatever we are teaching, whatever we are doing, we say outcome based education. So that outcome based education, how do we come to know? My student has become a company owner. He has established a company. My student is working in this particular area. How is he doing that? Because of the learning that he has done from the school, and that is what he is applying. So whether what I am teaching he is able to apply or not is what I have to assess. Then only I will be able to say my teaching was effective, whatever I have taught. So that is what Bloom's taxonomy is all about. Nowadays they talk about Bloom's taxonomy, but when my teachers taught me also, they were looking at the same thing, effectiveness and outcome based education. Now the formal nomenclature has been given to them and the systematic formats have been given to us to use Bloom's taxonomy that gives the effectiveness of the teacher. So when a teacher, all the members have spoken about all these things, teacher is having majorly three responsibilities: teaching, research, and also student support. Student support is something which we are not told as part of our job responsibility. We are told that you have to teach in the class and then you have to conduct research, bring out publications and grants. But student support is something that you are automatically doing after getting into the job. Whereas earlier Dr. Sohan Chitlange and Dr. Dandavala had spoken about so much about student support, which is a missing element that is also required. They have spoken about the entire career where the student support is required. Whereas I'm going to cover only the learning part of it. I'm not talking about institutional building, which is too much. So what essentially I'm trying to say is that we have to have standard academic processes in place. And so far we have not created any standard academic processes. Dr. Sohan's suggestion is that you have to have training programs. So how many colleges are willing to send the faculty for training programs? How often do they send them? Because the principal is worried who will do the classes. I cannot send one person goes and then that many 16 hours someone else has to adjust. It's not possible for me. So go during vacation. That's the solution that we give us. So what I have observed during my career is that the roles and responsibilities of the faculty have been changing throughout their career. They have a career of about 30 to 35, 40 years. What is happening when he's coming in as a new entrant? As earlier members had said that he just doesn't know, you're throwing him in front of the class. So essentially at that point of time, his responsibilities teach the students. How do I teach? How do I engage the class? The first 6 months when a new teacher is coming, inevitably the teacher is coming out of the classroom saying that I'm not able to control the class. They are doing a lot of masti. Class of 60, they're making noise, they're not listening, they're coming out of the class. Why? Because he is not yet trained how to handle the class. And the students are also trying to assess, measure, and do all these activities with the teacher. So initially when the teacher is coming, his first responsibility is teaching and also supporting the students in his own small way. And then he's supposed to be initiating the research. Now, who will be doing all these activities? Who will be telling? So that becomes the responsibility of the senior teachers or the middle level teachers. They will be hand-holding, they should be hand-holding, which we are not doing in a systematic established procedure. So the management will have to, the principal will have to take a lead and say that whenever a new teacher is coming in, he has to go through this process and we will be, that is an induction program that they have to do and tell them depending upon the culture of the organization, how he has to train himself. And then this one more important thing that I'd like to emphasize is peer review. We don't have peer review system within our teaching practices. By peer review, I mean, I will cover in the next slides. When the teacher now becomes a little bit senior, 10 years, 15 years, he becomes confident teacher. Then he's also worried about promotions. He's also worried about research grants. How to write research grants? Who will teach him? I'm sending the grants, I'm submitting applications, they are getting rejected. What do I do? That is where the senior teachers will be able to help him because they have already gone through that process, and then they will be able to support the junior teacher, telling him the nuances as to why your application is getting rejected, how it can be process properly, what corrections you have to do. So that kind of mentoring is required by the senior teachers to the middle level teachers. Middle level teachers on their turn, they can support the new entrants also, because the age gap between the new entrants and the middle level is less. So they'll be able to support. Senior teachers anyway are there to support them in the system. Student support can be done by the senior teachers also, but majorly at the middle level, they are having this issue of research grants, and they are having this issue of mentoring also. They need mentoring, middle level teachers. They need how to write research grants, improve and enrich their career. So that is where the senior teachers can help them out. And the training programs. Can we just depend on APTI only? Can we just depend on PCI, ACT to do the training programs? No, why can't we have that in the school itself? The teachers themselves, we are one family. We'll have to support each other, and we are working for that. But for that, the teacher comfort is must. Teacher should feel that he belongs to the school, his salary is there every month, his job security is there, he will get all the benefits, he doesn't have to worry about money or job. Then only we can talk about all these things. Then at the senior level, what is it that we are looking at? The senior level teachers are very well established. They are the ones. First level is the new entrants. They are looking at outputs. The middle level is going to give us the outcomes. The senior level is all impacts. So this process that I'm moving on, we have to have collegiality in the institution. And I'm talking about teaching and knowledge dissemination. Every teacher brings in a different skill sets, and they also we have to have the learning and growing mindset. Essentially, academic process should be established. That's what I want to insist upon. Curriculum, creation of session plans, and Bloom's taxonomy we should start using right from the beginning. How to assess, how to set the rubrics. That is one more thing. What am I going to teach? Why am I going to teach? How am I going to evaluate? This peer review process is one thing that I would like to bring in. Let the other faculty come to your class, and then let the other faculty assess, not for threatening purpose. We don't allow other teachers to come to our class. It's a private business between students and teachers. So if the other faculty, seniors or your peers can come and assess your teaching and help you out, and then that particular process will be helping us to become better teachers. And how to control the class, all these nuances, where is the difficulty, how to control that, all of it one should be able to handhold the juniors as well as middle level teachers. But this process should not appear threatening, this process should be supporting. So if we can do that process safely, this peer review system already followed by many international institutions, it's part of their academic process and compulsory. We don't have it, we should adopt that particular process, and it will improve the quality. Again, research culture, many of the earlier members had spoken about it. Organizational research culture is very, very important. How do we expect, what do we expect, integrity, and how are we going to support? How is the management going to support them? Give a little less number of lectures if he's a good researcher. How can we support them? So these are the things very, very important. One has to establish strong research culture so that we can have good outputs in terms of rankings, etc. JSS is one example for such research activities. Similarly, encouraging research, forming research groups, discussion groups, like conferences like this. These will be also forming, helping the research, creating positive environment, not criticizing, but helping out, finding that. Having research seminars, that is again another important activity one has to do. Then I'm moving on to the student support. This is strategies to improve research output. I'll skip that. In the student support, what is it that we can do? We are providing learning to them. So in that providing the learning, first question we have to ask is, why are we here? 60 students, 60 man hours plus the teacher, 61 man hours we are spending together. So what are we going to get out of that in that one unit, one session? First of all, we have to make it clear, what am I expecting you to learn from this class? How are you going to use it in your life? If it's not going to be useful in your life, then why are you wasting 1 hour, 60 hours? Plus one teacher's hour, 61 hours are getting wasted. So how and why that learning is happening, what are we learning, and what am I expecting from you? These are the things that student has to be made clear to. We have to explain that. And whatever the teacher is learning from the class and whatever he's thinking, that is the only thing that he takes ahead. How he interprets that information, that is what is going ahead. And faculty member has a very good influence on this. And you will be influencing his knowledge also, his attitude, his behavior, behavior, his habits, and his culture. You can see here JSS, the students, they are all participating. They are learning hospitality and they are learning team skills. They are learning attention to details. These are all the things apart from education you are teaching to the students. This learning they are going to take ahead and it's going to be part of their life, and they become self-directed learners subsequently. Using Bloom's taxonomy, providing session plan becomes very, very important, which we do not do. We just give the lecture and syllabus to the teacher and the reference books, that's all. So that needs to be given very clearly. Tell the students to ask questions. If they're not participating, if they are scared of the teacher, then there is no point. Feedback becomes very, very important. Help the students out and then train them for analyzing and applying. So your question paper setting has to be with analyzing and applying. And what we are expecting from the students, we have to tell them. Giving feedback to the students is absolutely essential. Taking feedback from the student also is absolutely essential. And then classroom climate maintenance, where we have to have a positive climate. We cannot say you don't know anything, you are a donkey, you are this, you are that, what you have not studied or what, this much should be known to you already, how come you, from where have you come, all these things we cannot have. We have to encourage them positively. So that the learning becomes very effective. Building on the prior knowledge becomes very effective for us. So we have to tell them what positive value he gets out of his learning and then what we expect him to achieve to also apply. So asking the question why becomes very important for all of us. We should start with the question why. Why are we doing this topic? Where will you use it? Because students strongly influence the liking and disliking of all the teachers. Many are scared of chemistry. Why? The way the chemistry has been taught to them, it is kind of intimidating to them. So if you can get over that, if you can make the students understand and like the subject, you will have many people who will be able to do APIs for Indian industry. Then several pedagogical tools, I'm not going ahead. Even national education policy talks about all these things that we have to do. Compassion, scientific temper, ethics, courage, all other members also have spoken about it. One more information I've taken from NEP scientific, NEP policy, teacher education, holistic, multidisciplinary, all these things are being covered in the NEP once again. So this is the last slide, I think, that students, teachers and institutions and society will also have to help. We all will have to work together to build the nation. Just by training or by doing things in silos is not going to work. Collaborations will have to be there. So how the earlier members had spoken, professional education is absolutely essential. Lifelong learning will happen. Technology use, we are already doing it and learning it. So these skill sets, if we can impart to the students with commitment and compassion, that is where we'll be able to contribute to the building of the nation, which already our faculty members are doing. So they will continue to do so. Thank you so much. Thank you for allowing me to speak a little bit over time. Thank you so much.
Excellent presentation, madam. As expected, empowering academia, the change agents. So you have touched about the teacher quality. You have talked about the key capacities of change agents, vital role of faculty nation building. What impressed me the most was the teacher induction. We talk of student orientation, student induction. If a new teacher comes to the family, your setup, you have to tell her what is your expectation. Then only outcome will be there. Then only she will get into that mold. She will come to, or he will come into the comfort zone. If they are not settled, they will not give you as per your expectation. Sudden monitoring them, sudden in class, sudden asking for the lesson plan will not help. If the policy matters are inducted well into their culture, then I think outcome will be good. Excellent that. And rubrics, Bloom's taxonomy, really need of the hour. And then another important thing I feel, and I add on to this, is calendar of events that sequence the whole exercise. So students are prepared, their support is there, their learning is good, they know when there is short break also for them. They cannot suddenly come, madam, session is over, we want a break. You know everything. Everything has to be strictly followed. Students should have a pocket calendar to know these are the exam dates, these are things how to happen. Then obviously outcome will be more. They will look forward to a break like how we look forward to a Sunday. So I feel it's complete in all respect. It deserved much more time because so much data you have put, no? And that is exhaustive, really appreciable. And you have done it in 20 minutes. I think we should applaud for madam. Wonderful presentation. Room for one question, if anybody has. No, no, they went, they were hungry, they went, ate and came back. No issues. Thank you, madam. Thank you so much.
Thank you, ma'am, for that wonderful presentation. I now request the chair and co-chair to honor Dr. Balaprabhakar, ma'am. I now request Dr. Krishnaveni, Professor, JSS College of Pharmacy, Ooty, to honor the chair and co-chair. Please, ma'am. As we are running short of time, we have a lunch break for 20 minutes. I request all the delegates to please be assembled by 3:10. Thank you.
Hello. Very good afternoon, one and all. I am very happy to release a textbook of Pharmaceutical Organic Chemistry 2. Authors are Dr. Nirmala Shinde, Dr. Avinash Dhake, and Dr. Sachin Bhosle. I am very much thankful to APTI for releasing of this book. Thank you once again.
some cartoons and pictures on it, she tries to swipe on it. Right? She is unable to differentiate between the normal physical world and the digital world. So that is the reality of kids born in this age. So technology is part of their life, right? So when a student who is has been using technology all their life moves into sir, it's not moving. Yeah. So this is generally the habits of students. Everything that they do, they demand more flexibility in that, because they're used to that flexibility in the outside world, right? So they want things to be very relevant to them. They want things to be fun, and most importantly, they want things to be mobile, be done anywhere, anytime on their own devices. Me and my team have done some research on the learning habits of what we call digital natives. Now, digital natives are people who are born after the year 2000. Now they are born into a digital world, a world of smartphones and internet. They have very different learning habits. Their attention span is very small, 6 to 8 minutes. So beyond that, fatigue creeps in. They're unable to grasp, which is why you see in the internet, apps like Facebook, Instagram, YouTube, they all cater to that shorter attention span of human beings. Right? You see short little videos, you see short little posts, because it's very easy to grasp and understand and assimilate. Anything beyond that, fatigue creeps in. It has to be delivered in a different way. So they prefer what we call short, bite-sized content that is very rich and engaging, and generally they want to learn on the go, anywhere, anytime. Now, if a student who is born in this digital world walks into a typical classroom like this, right? A classroom with closely packed desks, blackboard, all eyes on the blackboard, finger on lips, and a teacher would deliver a 1 hour long monologue. Generally, the student will never feel comfortable with such an atmosphere. Right? If I am the student, I'll be walking into an atmosphere that is not natural to me, right? Where I am restricted to use my devices. So you're suppressing the students' natural instincts. So people today are very used to taking quick notes on their laptops, quickly looking up, searching information on devices. You're restricting all that in a typical classroom. So the student will feel that he's in a totally different world, a world very different from what is outside his natural world. We're essentially putting them into a different atmosphere. So it is very important for us as educators. So it's not aligned. It is scroll down. Sir. Yeah. So as educators, we need to understand this and be open-minded to bringing in more technology into our classrooms. Right. So if you see, it has already started happening in schools. In K through 12. Now, most schools, most advanced schools out there have, as per the new education policy, also have started bringing in more and more technology into schools. And the classroom is filled with technology. So blackboards are replaced with smart touchscreen smart boards. Now there is augmented reality. Every school has an internet connection with Wi-Fi connectivity. Students are allowed to bring in devices. They are allowed to play with simulations and science kits. So a lot is changing in this in schools in the K-12 sector. 5-6 years down the line, these students are going to come into higher education. It's very important that higher education institutions and universities start creating similar atmospheres for students. Otherwise, they will feel that they are coming into a different world, a world that is very different from what they have been in schools and outside. Right now. So technology is also about what we call personalization, right? So the traditional education is very different. You have 60 people in a classroom, one instructor talking to 60 people. It is impractical for one instructor to give personalized attention to each and every student. What happens generally? So the same lecture, the same set of assessments, assignments are passed down the throat of every student. However, every student is different. Students come from different backgrounds. They have prior learning dispositions. They have their own strengths and weaknesses. It's important for us to treat each individual differently and create personalized learning experience for each individual. traditional education cannot meet that because it's impossible, like I said, for one instructor to give personal attention to every of the 60 students. Technology can solve this big problem, right? We're using learning technologies, things like AI and ML. We could enable custom learning paths and learning experiences for students. Right? What you see on the top is conventional rigid learning path where every student goes through the same set of course material, same set of assessments, assignments throughout the year. Whatever they are, they may be smart, they may be slow, they may have strengths and weaknesses. Everybody goes through the same set. But personalized learning enables you to, essentially, the screen is broken. Please apologize for that. But the top half of the screen shows that students start from the same starting point, but they traverse through different course content. They traverse through different curriculum altogether. And technology, we have technologies today that can enable you to do all this. So what is the role of educators in all this, right? So we as educators, including me, I would say, most of us are born in a different generation, right? So there was no technology, there was no smartphone, there was no internet. Rather, internet was not a ubiquity when I was in school. So we adopted technology into our life. So we have a certain way of doing things. The generation today, the students today are born into a technology-filled world. So their life, the way they consume content is very different. So we should create an atmosphere for students that they are comfortable with, right? That where they can resonate with the learning experience around them. We should not build an atmosphere that we are comfortable with, right? In most colleges, most educational institutions, faculty end up building, a learning atmosphere that the faculty is comfortable with, right? Because there was no technology, there was no online learning when we were in school, we were in college. Hence, there will be no online learning even now. That will never work. We should work towards building an atmosphere the students are comfortable with. It's important for us to bring in technology into our education system, be it learning operations or curriculum, as soon as possible. And while working with colleges and institutions, we have seen that a sudden transition is not possible, right? So there are institutions where they go about setting up an LMS, and 3 months down the line, you see that nobody is using that LMS. There are no students, there are no faculty, and when we checked with faculty, they say we're already overworked. There is so much work that we have to do with our existing courses. The management is trying to put this additional burden of managing LMS, creating online content. So it should never be seen that way. From our experience, we have seen that incremental changes over a period of time is the best way of digitizing an institution, right? So overnight change will never work. Incremental changes where the management, students, and the faculty work hand in hand and make small little changes over a period of time to achieve the larger goal of digitizing your institution or university. So our based on our little experience, we have, I think, digitized over 25 colleges in the last year and a half all over India, mostly pharmacy colleges. So we have listed down a 5-step approach basically to what we call tech whip your institution, right? So it's not just about bringing in or licensing a large platform and an LMS platform or a student information system and hoping that things will change from tomorrow. That will never work that way. The first step is basically you attempt in digitizing your student course and faculty data, right? There are colleges out there that still manage their student and faculty data on paper-based register. Some use Excel sheets to do it. It's still very disorganized, very scattered. So you can use a simple lightweight platform to bring in your student course and faculty data into one single platform. So there is one source of truth out there in the cloud that everybody has access to. So this activity will generally take about a month, 3 to 4 weeks, where your faculty need not be disturbed. It's just the management has to work with a technology partner and help digitize your entire roster data. Second step would be to digitize your assessments and surveys. So attendance is taken as part of most traditional education. Why don't we digitize that attendance? So digitizing attendance gives you the data of engagement. So how are students taking your courses? How is the attendance? How is the engagement level? Assessment, every course, every education institution has assessments. You have CII, your continuous internal, CIA, continuous internal assessments. So all your internal assessments as well as midterm exam or the end of the semester exam can be digitized, right? Instead of taking it on paper, they would take it online. It could be a proctored session or it could be an unproctored session. And then surveys. So at the end of the course, students are supposed to give feedback and survey about the faculty about the course experience. The second step would be to digitize this. So the power of this is that at the end of every semester, you now know how your students are doing, what is their engagement, what is their performance, how is the faculty doing, how is the course doing overall, right? So we are still not talking about any sophisticated LMS or online content. In step 2, it is just about digitizing your assessments, assignments, and surveys. The next step would be to digitize report generation. So we worked with numerous colleges where during the time of accreditation, right, there is a NAC accreditation or there is an audit, you see faculty running around with Excel sheets, trying to generate reports at the nth moment. So this problem can be solved if you have the first 2 steps ready. Report generation will already be digitized. With one click, you can generate any reports for any accreditation body or any audit, right? A single click report. In fact, reports can be made automated so that you get these reports over email every week. Finally, we come into digitizing your curriculum and learning. So most of the faculty always complain that building online content, online curriculum is very time consuming. Hence, we're taking it in the 4th step, right? So once you have the first 3 steps built, you can go about touching the 4th step, because each step builds on the previous one. Now you have the basis, the foundation is set. You can encourage your faculty to start building digital courses, digitizing their courses. The same course that they deliver in class, part of it can be digitized. Assignments, assessments are already digitized. Courses, reading material, recorded videos can be digitized, and your entire curriculum and learning can be digitized. Finally, now the career aspect, right? So into the same experience, you can bring in industry connect, careers, and alumni connect, right? So there is an alumni working in a very senior position in a pharma company. It is important for that college to tap on that industry connect, ensure that that alumni can come back and give inputs and feedback and career opportunities to future students. So all this is 5 different steps, each building on top of the previous one, to create a learning ecosystem where students, faculty, and management are very tightly interacting and connected. So you can see some screenshots of how things would look like. Some glitch, yeah. So this is one of the steps, sir. Basically, the product that we used to help multiple colleges across the country is called LearnEd. As the first step, what we are doing is program course information. The users or the students, the faculty are all brought together. You have one single place on the cloud where this mapping happens. Once this happens, you can actually look at individual reports of users and faculty, what all courses they're teaching or they're enrolled in at fine-grained level. The second step would be to attendance, right? So you can digitize this attendance. So the faculty would record all the attendance information online. Anybody, the management, program coordinators, students themselves, and the faculty can see the attendance and engagement status of users or students across different courses in the program. They can also look at assessments, the scores, the grades in various points. Different accreditation bodies require grades to be presented in different ways. So all those modules are built into the platform. The third step would be to digitize report generation. Now, every single data point is already in the system. So it's all about creating charts and reports. So the most common reports and analytics are already built into the system. One single click, the faculty will be able to download reports in various different formats. Now we talk about the difficult aspect of creating online content, digital content, which is time consuming, of course. So this is where the faculty needs a little extra motivation in order to generate that additional digital content along with their classroom sessions. The The content is already available in this platform that we gave to most pharmacy colleges in the PCI structure, but there is a lot of flexibility for the faculty to modify that content, add additional questions, add additional assignments, modify it based on their needs. So the entire digital curriculum will be then made part of your offering, and then your students will be able to access digital content as per the PCI syllabus on their own platform, anywhere, anytime, from the comfort of their homes. And finally, there is a module called Career Ed that ties on to the learning aspect. So there are about 60 pharma companies from all over the country who have access to all the students who are using LearnEd across colleges. So we have about 40 colleges, students from all these 40 colleges. The data is there in our platform, and recruiters from different part of the country will have access to these students. So what they do is, basically, if I am a pharma company HR, I want to hire 5 freshers who specialize in pharmacovigilance in Delhi NCR area, and I want their GPA, or I want their grade to be above 85%. It's just a simple search for me. I can search for all students in the Delhi NCR area or willing to relocate to Delhi NCR area who have their grades above 85%, who specialize in pharmacovigilance. I'll get the profiles of everybody. I can schedule interviews or invite them for an interview. Similarly, the students will have access to job data from pharma companies. They can actually search based on multiple criteria for the jobs they want and apply for those jobs. Right. So essentially, what we are doing is we are bringing in the education, learning operations, as well as career opportunities together into one single platform ecosystem, which is only possible through technology. Otherwise, it's all done on paper registers and scattered Excel sheets. Essentially, it's all bringing one, it all together to create an ecosystem of entities. So I would like to close this session with one last thought. Now, as educators, it is our responsibility to open our minds to create that channel of bringing in more technology into our classrooms, into our learning operations, into our institutions, so that students feel at home. They are in an atmosphere, they're learning in an atmosphere that they are comfortable with, not what we are comfortable with. And number 2, we also are ready, future ready, because the next generation is all tech equipped, and they'll be hitting the higher education colleges in about 5 years. It's important for higher education colleges to pull up their socks and be tech ready or tech equipped for the next generation to come. Thank you. Thank you.
So I was listening to your talk, and Dr. Adas, you have explained everything. We know that after pandemic, overnight we shifted from classroom to digital platform. And as I always say, if I'll give you a mobile in your hand and after 10 seconds, you are ready to use it. But right now, about the digital platforms and digital learning, most of the colleges in some way or another way, we are using it, but still what you have said is we should be ready and we should be future ready. Yes. So that is again a challenge to all the institutions, that how we are taking it. But as the school or kids, I'm having some different opinion because I'm a parent also. And right now you all are aware that now we are opening a counseling chambers, and for the kids also, that they are so fond of the equipment because they are fascinating, and this is they are charming things, and they are I don't know what will be the limit of that. So I always, as a teacher, this is my personal opinion, that we should go on a blended learning. Yes. We can use the technology as a tool to improve ourselves or to give the knowledge. What the different you talk about a very different parameters to be implemented in that. Only at one platform, I'm having a different opinion that in classroom,
yes, sir,
it should be in a blended mode.
Yes, absolutely.
Rest of the things, what the technology, how you're using, it is going to ease us. Correct. To give us support in the classroom, to give us support to evaluate the things, to give us something best out of that, what to help us. So I think so. It was overall a very great presentation you have given. You have covered everything in that, and Thank you for
sir.
this
Thank you.
nice talk.
Thank you, sir. Thank you. Yes, I completely agree with you, sir. Technology is only an enabler. It cannot replace traditional classroom learning. It can only help, making things easy for the instructor and students. Yes.
So thank you, Dr. Adarsh, for taking us through the cloud computing. And we are fortunate enough to listen from an entrepreneur who came back to India for this venture. Congratulations on this effort. I think it's a great vision for the youngster. Thank you, sir. We can put. So I open the house for the any queries. If you have any queries, you can raise right now and before we conclude the session. So I have one query regarding your presentation that we have so many modules right now in Indian higher education system. You must have heard about learning management system of Colpol,
yes,
in ports, Sakai. So how your module is different from these? Any unique feature you have incorporated into this?
So generally, if you see the generic learning platforms out there cater to all domains. Moodle is used in a school setting. It is used in an engineering college setting. It's used in an arts college setting. It's used in a pharmacy, medical college setting. We understand that some of these health-related disciplines, which include medicine, dentistry, or pharmaceutical sciences, are very specialized. Right? The curriculum, the way the workflows, the terminologies used are very different when compared to what is it in engineering or elsewhere. So what we have done is we have taken that extra care of tailoring it specifically for pharmaceutical sciences, for dentistry, and for medical education. The terminologies that people use, the workflows, the structure of the program, the different types of people involved, like people like program coordinators, students. It's very different in health sciences versus elsewhere. So the platform is tailor-made for health sciences. Number one. Number two is the content. The platform comes loaded with the content structure as per the syllabus, the PCI syllabus in case of pharmacy, which gives people a feeling that it's already loaded. So you're not getting an empty learning platform where you have to fill in content. It's already loaded. Everything is structured. We just have to tweak things based that to make it work to our needs.
I think with the advancement going on right now in technological field and its application, the day will come where the robotic teachers are coming to the classrooms and we are watching their lessons. Thank you. Thanks for this. This is a nice session. Please.
Thank you, sir. Thank you.
Thank you, sir. May I please request the session chair and co-chair to felicitate the speaker, Shri Adarsh Sudhindra. Please, sir. Thank you, sir. Thank you. The next talk is by Shri Sundar KS, Associate Vice President, Head Campus Connect, Mysuru. May I please request Shri Sundar KS to come on to the dais, please? And he's going to talk on the topic, New Age Learning Powered by Digital Technologies. Please. Yeah, I'll arrange. May I please request the chair and co-chair to introduce the speaker for this session? Thank you, sir.
Thank you. So we have another speaker in the same domain of the cloud computing and infotechs in pharmaceutical or higher education system. So we have with us Dr. Sundar KS, who is Associate Vice President, the Head of Campus Connect, Agile Development Operations, and Account Enablement AT at Infosys, a great company which is looking after the integration of education into the different domains. So he was also a part of Infosys core team that helped in setting up the GEC, that is the Global Education Center, the world's largest corporate university as Infosys Mysore campus. Dr. Sundar has also handled the development of Infosys Wingspan along with the client training. Wingspan is a unique platform, everybody aware about this, that allows us to equip our clients with a future-ready workforce in a holistic way. He is also a member of the Executive Governing Council of Infosys Education Training and Assessment. And outside of his work, he also connects learners across the globe through teaching conferences, forums, and different co-curricular domains. Additionally, he also participated in education drives with multiple NGOs to uplift the life of underprivileged children in rural areas to witness them achieve greater things in life. So I think it's a unique combination of a expert in technology as well as with a societal mindset. So we welcome you for your session, sir. Please take us your session ahead, sir.
So good afternoon. Am I audible? Yes, it's very tough to sit in the afternoon, but I'll still make use of the next 20 minutes that is allocated to me to talk something probably complementing what others spoke about, right? I think he talked about technology in education from a 360-degree perspective, but I just want to actually add some supplements to what he spoke about. Before I start with this, let me tell you, if I recollect the date correctly, 2019, July first week. I think July 19th was the date when we had the lockdown, if my memory is correct. I think July first week or so, one good day in our Global Education Center campus at Mysore. By the way, just for your information, Mysore hosts one of the world's largest corporate universities in our campus in Mysore, in our campus in Infosys. So in case some of you are interested, anytime when you're free, you can actually visit that. And the building that hosts the training is supposedly India's largest building. Of course, it was. Now I think there is a bigger building. It was India's largest building ever constructed post-independence. It's not related to what I'm talking about, but just keeping that aside. It was during the first week of July 2019. One good day, we had to close the doors. How many of them were undergoing the training? It was almost about 9,500 people. Where did they undergo the training? In a classroom setup like this, a smaller version of this. We had to actually shift all of them, meaning safely move them to their hometown. But at the same time, all of them had to continue their training with possibly a gap of 1 week. Just imagine 9,500 people in your university will have to be moved to their hometown with just 1 week of lead time. They will have to start once again or continue once again what they were learning in the campus. Learning is not just about listening. Learning is all about comprehending, practicing it, because we, being a technology company, obviously will have a lot of hands-on activities associated with it. So if not for the technology, probably we wouldn't have kind of reached that stage where just a matter of 1 week, all the 9,500 people started learning completely in a different way. Trust me, those 9,500 people came out of the engineering schools. All of them were used to the classroom kind of a setup, the instructor coming and explaining them. Now they had to actually sit in front of their computer and then start doing the hands-on activities, completely self-governed and self-managed way. But we could actually achieve that. The reason being, we were able to possibly about an year back or so, sometime in 2017-18, completely digitize the learning ecosystem in our campus. So whatever I'm speaking now in terms of technology in education is something that we have experienced in our campus. So it is something like just explaining or sharing the experiences, how technology has helped us in bringing this kind of a drastic transformation from a conventional learning approach to the new way of learning. So I'll be in the next 15 minutes or so going to talk mostly about these aspects. So is it working? I'm not able to move. Okay, all right. I think you can please keep it here. You know what is the biggest problem in our learning system? It is not the curriculum. Curriculum is one aspect of it, but the biggest problem is what we call it as one fit all. One fit all is the biggest problem, meaning, for example, you know, there are about, let's say 50, 100, 150 of you sitting here. You are actually hearing something. The way you absorb things differs from each individual. Some of you would like to hear, some of you would like to quickly hear and then start practicing it. Some of you would like to actually hear from others and then do it. So the way we perceive things is completely different and it is individualistic. Unfortunately, n is equal to 1 is not being implemented in our learning system. So here is the analysis of the data or the point that I mentioned about. What we noticed is 68% of the people, this is about the learning trend. 68% of the people feel that, hey, don't teach me upfront. Let me work and then whatever is required for me, I will actually learn during that time. There has to be adequate rigor and relevance in what I'm learning. So I need that. Similarly, they prefer to learn at their own pace. Unfortunately, all the learners in your institution, in our place, all of them are made to run, forced to run 100 meters, and the one who is going to reach the spot first is going to be the winner. Unfortunately, that still is the prevailing system. But they prefer to learn at their own pace. You cannot force fit people. Some of them have their own learning styles. Each one of them have their own learning styles, but the education system doesn't permit that. Is there a possibility for us to break such kind of a one fit all kind of a mechanism or a confinement that we have today in the system? Similarly, you know, what we found was, it is not just in time, it is just at that point of time. It is not even just in time. Just in time is actually anticipating that something is going to come and I'm going to learn, but just at that point of time is it has already come. Something like it is not Yuddha Kale Shastra Abhyasa, it is Yuddhe Shastra Abhyasa. Only when actually we have the war, then I'm going to learn. So that kind of a problem, that kind of a thing, almost about 49% of the people said that. This is actually the data that we have accumulated through LinkedIn Learning. So basically they have acquired this data, they have analyzed this data, and what it actually talks about are the 3 top online learning trends. So for 49% of the people prefer micro learning. I think Adarsh or someone was talking about it. Today, if you ask me, what is the retentivity rate of an individual? You can ask your students, how long can you focus on something? It is not more than 5 to 6 minutes. But how is the organization of the content in your voluminous book? I know I may not know much about the pharmacy, but I have doctors at home. I know the kind of voluminous books they actually go through. It scares me, you know, really. And you have to actually go through everything. I need to learn about possibly some, you know, one specific topic, but I'll have to go top down. It doesn't mean that, you know, I can directly get into the topic, but it becomes extremely difficult to get into the topic. So the concept of bite learning is missing. So that's the reason why we feel that almost about 49% of the people feel that there has to be a bite-sized learning, meaning small capsules of learning. That is extremely critical. 46% say just-in-time learning, and then 46% of the time feel that there has to be an experience. I think Adarsh was talking about LMS. If we confine technology only to LMS, we are going to fail again. You will be surprised to hear this. LMS is something that we spoke about as the technological influence on the learning. What is LMS? It is learning management system. What is learning management system? Capture the attendance, capture actually the score, generate the report. My bigger question there is, you know, what are you achieving there? Instead of doing it manually, you are actually doing it in an automated way. Other than an improved productivity, tell me how the learning quotient is going to improve because of LMS. The answer is not. Trust me, LMS is going to be an augmenting factor, but that is not the end result of, you know, your digitization of the learning. If your learning ecosystem is a good blend of an LMS and LXP, I repeat what I'm saying. If the learning management or learning ecosystem, the digital learning ecosystem is a good blend of an LMS and LXP, then the best experience will come out. LXP stands for learning experience. What is learning experience all about? I'll just give a simple example. I have logged on to my digital portal. I am learning a specific topic, and I've been empowered to learn on my own. But at this point of time, I just want to see along with me how many active learners are there at that point of time. Meaning I'm going through the content all across the globe. How many of the learners are learning simultaneously along with me? If I'm able to actually catch the attention of all of them, then I can actually have some kind of a collaboration. Unfortunately, the collaborative effort through the digital ecosystem, if it is missing, then it becomes purely just an LMS. So I want to actually know who are the subject matter experts, all across the globe who are available at that point of time, so that I can have a meaningful conversation with them. Because whatever I learn cannot be looked at in isolation. It has to be contextualized in solving the real world problem. If there is an opportunity to do such kind of a thing, then your LMS with an LXP becomes the best way of learning. So that's the reason why the technology today, I think in the morning also, there was a mention about the AIs, the MLs and other technologies, towards augmenting the learning experience. Your LXP is more towards bringing those kind of an AI experience. LMS is all about automation. LXP is all about bringing the human intelligence onto learning, so that we can actually come close to the actual learning. Sir, I want to recollect the question that you mentioned about technology can be an augmenting factor. It cannot be a replacement for Guru. So we have the greatest tradition of Gurukul. Trust me, I have been actually doing the training at length many years. Even today, if someone says that technology can replace the complete learning ecosystem, I'm the last person to believe it. There has to be a guru, but all these technologies with an LMS, LXP that I talked about can only augment the learning experience, is what we have experienced in our large learning setup. So keeping all of that in mind, so we can go on to the next one. Let me see if I can. Okay, so keeping all of that in mind, what are the 4 tenets of the digital learning ecosystem, or how technology can implement these 4 things? Others touched upon it, but very briefly, let me tell you. Today's generation, the millennia, wants everything in their fingertips. If I have to ask someone to learn, the first question that they will ask is, I don't have a laptop, number 1. If I ask them to do some practice, let me give some technology examples. Why don't you please write a small hello world program? He or she says that I don't have the software in my system. If I say, why don't you take an assessment? The person says that I don't have time to go through the assessment center. So if there is a possibility of a technological influence on bringing anytime, anywhere learning, so that learning becomes convenient, if the technology is able to achieve that, then it is going to make a big difference. I just want to put some data into perspective very quickly. About 5 years back, we as, by the way, all of us know about Infosys. And I'm very happy to tell the founder of Infosys, Mr. Narayana Murthy, is from Mysore. And that is why he has set up one of the largest corporate centers in Mysore. 5 years back, we as a large learning organization within Infosys, we could achieve about 40% coverage. 40% coverage, meaning if there were about 200,000 people, we were able to achieve about 80,000 people learning, through whatever means that was available. But that was a very small number, because the intention was to reach all 100%, because everyone is a learner in an organization. No one can be an exception. So we had to increase the reach from 40% to possibly 60% or 80%. And when we analyzed the impediments of learning, we got a lot of challenges. So people said that we are in the client location, we are spread across the geography, we can't come to one location. Classroom training is a luxury, we can't afford to have it, all those kind of a thing. So we were able to actually achieve, the kind of success that we have today. I just want to let you know, today, 98% of our organization employees are learning in one form or the other. Just imagine, from possibly 40% to what it is today, almost about more than double, kind of an increase. And that was made possible because we created a digital platform called Lex, which makes the content available anytime, anywhere. So the first problem that we had in mind was, how can you make the learning experience available anytime, anywhere, make it convenient to work? So that is the first part. The second thing is bring rigor and relevance. until and unless the content, what is it for me? You ask any of your students. Unfortunately, this is something, because I have the Campus Connect responsibility, we're working with more than 700 engineering schools in India. The first thing that I ask the students is, why have you opted for this branch of engineering? Why are you learning this? They have absolutely no answer. Most of the time they say that we are compelled to come to this graduation program because my father, my parents said that, if you complete your degree, they are going to get some good job kind of a thing. So until and unless we have the adequate rigor and relevance in what we do, be it learning, be it doing any activity, the best out of you will definitely not come out. So the content also has to have relevance in terms of bringing the real life case studies. How can you actually amalgamate the concepts with implementation aspects in the whole process of learning? So let us not forget, bite-sized learning and make the content more relevant in the context of the learner is extremely critical. So technology can certainly support those aspects. The third aspect is engagement. This is something I'm not sure whether others touched upon it, but I want to mention about it here. Engagement is all about ensuring that learning is a fun. Today's world, people are looking at, I want gamification. If I complete some training modules, I'm going to get some badges. And if I have the badges, I can be competitive with other people. So is there a mechanism to make people competitive while they learn? There has to be some interest. Very interestingly, in one of the cases, I have seen in some companies, some important message was supposed to be read and communicated. None of them were listening to all the mails or reading some mails. One day there was a cricket match that was going on. So they actually published the score in a portal and everyone logged onto the portal to see the live score. Alongside, there was also some important message. So through this, they are able to catch the attention of the people. Similarly, through gamification, we can actually engage the learners a lot more. So that is the part. The last thing is about the telemetry. I think there was a mention by Adarsh about the data analytics that I'm talking about. If I am able to let you know, for example, all of you are members of your prestigious institution. If I ask you one simple question, possibly to the principals and other professors of your institution, can you please tell me what is the learning appetite of your institution? I don't think anyone will have an answer. So when I talk about learning appetite, if you ask me the reverse question, what is the learning appetite of your organization? I can very confidently say that there are about 40 to 50,000 learners able to learn every day beyond their office work, almost about 50 to 55 minutes every day. And this is the data that is being captured. So this analytics, actually the telemetry is actually going to capture the data so that many of the time we get these questions from our customers. Can you tell me how much of time your employees are spending time on learning and development? I think this telemetry and other things will certainly provide the data. There has to be, that's the reason why Mr. Murthy always says, in God we trust, everything else we want data on the table. Until and unless we have the data on the table, we cannot actually, accept anything that comes in on our way. So telemetry becomes an extremely important point. So 4 important things. Ensure that the learning opportunity is available anytime, anywhere. Second one, ensure that there is adequate rigor and relevance in what you're learning. Ensure that you have the gamification and engagement of the learner so that it is more of a pull than a push. I hope you're getting what I'm saying. Learning should not be a push, it has to be a pull. So the people have to subscribe to learning rather than being forced to learn. So that is the engagement part. And the last thing is about the data and the analytics that's going to bring this kind of a thing. So this is the, building block for technological adoption on learning, using which we were able to actually create the digital platform in Infosys. So I'm actually almost coming to an end because of the limited time, but let me tell you what all are the world of possibilities using technology in your learning space. So there is something called Career Navigator. I think Adarsh also spoke about it. So there is a possibility, and also prior to the lunch break, I heard about how actually the learning can facilitate employability. Career Navigator is all about how you in the pharma industry can actually talk about what are the possible roles that these people can play. This is very interesting. This is what we have done it. What are the possible roles a student of a pharma industry, pharma study can do or can perform? What are the key areas of responsibility for that particular role? Identify the key areas of responsibility. So once you identify those responsibilities, identify the skills required to meet those responsibilities, and identify the training program underneath. So this is how the skill framework can be built. First thing is, what are the roles these graduates can play tomorrow when they come out? Second one, what are their key areas of responsibility? The third one is, what are the skills associated with it? And finally, what are the training programs that they can actually acquire so that they can get into this? So these are all the world of possibilities. I talked about Career Navigator. I'm conscious of the time. I'll quickly wind up. The second thing is certification and virtual proctoring. Today, I can sit in my place. All of you know that there is one examination called GRE, Graduate Research Examination. They take it for getting admission into the US universities and all, right? So earlier they used to go to an assessment center. Today everything is happening in their home because there is a virtual proctoring, there is a video proctoring. Many of the interviews are happening through video proctoring, and thanks to the technology we were able to achieve that. Similarly, enterprise knowledge discovery. Today, if you ask me how many Java experts are there in Infosys, in Mysore, in this particular building, I am able to dice and slice the data and get the data accordingly. So these are all the world of possibilities where technology can augment the learning experience, and you can certainly make use of all of this. So finally, before I conclude, I have an offering. Because I have come here not with an intent to talk about what we have or what the technology is all about, but I want to place and I want to actually give you an offering to pretty much every institution and the representatives who are here. You talked about all the 4 tenets. You talked about the technology in learning. So we, as a responsible corporate citizens, or corporate in the country, we have taken up an initiative, corporate social responsibility initiative, of digitizing the entire learning ecosystem in India. And we are spending good amount of money to ensure that right from 6th grade onwards, postgraduates, whatever level you are in, you will get a learning opportunity. So Infosys has launched what we call it as Springboard, the next generation talent transformation digital platform, absolutely free of cost. And whatever I spoke about is available. What it actually calls for is you getting onto the portal, log onto the portal, register it. Institutions can actually do it without any cost implication, zero cost implication. What is the benefit? Whatever I spoke about is available. You can create a miniature version of your college portal on Springboard and give a feeling to the student that it is your own portal, absolutely free of cost. More than $1 million worth content is hosted. And possibly you might ask me, is there a pharmacy content? I can let you know that we have an authoring tool. You being the subject matter experts, you can host the content on the platform and start using it for your own students. So it's available absolutely free of cost. As on today, we have signed an agreement with many of the state governments and central government. We got recently EICT approval also for this. And more than 3 million learners have already registered for it. Educational enrollment is also possible. So technology in education is the need of the hour, but technology in education has to be facilitated to the institutions and then guided. Here is an opportunity for you to join hands with us, and then we can collaborate and take it to your doorsteps. So with that, I once again sincerely thank, but I'll be failing in my duties if I don't offer my pranams. I should have done it at the beginning, to the lotus feet of Swamiji for having arranged such a wonderful, having blessed us and arranged such a wonderful program here. If there are any questions, if there are any comments, I'll be very happy to do it. Once again, not to forget, if you're interested in bringing this digital learning ecosystem to the doorsteps of your institution, there is an opportunity absolutely free of cost, and it's going to be all yours. So with that, I hand it over. Thank you once again.
Thank you so much, Sudhakar KSG. Indeed, it was a session complementing the previous one. In that, others told about what we can do with the technology. But rightly, Sudhakar ji has explained how we have to utilize the technology in the education system, and what exactly the people are requiring from us, that what technology we are providing and how to provide the technology to them. So basically, what the very relevant, it was looking like a very learned and experienced teacher is telling about all the aspects on which we should focus on. what exactly to whom you want to give the information, what exactly he is requiring, when he is requiring, how he is requiring, what type of content he is requiring. So considering these things, I think so what the effort, because I know creating a digital information or digital content, it is very difficult, that what the content you are making and how you are going to narrate this or how the people are going to take it. So what you told or what you explained, that is, I think so as a teacher, I have also taking it with me, and a lot of them, all the teachers are sitting there must be thinking about that. Maybe you are talking about the technological content, but it is relevant with our hard copy content too, that what they are requiring and what we are giving and how we are giving, in which form we are giving. So thank you so much, Sudhakarji, for giving an insight into this. And again, as he said, I'm very thankful that you have given opportunity that free of cost he's giving a platform where we can register and we can utilize what the content they have created. So thank you so much for giving this opportunity to all of our teachers. Please, Rohit.
Any queries from the audience, please, if you wish to ask anything? Dr. Pranay, you want to ask anything? Okay, thank you. So again, I have one more question, sir, that you explained that LMS plus LXP, you are proposing amalgamation of LMS one step ahead to the LMS. So still, if you feel that in our country, most of the population in rural background, so they are not well aware about LMS, and most of the higher education system are still lacking the LMS. So how you see this as a challenge for this venture?
Yeah, absolutely. This is exactly the same question Shri B.C. Nagesh asked us, the minister, the primary education minister of Karnataka asked, when we actually proposed the Springboard platform. He said, the first thing is, I don't want to implement this in Bangalore. I don't want to implement this in Mysore. I want to implement in Kalyan, Karnataka, where there is absolutely shortage of good educators or good faculty members. He also mentioned about the challenges like, no infrastructure, government schools, and he was primarily talking about the government schools, not the convents or other things. So the only way we can actually break this, it has to start somewhere, sir. So what we told them is, we have a massive, computer donation programs. Many of the companies are doing it. So today, everyone has shifted to the laptop. So the personal computers that we had, all of them are being donated. So what we assured the minister is, we will actually contribute towards, creating the labs in the government schools through our CSR funds, and we have donated a lot of computers. We also said that we can actually create some local network, the Wi-Fi networks and all those things. And also what they are asking is, can we actually have the expert, especially mathematics and science? These are the two areas where the rural schools, they don't get good teachers. Is it possible, by the way, Springboard that I spoke about is available in the local language also, 14 local languages. So what we told is, we can actually capture the recording of something like, in today in Byju's and all, you have all the recorded lectures available. So a good mathematics professor or teacher explaining about the concepts can be captured in a small bite-sized form. We will host it, make it available. What we need is one teacher in those schools, because there is always Ekopadhyaya Shala, one teacher, and that person can facilitate the learning with the video being played, and of course the person can also learn and do it. So this is an approach that we thought is going to work for those rural places. There are impediments, there are constraints, but I think the time has come. Even today, sir, the banking, sector, everyone is having the local account today, right? So today, even a street vendor is actually using the UPIs for making the payment. I think we are going to break that barrier that existed yesterday. And I think the days are going to be completely digital. So there are some ways and means. It requires conviction, it requires determination, and it requires certainly willingness to work towards it. It's a challenge, but it is all up to us to convert the challenges into opportunities. That is the only time when we become successful, sir.
Yeah. Thank you, Dr. Sundar. I think you have given us a feedback, and luckily, the chairman of Education Regulation Committee, Dr. Dipender Singh, is with us today as the chair of the session. So I think he can take a leaf out of it, and we can introduce some basic concepts of technology where the informatics will be taught to the pharmacy students also.
Yes.
So that may be the way ahead. And secondly, I saw so many channels, DD Nationals, that there are 24 channels where the engineering education and basic science education is going on live for the students. I think it will be a great platform if Infosys join hands with this Ministry of HRD. And similar you can do for pharmacy. Irrespective of the area, I think everybody has access for the television satellite channels.
Absolutely.
And one nation, one channel, one class.
Absolutely.
Thank you.
Sir, with your permission, I'll just take 1 minute. I know I'm running out of time, but let me tell you, I know we have a very sparse crowd, but I want you to let you know. If you think that IT is a foreign land, I am only a pharmacy student. I think we are going miserably wrong there. IT, which is nothing but storage, compute, and network. They are like the ABCD of of English. Today we are learning the alphabets. We are learning English not only to learn science but also social studies, but also mathematics. We're using that language. The IT skills are the core skills that are required to solve any of the problem, be it socio-economical problem, be it pharmacy problem, be it medical problem. So there is computer science is just a tool. It is not a branch of engineering. It is a tool, and we have to learn the tool. There is no escape from it. So my sincere, humble request to all of you is, you have to be IT enabled. You need to know what a database is all about. You need to know what a programming language is all about. You need to know how the screen is designed and developed when you are logging on to any portal. And we have the ways and means to do that. If you have interest, the only the only impediment to learning is motivation. The only friction to learning is motivation. If you are motivated, there are plenty of opportunity. And as I said, we'll be more than happy. Springboard is a household name today, and we are launching it massively in India and even outside also. And I have the primary responsibility along with my other team members. So we'll be very happy to support you.
Thank you, sir. I think you have given the outcome of the session, that motivation is the key to learning. Thank you.
Thank you, sir. May I please request the session chair and co-chair, Dr. Rohit Datta and Dr. Dipendra Singh, to felicitate the speaker, please. The next talk in the session, Technology in Education, is on the topic Simulation and Experimental Learning. The speaker of this topic is Shri Aniket Jha, Vice President, Marketing, Simulanis Private Limited, Nagpur. May I please request the speaker onto the dais, please. May I please request the chair and the co-chair to introduce the speaker of the session? Thank you, sir.
Thank you. So the next speaker of the session is Shri Aniket Jha, who is again a techno expert, and he is the Chief Experience Officer at Simulanis Private Limited. Please correct me if I am wrong in pronunciation of this particular company at Nagpur. So, it is written at the Nagpur. So sorry from the LOC. So he is a technologist, having done his PG from University of Westminster with 15 plus years of tech and management experience. Shri Aniket has founded 2 companies, and now he's a CXO with Simulanis, India's most awarded XR company. And he deals with the solution in artificial intelligence, machine learning, AR, VR, XR, the 3 domains, with strategic clients, and leads brand building programs. I think it's heartening to see such young entrepreneur and leading the tech companies. And we are sitting here on the dais and we are completely out of this cloud computing. And I think we are thinking that we need to take some more session because the technology is taking pace at a speed of anything. And we need to cope up that speed. Thank you. Please take the session ahead, sir.
Thank you. Good afternoon, everybody. I hope everybody can hear me. Yes, no, maybe. Okay, can we have the slides, please? On the screen. Thank you so much for being there. It's a pleasure and privilege to be amongst you and presenting before you. I take this privilege, definitely. So we're going to talk very briefly. I know we're running short of time and I'll make it as quick as possible. But there's been a very interesting talks, especially with regards to technology and how the education is intermixed. I'll get it down more towards the outcome of the education. But before than that, can we just get going? Does this work? Right. Hello. Okay. So how many of us has experienced metaverse? Right hand up. If we have, great. We have practically nobody. Okay. So then we have practically yes, and majority of us are no. Metaverse is by default, again, it came down to the a very new word, I would say, because of Facebook turning its name to Meta. Meta means the infinite and verse is for the universe. Okay. But moving that aside, I will just try to break down the technology in three basic aspects, which will help us to take it forward. So if you could run the video, please. This is augmented reality. Augmented reality is when I have a practical a platform, let's say a real platform, and on this I superimpose a digital asset over it, a digital model over it. So that is what, sir, can you please play the video? Thank you. No, without the sound, please. Sir, without, hello. Sound, no sound. Mute. Sir, we got to mute the video. Thank you. So the idea is, if you could see, it was, will you restart it again? Mate, I need 2 minutes here, please, for the session. Thank you. Appreciate it. So if you would see, it is just a piece of paper. The piece of paper that exists in the physical world. And when we use a tablet or a mobile phone, we are able to see what it would function like. You can imagine what it would happen when it is functional. Okay. Obviously, the use cases are immense. Industries have been using it. It is being particularly used by majority of the companies, especially in the automobile industry, to save them millions and millions of dollars, because they don't have to prototype the car now. They can just create in the augmented reality and get the exact output and the way how it would work like. This happens practically for anything and everything. Okay. So far, so good. Are you with me? Thank you. So we'll move to the next slide. Next slide, sir. This is called mixed reality. Can you please play it without the sound again? Please start playing it without the sound. So this is a use case I'm particularly trying to showcase across. This is mixed reality, MR. Okay. So mixed reality is where I exist, I can stand, I can see. However, I am able to interact also digitally in it. This is one of the particular use cases where we can see that we support where we are practically doing something. So it's a very small case study that I'm trying to highlight it across, wherein the person, now the use cases that they have to do a changeover on the actual shop floor. So how do you do that? First step, wear your gloves. Second step, make sure your helmet is on. Third step, your mask is everything. So with that, and then how do you have to perform the process? Now that process, if I had to do it practically, I had to carry a manual of not less than 100 pages for me to happen up. And then I have to actually refer it. And if I'm not able to refer it, what's going to happen? I'm going to lose down my productivity. I'm going to lose down my time, right? And this is what exactly happens up with the help of technology. If you are unable to see it, you don't remember, you don't have to. You've been guided up what you have learned in theory. You've been guided step by step to see it, perceive it. And if you want, you can actually look at it. Okay, I forgot. What was the next step? Sir, you have it right there. How was it supposed to be done? It's right there. Look to the left and you'll be able to see it. Just not that, you have also been guided of how and where you had to take that step on the machine. Machines, I am sure you would understand, are worth crores of monies these days, right? Any manufacturing unit, any capex intensive industry would understand that. This is one of the sessions where the person is being guided and is able to also perform the activity, and with the help of the support of mixed reality. Next slide, please. Sir, next slide. Thank you. So this is again a virtual reality. So augmented reality, physical world, digital asset superimposition. Mixed reality, digital world, running at the top of it is the mixed reality. The digital assets you can see. Virtual reality. Here you are involved. You are a part of the world. That becomes your reality. You may not be crossing up, you may not be walking, but then it actually happens up. This is an actual pharma case that I'm trying to showcase across. Here, the person, my colleague over here, Ritesh, he's actually standing and he's working, he's handing the controllers, and he's been able to see what a fluid bed dryer would work like. What are the functions to happen? We have been hearing our speakers talk about bite-sized information. This is exactly bite-sized information. One module probably helping you to understand one particular aspect, but completely. Now, the interesting thing happens up. They are able to understand what is exactly moving in the machinery itself. So they don't just listen to it, they are able to experience it, rather they are performing it. Okay. Sorry. Oh, sorry. No mind. So next slide, please. Okay, so then we hear a term which is called extended reality. So what is an extended reality? Just to give you a brief, it is an umbrella in which augmented reality, mixed reality, and virtual reality exist. So far, so good. Everybody with me? Any doubts? Great. Thank you. Can we move ahead? So we are used to learning via 3D. Even when we read on the computer or on the books, on the textbooks, we basically convert it into 3D, and that's how we understand or we have the information stored with us. So 3D, that's Mario, means we would see how would you remember it, and then this is actually how you would remember it in the brain. Now, which one is easier for you to remember? It's the same character. The left one, the right one? So right, left, sir. Which one? Okay. Obviously, it's the right one that's mentioned up. So that's how the image is stored for us in our brains, and that helps. Our world is built with sounds, and with that information that we're storing in our head, with that 3D information, there are sounds, there are simulations which practically store, which becomes a memory for us. Next. So this is a very interesting thing. We were at Stone Age for the longest period of time that we have known. Now, oops, this works. Okay, it doesn't. So Stone Age is basically where we were the largest time that we have spent as a man age. And what happened? We knew to run, for an example, only maximum till 15 kilometers per hour. That was the best that we could have done. Come down to information age. We are doing at 17,700 kilometers per hour, and that's the rocket. Now, what has changed over these years? What has these different ages got to showcase across? In every stage, the exponential growth that has happened up, let me tell you one thing, sir. The only difference is how we are representing our data and how we are accumulating our data. And that's helping up to go to the exponential age. Obviously, the information age, as compared to where we have, it's just a tiny spot we are currently living in today. And the next is most likely the exponential or the knowledge age. Right? So what are the current present challenges that are faced by the industries, the working, anything that's fresh out of graduate, what would happen up? Increasing product complexity. Anybody can say that, no, we are doing more simplistic way now. The operations and everything are going more complex. Time and cost of training, that has enhanced because experts are required. It's just going on increasing number of places where we are. Long and costly sales cycle. That's another trend that has been seen where the market is purchasing, but they're purchasing at a later stage. They're not purchasing on the go. So there's a long sales cycle that the industries are facing, and the employee efficiency and safety definitely is a concern for any unit to happen up. So how, I'm sure all of us have given interviews. Anybody who's not given an interview? I'm sure we all have done, right? And when we go to the interview, the kind of question that we are asked is, we need skills. So I am fresh, I have learned, I know exactly what I have to do, but then at the same time, I need skills. Interesting. So let's define the skill for a second. The skill is ability to do something, especially because of practice and training. One step more forward in the education sector. Why practice? So Edgar's model, so if we could learn anything, and after we had a discussion, and after 2 weeks, if we had to really rework on that what was our takeaway? If it was just a reading, I would have given you a sheet of paper, it would have been 10%. 20%, you can hear me. You're not reading, you can hear me. 30%, you can see me and hear me at the same time. But the interesting thing, we come down at here, we can remember 90% only if we are doing it. So the idea, the basic one of the outcomes of education and colleges, or education per se, is that we acquire the skills that can be utilized in the real world. And to do that, the only way you can do it, it says in the study that you can do it by doing it. Now, how do I bridge that gap? I'm not in the industry, I'm not yet working, but also at the same time, the expectation is that I should be able to do that. So that's learning by doing. A couple of case studies that we had seen across the models of VR that we are looking about. If I could tell you that, let's say in the pharma industry, mixing operations, separation process, drying process, material dispensing, changeover operations, all of this is something that you have performed on the shop floor without going to the pharmaceutical industry, but you know exactly what it happens, and just not what it happens in theory, but you have performed each step of it, and you will be able to do it. Sounds interesting, right? What if you could learn in sync? Video, please, sir. Now here, there's another case scenario where we can build across different people. Now that's two friends, two colleagues of mine working up. So they are wearing reflexes. That's another hardware we give. So they are wearing gloves. But what if you are able to work in sync, just not by doing it, but even collaboratively doing it? And that is something that's possible, and that happens. Next, please. This is another case in a scenario of simulation that I'll give you. Can you please play the video, please? This man is getting trained or is experiencing how it would be if you would be standing on, let's say, a 30-floored building and you are working at height. Okay. What if you are working at 3 floors, 30 floors, how would it feel like to work it up? And then every step that is taking is on a scaffolding. And this is more of an extended reality where it comes down to be where we are actually integrating the physical objects with the help of IoT, Internet of Devices, and giving them this experience in virtual reality. And the fun happens obviously when he falls. So it was the training that happens of what would happen if you're working, and if you don't take the proper steps, you could fall. And with the haptic helmet, they were actually experiencing how it would be to fall. These are a couple of hardwares I would like to just showcase across that are available in the market and being used to happen up. Oculus Quest 3, RealWear. There are, depending on the needs, there are different kind of these hardwares that are there. What is the impact of what happens exactly when it happens up? So this could be interesting for us. What if I would say there's obviously reduction in time, which is 20%, and this was by third-party assessments that has been done. But let's say a course is of 5 years. But with the help of actually acquiring skills, you could reduce down 20%. Can anybody tell me how much that 20% reduction would be? That would reduce down to 4 years. You can actually add up 1 extra year, and that too with the practical knowledge and industry knowledge to happen up. There's 87% reduction in the errors that happens up. These are just a few more cases that I'm trying to highlight, where bringing in the technology to actually acquiring the skill helps and to take it forward. I'll be more than happy to take any questions that are there. And before then that, please to visit us. If you have not experienced what a virtual reality is, trust me, it's an experiential learning. Please to visit us till 6 p.m. at stall number 5, and we'll be more than happy to help. Any questions, please?
Thank you, Aniket Haji. It's a pleasure to learn something new. Again, in the series, we had an insight, or you can say overview of the various realities. Few of the realities is also very new for me. So Aniket has just explained about, he told about us augmented reality. Okay, we heard mixed reality. This is something new, which he is talking about how we can utilize it. Then virtual reality and extended reality is something new for me too. So I'm very thankful.
It's there in this college for a year.
That's why I'm saying if we the teachers are, you can say we are way behind you people, because you people are taking the things at a next level. And we heard about that, but we never had an experience. Maybe this video is also available on the internet, but we are not bothered about it is there or not, because we are least concerned about that. But you told us how to utilize it, and I was thinking how to utilize in our industry, and indeed it will reduce our pressure, and also where you need a very proficient worker or there, and he can practice at a virtual world. So thank you, Aniket, for giving us good information, which can be very widely utilized in the industry as well as different places in the pharmacy. Thank you so much.
So thank you, Anketji, for enlightening us about the augmentation of XR, AR, and other 3D digital transformation, basically for industrial setups. May I ask one query, that whether the companies are looking after similar kind of trainings at the education level, higher education level also, because obviously the graduates are going to join the industry. And if straight away they are going into these technology, maybe they are not fit for that job role. So are your companies looking after that prospect also?
So it is very interesting. It's question one. We started in 2013. So it's been 8 years we've been doing this. The companies are the maximum buyers, and pharmaceutical industries are our major customers. So definitely it has been running up, and you would be surprised to know the names and the companies that are utilizing this technology for years now, and just not a couple of months. It's something not that's new. It has been used very much. With regards to training and education, that's the whole idea, that it has been already been utilized across. So if I had to give you this thing, when you say about skilling India, so we were talking about skilling in the rural, skilling up here. what is the basic challenge that you face when skilling in a rural area? Anybody? Sir, Jio ne kar di. Internet connectivity is not a problem anymore. Resources, getting the trainers to go there. Now, the courses that I'm there or that's available even here, you would be surprised they are built and approved by the industry, quite a few by the government, and they have been utilized to train. Now, I'll tell you what, you are going to learn from the expert n number of times at your convenience, just putting the headset and the controllers on, and it is guided. So there is a guided mode, there's an unguided mode. The guided mode takes you where they step by step you will be learning the skill. Unguided mode where you can do the assessment, but it can also be done in any number of languages because it's built up. This is actually taking the expert knowledge to any part of the country within no time, and it can be carried practically in a case.
Hello.
Yes, hello, can I help? This guy doesn't like me here. Anyway, so I hope that helps up the solve. It's about giving an expert skill development to happen up across anywhere. And trust me, this is the head, just the tip of the brain. If it would come down, I could showcase fire extinguishing simulators, welding simulators, the n number of cases. How would even in the pharma industry, the models that are there, everything before even a student can go out in the real world would know of it, and just not know in theory but know it in practical. Obviously it helps to raise EHS for environment and safety, because you can immediately highlight if there are anomalies that are being said across, and definitely it helps in operations and even taking them steps ahead in because the skill is the experience, right? You are able to skill that experience in couple of months, and that could, that's exponentially high. So the study shows that we have done is we have seen a drop of 30%. So if we were training like 4 months to train somebody, with the help of VR, we've been able to do it in 3 months, and that 30 days is more productivity. It obviously enhances quite a few things. So that's it.
So thank you, Aniket, once again. So explaining everything in a manner which was required. Thank you so much.
Thank you so much for having us here. It's been a pleasure.
Yeah, thank you, Sri Aniket Jha. May I please request the chair, Dr. Rohit Datta, and co-chair, Dr. Dipendra Singh, to felicitate the speaker with a shawl and a memento, please. Thank you, sir. On behalf of the organizing committee, may I please request Dr. Salahuddin, Principal, Al-Amin College of Pharmacy, Bengaluru, to felicitate the session chair and co-chair. Thank you, sir. Thank you, Dr. Salahuddin. I also take this opportunity to thank Dr. Rohit Datta and Dr. Dipendra Singh for chairing the session. Sorry. Let us all break for short break for refreshment. I request the delegates to kindly gather back in the auditorium by 4:50 p.m. Thank you. Welcome, sir. Yes, sir. I kindly request the chair and the co-chair to kindly introduce the speaker of the session. Thank you, sir.
So good afternoon, everybody, and welcome Sri Sunil Atavar, sir, the Chairman and Managing Director of Group Pharmaceuticals Limited, Bangalore. And he is currently the Chairman and the company which is primarily focused on dental and oral care. He has over 35 years of experience across various roles, starting as a medical representative with the last 20 years as the organization head. He has led marketing, human resource, finance, product development, and overall business management teams. So he is credited with launching 9 first-time in India products in the dental segment and continues to launch innovative products in oral care through partnership with Indian as well as international universities and in-house research. This focus on innovation is also seen in the 3 granted and 2 ongoing product patents registered. So Mr. Sunil is a part of many industries advocacy groups. He is the immediate past president after completing 3 terms of the Karnataka Drugs and Pharmaceuticals Manufacturers Association, that is KDPMA, senior vice president of Federation of Pharmaceutical Entrepreneurs, that is FOPE. He is vice chairman National Alliance of Pharmaceuticals Association, that is NAPA. He is also associated with many colleges as a visiting resource and is the governing council member of Acharya and BM Reddy College of Pharmacy. Member of the Planning, Monitoring, Evaluation Board of Adi Chancheri University. He has served on the board of trustees of a leading international school in Bangalore. So it's a great personality to be with us, having so many things, so many achievements into his credit. And in India, where tobacco and all those things affect a lot of dental cares and oral cares. So the speech will be really valuable. So please continue, sir.
Thank you, Dr. Mir, for that introduction. Good evening, everyone. I usually in every college that I go and I start with this great slide, and I think there's no more apt occasion that I can once again present it. It's a great quote by Aristotle, which says, it's for teachers. So those who educate children well are more to be honored than those who produce them. For these only give us life, but those, that is the teachers, teach us the art of living well. And it's a great opportunity also to thank, as a lifetime learner, I think I thank all the teachers who are present here. And if there are students, I think our teachers deserve a big hand. Thank you very much. So I thank the organizers for giving me this opportunity and to do this lecture, and especially Dr. Suresh and Dr. Pramod and the team who pushed me. And I said, this is what I'm going to talk is not science, but they said it's very important that you are here and you talk about industry academia. So it was in 1965 that Prime Minister Lal Bahadur Shastri gave us the slogan, Jai Jawan, Jai Kisan. This was soon after we were attacked by Pakistan. And it was to enthuse the farmers and also, you know, the army and the armed forces. And that was a great slogan that we gave, which we continued. In 1998, Prime Minister Vajpayee added Jai Vigyan. This was immediately in Pokhran. As soon as the bomb the nuclear, we did the nuclear blast. And that was to, again, enthuse the scientists. Jai Anushandan, which means innovation or research, was something that Prime Minister Modi spoke at the 106th Indian Science Congress in Punjab. But I think like many scientific meetings, a very close community, he re-emphasized and he made this clarion call at the 75th Day of Independence when he spoke on the Red Fort, and he said that we should focus now. It's time for focusing on research and innovation. And that's to enthuse all of us that we should put our attention here. So hence my topic, Jai Anushandan, a clarion call. A clarion call means a very urgent call to academia and industry to collaborate. It's something that is very urgent. The reason is when I was preparing for this presentation, I went back to when I started with KDPMA as a joint secretary about 13 or 14 years back. And I saw that even 13 years back, we were talking about industry academia collaboration. It is not something new. For last 13 years, we've been we have seen a lot of islands of excellence. Things have happened here and there. There are few outstanding colleges and universities that have done outstanding work in this direction. I also remember when Dr. Goli was there, we had a very big conclave where we got students and industry together to interact. We did one thing in Rajmundry. We've done these small islands of excellence. But if research has to become a part of our culture, is something that the community has, then I think everyone has to do it. So my presentation is in two parts. Why do I believe that it is an urgent matter? And what can we do about it? And this point of what we can do is all from my experience. Nothing else but just my experience. So the first part is, why is it so urgent? Yesterday, I think even in the inauguration session, our chief guest, Mr. Sudarshan Jain, spoke about it. Other speakers have spoken about it. But why is it so urgent? Why is everyone still talking about it? We all know India is the pharmacy of the world. There's absolutely no doubt. Medicines are the one product that we export to 220 countries. Our vaccines, we've got all the data, and we've shared all that with you about why India is called the pharmacy of the world. But the fact is, out of that, 95% of the medicines we make are generic. In India, what we consume. Even the other 5% of patented products that sell in India are actually international patents that we are selling. We are just like the like most of the IT industry. The pharma industry is the back office of the world. Somebody researches it and we copy it, or we develop, means we use our, what we would say is our ingenious technology to make it at a better price. And that's why we are selling it all over the world. Today, our exports, we are a $25 billion exports, and we export to 220 countries. But the export is dependent on cost. It's because we are making cheap medicines that the world is buying from us. The fact is that we can't continuously to be in that cheap category for the world to look at us. We are dependent on global research. We are dependent on global requirements. So if things change, and which are changing post-COVID, because the world has seen what has happened with supply chain disruptions. And we have seen within our own country, when the COVID lockdown was there, we couldn't get medicines from one part to the country to the other part. So in fact, every state, every country is looking at make at home. There are a lot of delegations in the last 1 year. As an association, we have seen delegations coming from all across the world and coming and requesting us, please come and manufacture your products in our country. Nigeria, which was one of the biggest market, has banned 140 products for import because they are saying we will only manufacture it in-house. We will not import it. So our import growth is also now going to be dependent. If the whole world starts making at home, then it's going to be a big challenge. Our domestic growth is also driven by demographic expansion, because healthcare was at less than 1% of GDP. It's been growing up a little bit. Income levels have been going up. We have been able to reach into the villages and into the small towns. So our growth has, the demographic growth of our country and India's growth has matched. We had many tailwinds. We as an industry should face it. We were supported a lot by government. In the early 70s, we moved from process patents to product patent, because of which we could copy medicines very easily as soon as it was launched abroad. Because we were not in the patent regime, we could copy medicines and launch. We also know that you all know FDCs, or fixed dose combinations. We went on launching all kind of masala products in the market. which finally became almost 40, 50,000 crores. And then the government intervened and tried to control it. We had a very liberal regulatory regime. Most of the products that were launched did not require bioequivalence, bioavailability. But in the last 5 or 6 years, all that has changed. Today, without bioequivalence studies, I cannot launch a product. Now, we all know how difficult it is to get that. So these are things or challenges that the industry is facing. India is the youngest population in the world. We are very proud of it. And we say that we have so many young people, but the fact is, in 30 years, India will have the largest old people's population also. Our disease profile will be very different from what it is today. It will be completely different. And the world is not doing research for us. They are doing research for their problems. They are not doing research for India's problems. So if India doesn't look at research as something that is important, we are going to face a lot of challenges. And that is why I believe that right from the Red Fort, we heard that clarion call saying that we need to focus on research. Also, why is research important? Because pharma is not about pills and powders anymore. If you look at this study or this data which has come, recent data, 2022, about what is the new trends in pharma in 2022. And you can see AI, we have heard a lot about big data analytics, flexible production. Flexible production is where you're doing 3D printing of medicines. You're just taking a medicine depending on each person, what he requires. Because today I take a paracetamol, I won't say 650, very controversial, but 500 milligrams paracetamol, whether the person is 90 kilos like me or 45 kilos is taking the same dose. So 3D printing, flexible manufacturing or production is the new thing. It will happen in small batches. Precision medicine is where medicine will be given exactly what you need. Additive manufacturing is a very exciting technology where, especially in biologics manufacturing is very complex. And they find it very difficult to use motors and stirrers. So there are these companies who are using bubbles as mixing agents. Blockchain and extended reality. Before this, we had a session in where extended reality is being used. Real world data. See, today, because of digital, all the information, our information is on the cloud. Ayushman Bharat has the largest number of disease patterns and data available. All over the world, DNA analysis is becoming a part of like a blood test. Now, all this data is being used by companies in order to create new, predict what is going to be the next, requirements of medicines, what is going to be the next disease, and curative therapies. And these are all the companies, and this is not textbook information. These are actually companies who have already started using it. So this is right here. Very soon you may hear these companies, or obviously they'll be taken over by larger companies, and the big companies will have all this information. So we obviously, as a profession, as a pharmacist, we really need to step up on this. We talk a lot about being self-sufficient, but without having research, we cannot be self-sufficient. And the fact is, if I look at global data, which we have picked up, all over the world, 24% of drug discoveries actually comes from universities. Doesn't come from pharma companies, which are there. Most of the development, the initial development work or the information actually is happening in colleges. In the last 25 years, they say almost all, including the COVID vaccine, actually has been introduced by PS, which is public sector research institutes, which is government funded. Almost all the vaccines have come out from there, not from pharma companies. Most biotech startups are from colleges. India, unfortunately, ranks 22nd in patent filings in the world. This is latest data. And what even shocked me more was that most of the patents filed in India are by international companies, not Indian companies or Indian universities. So all this is a big challenge. All this is something that really, in a way, should frighten us, because in India, till we don't get frightened or something is not urgent, we won't start running. We know that. If Dasara is there tomorrow, we'll start cleaning our house today. That's how we are. And I think all this should tell us that we really, as the profession, as colleges and the industry, we need to come together and we really need to focus on research. And the next part of my presentation is about what we did. So I am very impressed with this quote by a singer, actually, Morgan Nicholas, who said, "Tell the story of the mountain you climbed. Maybe your words could become the page in someone else's survival guide." So the next part is going to be absolutely experiences that I've had. So we've had many collaborations in oral care, some of which, what I'm going to list is about 5 or 6. But if I have 5 success, I am sure you will understand we must have had at least 25 failures. So all the learnings from that. So we worked with a team from University of Florida to launch calcium sodium phosphosilicate, which is again an oral care product. This company came and then we introduced the product. We developed the toothpaste. It went, and finally the company was sold to GSK for $135 million. We are working with the University of Columbia to launch a botanical oral rinse. In fact, our contact or the professor who's working with us is an alumni of JSS College, Dr. Jaishree. We worked with the Imperial College of Dentistry and Queen Mary College London to introduce a product called Biomin, which is actually a path-breaking ingredient for remineralization of teeth. It's has global recognition. It's exported to 40 countries. So we took this ingredient, and through our experience, we worked with the college. We manufactured the product. Today, we export the product to about 63 countries. And also, I'm very proud and very happy that we are working with JSS Academy of Higher Education University on these 2 projects. One is a dental denture stomatitis herbal MU gel. Dr. Meenakshi is here, and we are very closely working. And I'm really looking forward to this. Could be as a company, a first product that we could take from an Indian university and make it and put it in the market. It'll be something very, very special for us. And it's ready. The product is ready. It's a patented product by the college. We worked on a very good agreement where we will share royalties over the next how many number of years. So everyone benefits, and the product will come to the market. We're also working with the fennel gel. It's undergoing development in JSS Ooty. So these are projects that we are working. One of them is already ready. In a few months, I think we should be able to scale up and then take it. We also work very closely with MCOPS, that's Manipal College of Pharmaceutical Sciences, where we are very surprised. We do a lot of data, we do a lot of marketing, but most of our marketing is gimmicks, as we call it. When we are able to go with evidence-based marketing, it becomes a big help to us. So based on these collaborations that we have had, I want to share what we learned. One is that you don't have to be big to collaborate. There's always this thing that I have to be a very big company or to be one of the top colleges. It's not absolutely necessary. We are not a very large company. Yes, we are medium sized, in the top, maybe about 100 ranked in all among the companies. But we've been able to do good work because we have collaborated with universities. So the mindset should be that you can collaborate. The big thing I always hear is about trust deficit. There's a trust deficit between industry and academia. Now, trust can be built because it has to happen slowly. And I always recommend, to build trust, you have to meet. So it's very important always that the colleges and the industry and the key people meet, so that when you meet each other and you face to face, you build that trust. You do small things, take small steps, trust will build. There should be long-term benefits for all stakeholders. This is very important, because otherwise, if it's just a short project, 6 months project, 3 months or 1 year or 2 years project, people then lose interest. And there should be some benefit that occurs to everybody, all the stakeholders. So whenever I go to college, I make this request and I plead that any project that you're doing, and if it's going to get commercialized, the college, the professor, and whoever is involved should be a part of the returns or the benefits that come out of it. So if we give you royalty for the next 15 years, whoever was involved in the college also, who was the teacher, the professor, or the assistant professor, or the HOD, and the college, all should be benefited. And same thing should be the company. Often I see in many in the past when we tried, many of the colleges want like, okay, we have a project, we'll give it to you. And at the end of 6 months or something, you pay us something and it's over. Now, many of the research that happens or products that come to market will take anything between 18 months to 5 years to launch. It's not easy to launch a product. There are many regulatory processes. You do scale ups, you do trials, you do market research, and then so you must have that patience over time. A robust review process is a must, because if you don't review, I suggest every 15 days. If 15 days is not possible, every 30 days, every 45 days, whatever suits the team, there must be a review process which is documented. And development projects, especially product development projects, should be people agnostic, because sometimes teachers will leave, sometimes a student who was working on the project may leave, but the college or the university must ensure that the project is carried forward over time. Otherwise, what will happen is, and that is where many projects fail. Once the student has made their publication or has filed their what you call thesis, and that's the end of the project. And then the company feels very cheated, or they feel home and they don't, have the motivation. So any project that starts, especially development projects, should be people agnostic. What else we learned? That what do colleges have? Absolutely, you have the knowledge. Let's face it, the knowledge resides in you. That is where it is. Industry does not have the knowledge that you have. And that is something that we must accept, and we've learned that it's available there. You have the resources, you have the teachers, you have students, you have the library, you have access to global resources as a college or as a university, which I would say 99, in India at least I can say 99% of companies don't have that resources. We don't have it. We have to depend on you. You have time. When I say time, is not that you're not doing anything, but you have time means because the student is there for 3-4 years or sometimes 6 years. Professors I see are there for at least 7, 10, 12 years. So, it's possible to take projects forward. And you have cross-discipline access. Means today, as we've seen, you need to link different disciplines, whether it is pharmacy to engineering, to dental, to medical. Now, if we have to do as a company, and if I have to, like, if I had a challenge in, if I have a problem in dental department and I want to talk to pharmacy, I will have to talk to 2 people. But if Dr. Meenakshi calls a pharmacy HOD on something, she'll immediately get the connect. Or there is something else, and if you're doing medical devices, you may go to the engineering side, and because peer to peer, you will get a lot of support. What does industry have? We have the need, as I said. Very frankly, I can talk on behalf of the industry. There's a desperate need for products. There's a desperate need for growth, because the old ways of growth are gone. So new things are absolutely required. We have the reach because we can take the product, both domestic, we can take it, global. We have speed, we can take decisions because we've seen colleges are pretty hierarchical in their structure because you're a large, you have so many things to do. Companies can actually move things fast, and we have the resources. Most companies have sufficient resources, and today getting funding is very easy, and we have the market to take ideas forward. Combining these two can actually be a winning combination, and that's what we should do. What should industry expect from college? What industry expects, and this is from my colleagues and friends that I've talked to, and even my own experience, is that we need trust and security of data. Because often we say that you may take a project halfway, and then if some information goes to some competitor company or to some bigger company, the companies would have lost. So what we expect is trust and security of data. We expect seamless long-term commitment. And I think that is what is very important, that it should not be, focused for a short period of time. We need data that is robust to verification, because today everything is about, if I go to a regulatory officer or I go to, first thing they will ask is data. And that data should be, open to scrutiny, and we should be able to justify that, yes, if this development has happened, this is the data that is available. This is what the data says. These are what are the toxicology studies. They should be genuine. They should be available to us. What colleges should expect from industry? Again, trust. You should also, whenever you I think that's what is fair, that you trust the company that whatever information you give us or what you do will not be misused. Again, long-term commitment. And I think colleges should expect or demand fair returns on whatever you're doing. So if I earn something, I should be prepared to give you back a percentage of it. That is something that you should expect. And of course, timely investment. I think that's what you should expect from companies, that if you commit that this is a project on 18 months and it's going to cost X so many lakhs of rupees, then on that time to time, whatever money is to be given, we should give you. So what are the areas of collaboration that is there? And how can we do it? One is, I suggest that we have a collaboration cell with IP commercialization division. I see a lot of colleges, they have an IP cell, but I think commercialization of IP is something that you really need to find the right people, because information is very valuable, and if I'm earning from it, I should be able to give it to you. It's very important to propagate your area of expertise. See, all colleges, from my experience, all colleges will not have everything. So different colleges will have different technology or a different area of expertise. So I know some colleges, maybe sometimes because a professor has been there and he's a great researcher and he has a lot of information, will be very good in a particular, maybe on process development, or somebody else is in phytochemicals. So the whole idea is that whatever is every college USP should be propagated. We won't know. I've been meeting so many professors here, and my colleague has been introducing me. He's a great doctor on nanotechnology, and he's a great doctor on herbal technology. But I don't know. The industry doesn't know. So it becomes very difficult for us whom to reach out to. If you're reaching out, it's like a call in the dark. So you should propagate your expertise. Define a process. Very important is to define a process. So when any company comes in and says, we want to collaborate, so the IP cell will say, okay, if you want to collaborate, these are the definite protocols that you'll have to follow. This is the cost. So the company is very clear that, yes, I can get in or I can't. If something is very expensive and I say, sorry, it's going to cost 20 crores, sorry, I can't. But there may be another company who can do it. So that is why you need to define a process in the college and put in a strict review program, have timely investment made, and celebrate wins. We don't see celebration of new products that come or something that collaboration has happened. We don't celebrate that. We should celebrate wins. And I think this is something that I saw, I added it in the last minute, because just 2 days back, the government of India has allowed CSR funding for state government sponsored research cells. So I think colleges should take this up, and maybe APTI should take it up, and college management should take it to, and with industry, we can ask the government to allow colleges R&D cells to have support. In fact, when we were talking about this collaboration, my colleague sitting here and we made a white paper on, which we are happy to give to any college, on how you can set up and we have sent it to many colleges, how you can set up an industry academia collaboration cell. So anytime we are free, Mr. Sunil Chiplunkar, I think everybody knows him here, and you can reach out to us on LinkedIn. We are happy to send a PDF. Now, another thing on research is that research and new discoveries are a very big thing. It takes 15 years, it takes crores of rupees. So I suggest, please start small, because we are building a culture. Culture takes generations. I can change my religion overnight, but my culture will take 1 generation. So cultures are very difficult. So please start small. Start with dossiers. I've gone to many colleges and I've suggested you start getting the students accustomed to writing dossiers. Dossiers are 2 types. One is marketing dossiers. Say I want to launch a nano silver gel for wound healing, and the company wants to launch it. And I don't have full information, because as a company, I don't have access, but you have access on everything. Interactions, what will happen, what are the indications, contraindications, what is the excipient and active indication, interactions, what I should use, what I should not. If the students start getting into that habit of writing dossiers, also regulatory dossiers. Yes, in the regulatory dossiers, there are some which are secret. Most companies will not give, but a big chunk of the dossiers, if you have the college can start reaching out to company and say, okay, this part of the dossier we will take care. Because anyway, companies are outsourcing it to some consulting company. And that consulting company, we are signing an NDA. We write whatever same thing can be signed with the college. And we are paying lakhs of rupees for each dossier, maybe 1-2 lakhs to just, prepare the documents. It's my information which they are using. Why can't the college do it? Because the students need to get into this habit of research, of writing, of doing things. So dossiers is one. Incremental innovations. We don't have to go to new discoveries. Flavor improvements. What do you call? I'm using one opportunity here. In oral care, I've gone to many colleges and I've asked, any medicine we put in the mouth gets washed away because this saliva is continuously thing. In 20 minutes, the medicine goes. If somebody can work on a gel that will stay on the wound, on an ulcer or the wound or a cut for 2 hours, you please reach out to us. I will launch that product. So it is incremental and the product is there. You know it. Flavor improvement. Today, everything is about show. Marketing is about show. You take products in the market, improve the flavor, improve the small innovations, dispersibility. That it will use no crocin advance. It's just a very small innovation from normal crocin to crocin, which dissolves or dissolutes in 15 minutes. It's a small innovation, patented. There's an Indian doctor from Hubli who did it. Globally, it is, and he's earning money out of it because of that. Analytical method development. Today, analytical methods have become more and more complex. Companies are not able to, invest quality time. Every college today has a lot of resources. So if you can develop, I was giving an example, say just a very, random example, ibuprofen, paracetamol. So I do an HPLC for ibuprofen, I do a test for paracetamol. If you can do it in a single test and you can patent that product process and you can offer it to company and say, for every analysis, you're going to save 2,000 rupees because you do it in a single injection rather than 2 separate injections, you can earn a lot of money. Analytical method development is a big thing. Dissolution improvements, big opportunity. If you want to know which products to pick up, you can go on the website of CDSCO or you go on many websites of the FDA, and you'll see many products are failing in dissolution. Now, if the college picks up a project and says, okay, rabeprazole, let me pick it up. It's all it is failing. Paracetamol, albendazole, almost every 5th batch of albendazole fails in dissolution. Now, if you go there and you pick it up and a college takes up that process and goes to the industry and says, I'm giving you a foolproof method, you can imagine what is the benefit for everyone. Phytochemical products, India is you saw in my in the previous slides, I'm getting a botanical rinse from University of Columbia. What is it? Pomegranate extract, grapefruit seed extract. I'm sure everybody knows the benefits in India, but there they researched it, did all the studies, documented it, patented it, and now are offering it out to companies. Dosage innovations. Again, as I said, India is moving to a geriatric population. Maybe we can't swallow. You can make tablets which are very soft, tablets which will swallow, tablets which like transdermal can become a new thing. There are many other ideas that you can think of. So these are opportunities that are not discoveries, but are things that you can start in the college, which will actually bring the whole culture of research, the whole culture of innovation, and put it back into the students' hands. And then coming to one of my final slides, since it is a teachers' conference, and I thought I should also reach out to the teachers, how teachers can help. Is it teachers? I can't ask them, I think. One is stay up to date with new developments. It's very, very important. I am part of a school trust, an international school. So we have an IB curriculum and all. So when we talk to the IB boards and boards from international schools, they talk about that when a child is going to enter into school, by the time he passes out from school, the technology and information is already redundant. And the same thing is happening in universities. So a student comes in, and then by the time he passes out, what you call, a lot of the technology has already passed out. So you need to be updated on new developments. Please collaborate with other streams and departments. Very, very important, because medicine is all about now collaboration. I think we've heard the previous sessions also about how IT and VR and things, and you're hearing about wearables. There's a lot of research going on just putting a contact lens, which will actually dispense medicine into your eye. It will also diagnose what is happening to you. It will check your blood pressure. So many things are happening. So inter-department collaborations for teachers are very important. Please interact with industry. I don't know why teachers are very shy to interact with industry. We have an open invite. When you come with students or without students, please come to industry, spend 2 days, 3 days, look at departments, understand what's happening. It will give you a much better idea about what is happening. Look beyond exams, please. Because many times we see a lot of projects, exams are over, everybody is happy, everyone is relaxed, the projects get launched. There is great opportunity beyond exams. I know a lot of examples of where today students are thinking of what they have taken. In fact, we just signed an MOU with a dentist from Kerala. No, he studied in Chennai, I think, from Kerala. He had an idea which he presented thesis, and now he wants to take that product. And it's a long project, but definitely it is something that you need to look beyond exams. And finally, you share the merits of arranged marriage with students. Now, why have I put this as my last point? As an industry, I've gone to many, many colleges. We have a lot of interaction with students. Unfortunately, pharmacy is not an aspirational career. It's not a love marriage. And it's something that students are coming in because there is no choice. So you tried in NEET, you didn't get in medical, you went to dentistry, you didn't get in dentistry. So what's left? My father and my parents are not rich, so they can't pay management fees. So what is left is pharmacy. It's not their first choice. And what is shocking is, go to convocations. Just 2 months back, I think it was at a convocation, and I asked the students there, how many of you have now given up that I should not have done pharmacy? And not even, just 5 hands came up in a batch of 100. So you can imagine what's happening. We have 3,600 colleges, almost 2 lakh students coming out. Imagine if 90% of them are not happy to be pharmacists. Where is research? Where are we talking about research? Where are they motivated? The previous speaker said, motivate. We want to learn. Motivation is learning. But if you're not motivated, what are we going to learn? So I say we have to talk to them. I keep, wherever I go, I use this as my slide. Dr. Goli knows, wherever I go to the college, I say, arranged marriage in India work. Why they work? Because we fall in love with our partners after we get married. It's not a love marriage where before that I do everything. So it's okay. Less than 1% of arranged marriages end up in divorce. So you still have hope. You need to do this. It is something we need to build the pride into the pharmacy profession. It's very, very important. And I'm urging all teachers, please do it. Because if you look at the entire healthcare scenario, the doctor is at the center, no doubt, and the patient. But what does the doctor do? He only diagnoses. Who does the research? Who does the manufacturing? Who does the quality? Who does the pharmacovigilance? Who does everything else is the pharmacist. And I think that has to be somehow passed on to the students. And that is when, as a profession, we will really, things change will come. I was happy we were in an LSSS DC meeting just last week. Dr. Suresh also was there. And the government has now incorporated in 9th grade, I think, in 9th standard in CBSE, there's going to be a chapter, or at least part of a chapter, on medicines, dispensing of medicines, manufacturing of medicines. So I'm hoping that at least the students who come out, at least they have some idea that pharmacists are a real great profession and something that we need to do. So thank you. The best time to plant a tree, as they say, was 20 years ago. The second best time is now. I think even if we start now, I think it will be a great opportunity for us. And we really needed research, and industry is hungry. And I think I would request that even the profession comes forward, and together we can do great work. Thank you very much.
Thank you, Dr. Sunilji. Nowadays, we were talking about industry institute interaction. Now, time has come to have collaboration with the industries. I think along with that, since we are in pharmaceutical profession, we should take even help from hospitals, physicians, because that is necessary. And we are having research in postgraduate. We are having research for PhD and further also postdoctoral research. So at various stages, we can have research according to the projects. And I think for your information, our college is sending students for MPharm final year students. They are going to industry. They work for 3-4 months in industry. They take some problems from industry and they carry out in our department, which is academically it is essential for them to submit a project. So small type of research can be done at institute level. But even I think we should have collaboration with hospitals also, physicians, because they are the ultimately takers. They are the persons who are writing medicines to the patients. So definitely this must be added, I think. Sure. And you have given a very good procedural aspect you have covered, that what is the job of a teacher, what is the job of an institute, what is the job of industry. So how they should be collaborated if they combine together. And naturally, Jai Anusandhan, this is the, I think, Nara of our Prime Minister, and it is essential now. But sir, in Maharashtra, I will tell you, there is we are having pharmacognosy subject. I was telling our people that we should change this name. The moment biotechnology came into existence in India, a lot of people, even parents were trying that their son or a daughter should get graduated in biotechnology. But further scope was not there available in India. I think crude drug technology or natural drug technology should come up now. And there is a lot of scope for doing research on natural drugs, because so many ingredients are available there. And even Ayurvedic medicines, we are having crude drugs, a lot of work we were doing, but that was a crude work. But we can go it for a further research can be done, and industries can. And as far as you have already taken initiative for dental products, so that is also a very good attempt. Those who want to ask any more questions to sir, yes, please. Yes,
Sir,
Mike then.
Before the question, I'll just say one thing.
One or two questions.
In pharmacy, we see fourth year, fourth year students coming for projects or for industry visit. Actually, this should start from the first year. Industry visits should start, I think. I recently, this year, I think because of the new education policy, I don't know why, Christ University is sending their students for a 7-day industry connect before they join college. So this year we have had 3 students who came to us saying, please allow us to spend 7 days in your company. So I said, when I'm looking at them, they look like, school children. I said, which class? He said, no, we are joining management, but the college has told us, go to an industry, spend 7 days in whichever stream. So marketing, you can go into marketing or finance, but spend that and then come to start college. Not at the MPharm or, 4th year stage.
Sir, in Maharashtra, we have started Avishkar, innovative research. So there is a competition within the universities in Maharashtra about Avishkar. Then Anveshan also, Association of Indian University has started. Anveshan, the name is changed. Avishkar is Marathi word, Anveshan is a Hindi word. So that type of competitions are going on. A stress should be given that industry institute interaction, industry institute collaboration, and I think teachers should be given more training, because since we are professional, is by just taking this faculty development program. In faculty development program, I think even I myself, I have gone through AICT quality improvement program. I went to industry, I worked there for 3 months, even as a teacher. So when teachers know, they can impart to students. So teachers training program in industries, and through that they can have collaboration about research, what type of requirement of the industry. They should take up those issues. They can, because we have sufficient time. So I think that will be better.
Good evening, sir. My name is Ranjit Reddy. I'm a pharmacist turned lawyer, been practicing intellectual property laws and patent law for the last 9 years. So adding to whatever you have, your comments, we have the National Education Policy 2020, we have the National Startup and Innovation Policy for Faculty in Higher Education Institution 2019, Startup India Initiative 2016. So all these are highlighting the need of entrepreneurship at the college level. So however, there is a connectivity problem where the college reaching the institute, industry, or the industry reaching the college. So can there be a possibility where industry bodies like maybe BDMI, OPPI, or Indian Pharmaceutical Alliance on one side and forums like APTI on the other side could negotiate and come up with a framework, a policy, a framework for joint industry academic collaboration, so that every academic project becomes a startup in the future? My question is this. Thank you, sir.
Yeah, that's what I said. We have to propagate what is available. That's very important. So I'm sure if APTI takes it up, I'm sure there are many associations. I can speak for our association, that's the Karnataka Association, and I'm very sure that we can do it. We've tried in the past. We've done many programs where we've actually invited students. We had one, as I said, in Acharya College. We had one in Rajmundry and college. And we've had multiple such events where we've invited students to come. Now there, just to, as a side thing, what you call, out of the 20 projects, 19 were app driven. It was not a college driven project or something that came out of the curriculum or something. It was something that the students were doing on their own. They were creating apps. So yes, I absolutely agree with you. We should have that forum, and definitely we can take it. I'm sure APTI sir will, Mr. Ramandang and all our others are here. I think that we can have some kind of industry academia connect.
Good evening, sir. We keep talking about industry and institute partnership all the time, but we also see resistance from industries to allow our students to be there, to be taking part in the training sessions in their industries. So how do we bridge this misunderstanding between the industries about our students? There are few industries we welcome our students and train them, but there are majority of the industries that would not actually like the untrained personnel going around in their premises.
Yeah, that is an issue. What you call, so industry is little afraid that if we take untrained, what you call profession, there are two things. One is industry visits. Second thing is for training. So for training, what happens is we can't give the students hands-on. Say for example, in QC, if they come to QC, they don't go to an HPLC. For even any new person will take 6 months or 9 months. So they have to be ready to start at the basic. Maybe many of the students don't even. We have difficulty with even an automated pH meter, because a lot of the new equipment is very kind of electronic sophisticated. But there is where the alumni comes into question. There are 3,000 colleges, means so many colleges. Like in our company, we have some 70, 80 pharmacists who are at least coming from 30 different colleges. Now, if they come and request that my college is coming, I'll never say no, because he's working for me. I think the alumni you have to connect to your alumni, and you will have alumni in all the colleges. Also, I would suggest that which is happening is that you have an agreement or you have an MOU with 1 or 2 colleges, which you build trust over time. And you say that over the next 3 years, this is what we are going to support you, and this is what support you will give us. So I think 2 things. One is if you have these MOUs, I know there are a lot of MOUs signed because of accreditation, and there's sometimes it's a cyclostyle sheet, which I feel very upset about. But then if you sign, each college signs with 2 or 3 companies where you have a connect, and say that in this year, I'm going to give you 20 students or 30 students. And we agree that he'll be in training, and out of which you will take, how many you will take, that all is of course left to the college and the company to decide. And same thing, the college should have some kind of benefit to the company saying that we will allow you to come to our campus, we will allow you to meet our teachers, we will do some projects for you. So I think it has to be a synergy. But I think alumni is something which is very, very, and don't expect that they will take you into the most sophisticated areas first. Students have to be told, because I've seen students, they come, M.Pharm students come, and more M.Pharm students, and they straight away want to go on the most sophisticated equipment. They are not ready to work at the basic. They believe that they're M.Pharm, so I should start with an what you call a GC and an HPLC. But the companies are afraid because every one column will cost 35,000. And if something goes wrong, so we have to give them 6 months to come up to that. And I think that the students have to be what you call sensitized to. And when you are going, it's an internship or it is an what you call first few months, please allow yourself to get trained. Another thing which I have suggested is to do a paid internship, like doctors have or dentists have. I think pharmacy has to start after you finish B.Pharm. There should be a 1 year or 2 years paid internship, because then the expectation of salary and expectation of work is little different as an intern as compared to when you're coming on a job. So when the students come for a job, their expectation is different. When they come as interns, they are very ready to learn. They do, they make the effort to learn. So there is a lot of difference. But I think alumni and MOUs are the key for what you call companies to kind of come together.
Sunil ji, good evening. Your talk was excellent. A few of the things which you highlighted, especially with respect to what teachers need to do. And one of the point you have pointed out in that they feel shy, they don't approach and they don't express. The reason behind is that most of the institutions are not well equipped to carry out the research. And second thing, as you have said, that there should be a collaboration between the industry and the institute. And you also are the part of the KDPMA. And now being I with the APTI as the Teachers Training Institute, I look forward to have a collaborative activity with Group Pharma, KDPMA, as well as with APTI to bring up a teachers training activity. We are thinking about teachers training in the academia. We are also looking to have the teachers training in the industry part also. Now, in this case, my suggestion and also requesting to you also, can you and the other industry people look for few of the institutions as model institute where you can create a zone of training to the teachers as well as to the students in the industry. What is happening most of the time, the equipments that the institutions are having do not match with the industry. We are training on the old vehicle, but the new vehicles are coming into the industry. That's how I'm just expressing it. So in this case, can you just elaborate it how we can minimize this technology gap between industry and academia, and how we can bring up more quality output of the students along with the teachers?
Sir, about before COVID, about 2-3 years back, we went to the Skill Development Council, Karnataka, and we asked for space. So this will help you to what we can do. So we asked for 5,000 square feet to build a GMP setup to train teachers and companies. So you can have a cluster in, say, in Bangalore. If there is any college who's ready to say, I have this vacant space, 5,000 square feet. In this space, I think Acharya had it because they had got a lot of support from Strides and others to set up a factory, a QC lab, where industry will donate equipment. Industry will come there with teachers or industry specialists, where it can be set up, which will be open to all other colleges also to come and utilize the facilities there. We were talking to the Skill Development Council, and then of course COVID came, the whole team changed. There was a team who was, unfortunately in India, a lot of the initiatives are people, people driven. They're not, agnostic to people. So the whole team was very enthusiastic. They are ready to give us 5,000 square feet area in Kormangla, where their institute is, where they said, okay, you can set up a training center, which would be for teachers as well as industry. And industry, we had talked to large companies and other companies to kind of actually donate filling machine, these machines. I think MCOPS is planning to set up a GMP center, which will be also similar on similar lines that, industry will donate equipment, industry will support, but then that will become a hub for training. So we can do it in Bangalore. Definitely KDPMA is very interested in that, because we believe that that is the way to go forward, where you have a center. So if any college comes up or anything, I'm sure we will reach out to industry to get equipment and get resources to come and set up that for them. Yeah.
So with the shortage of time, we are not taking any more questions. If is it okay? Thank you. So, sir, with your 35 years of experience across various roles, and you have seen the prospect of and challenges in every sphere, and a fantastic deliberation you have put, which is quite motivating. Still, there are so many challenges must be there, which you have not shared in your slide, which is to be addressed by APTI and with all of your support. I can understand. But thank you once again for your time, and on behalf of LOC, APTICON, we would like to thanks for your gesture and your presentation. Thank you, sir.
Thank you, sir. Now, may I request the session chair and co-chair, Dr. Mihir Kar and Dr. Arun Patil, to honor the speaker, Shri Sunil Attawar, with a shawl and a memento. Dr. Pramod Kumar, Organizing Chairman, and Dr. Balamurlidhara, Organizing Secretary, APTICON 2022, to honor the chair and the co-chair of the session, Dr. Mihir Kar and Dr. Arun Patil. Please, sir. Thank you, Dr. Mihir Kar and Dr. Arun Patil, for chairing the session. Thank you. The next lecture is Ambiganandan Memorial Lecture, and the speaker for the next session is Dr. Narendra K. Jain, former Professor and Head, Department of Pharmaceutical Sciences, Dean, Registrar, and Acting Vice Chancellor, Dr. H.S. Gaur University, Sagar, Madhya Pradesh. And the chair for the next session is Dr. Tejal R. Gandhi, Principal, Anand Pharmacy College, Gujarat. Ma'am, may I please invite you onto the stage, please? And the co-chair for the session is Dr. Anupama Koneria, Principal, Sultan Ul Ulum College of Pharmacy, Hyderabad. Please, ma'am. I also invite Dr. Narendra K. Jain onto the dais, please. Welcome, sir. Welcome, ma'am. I request the chair and co-chair of the session to introduce the speaker to the delegates. Thank you, ma'am.
Slides.
Good evening, all dignitaries. And it's a humbling experience to introduce a very distinguished academician, Professor N.K. Jain, former professor and head Department of Pharmaceuticals, Dean, Registrar, and Acting Vice Chancellor, Dr. H.S. Gaur University. Professor Jain is an internationally renowned academician and researcher and a senior professor in India who superannuated in June 2014 after rendering more than 40 years of dedicated and distinguished service as a teacher and 25 years as a full professor. Subsequent to his superannuation, Professor Jain rendered his services as Director, ISF College of Pharmacy, Moga, Punjab, as Emeritus Fellow, UGC at Rajiv Gandhi Technological University, Bhopal, Madhya Pradesh. And then he has been a reviewer for several international and national research journals. He has also translated Professional Pharmacy Part 1 by Professor M.L. Shroff in Hindi on behalf of Central Hindi Directorate, published by Bihar Granth Academy, Patna. Professor Jain has been the recipient of Professor M.L. Khurana Memorial Prize for Best Paper in the field of pharmaceutics and biopharmaceutics, published in IJPS during the year 2006. On 2/10/21, Professor Jain was conferred the Lifetime Achievement Award by Madhya Pradesh IPA at Indore, and in March 2022, he has been selected for the Lifetime Achievement Award, and we were all witness when the sir had received this award yesterday in this very conference. This was conferred yesterday in the APTICON, during APTICON award ceremony. Professor Jain has been actively associated with professional activities, particularly APTI, Indian Hospital Pharmacists Association, Indian Pharmaceutical Association, Indian Pharmacist Graduates Association, and served UGC, AICTE, PCI, NAC, NBA, and most of the Indian universities as an expert. So this is why I said it's an humbling experience to introduce such a distinguished professor. It's an honor, sir, for us. And according to a recent ranking announced by the Stanford University scientists, based on a database of over 1 lakh top scientists of the world on the basis of standardized citation indicators, Professor N.K. Jain is included in top 2% scientists in the world in the area of pharmacology and pharmacy. And it is not going to be a very small thing that I would say there is no pharmacy graduate who would graduate without reading a textbook by Dr. N.K. Jain. Sir, it's a privilege to hear you today. We request you to give your golden words and wisdom, to share your golden words and wisdom with all of us. Thank you.
So, hello. Hello. So thank you, ma'am, so much. I'm deeply honored to be here, and would like to thank the organizers for giving me this opportunity to share my ideas about pharma education. In fact, this is a memory lecture. And I must say a few words about the person in whose memory this memorial lecture has been organized.
This is called as Ambika Nandan Memorial Lecture, and it is in the honor of Professor Ian Mishra, who was working with MS University of Baroda and succumbed to COVID and met an untimely death. In fact, in a memorial lecture, there have to be few sentences about the person in whose memory it is there. That's what I thought. I am deeply connected. I have been deeply connected with Professor Mishra because he was my PhD student at MS University Baroda. And one important thing is that he was serving industry for almost 15 years when he joined for PhD course in MS University of Baroda. And later on, he became an academician. He joined the teaching faculty at MS University of Baroda, and therefore he was a real mix of the academia and the industry. And that's how he could do some wonderful things. For example, the institute interaction with the academia, the type of projects which he could vet, that is really, worth mentioning, because he was the person who was instrumental in translating the need of the industry in the academia. And that was something very different and difficult in those days. So with this, I will start with my presentation, and that presentation is related to what some other speakers have already shared. And whenever you talk about pharmacy education, almost everybody is going to talk about these things, but then I have defined it in a different way. And that is, I'm talking about the challenges in pharmaceutical education. So when you talk about the challenges in pharmaceutical educations, naturally, we have to consider certain aspects of what is existing today and what is expected of pharmaceutical education tomorrow. And in that case, we must refer to what is mentioned in the national education policy, because today or tomorrow, we have to follow the guidelines as per the national education policy, and the ministries are very serious about implementing these things in pharmaceutical education as well. Now, in terms of the NEP, so far as important points for me in pharmaceutical education are concerned, number one, what other speakers have been talking, this is encouraging high R&D investments from government and private sectors. This is going to be a focus so far as the new education policy is concerned, and pharmaceutical education institutions have to prepare themselves to have collaboration, what the previous speaker was also talking, and all of you will be talking. So we have to prepare ourselves as teachers and institutions so that we can encourage, we can get the encouraging investments on R&D from the government and the private sectors. So that is going to be a very important aspect of the new educational policy. We should also be able to prepare the next generation to thrive and compete in new digital age. So thinking about the artificial intelligence and applying the digital technology in pharmaceutical education and its application in pharmaceutical industry, that is going to be a long way. And therefore, this is a part of implementation of the national education policy as well. This NEP definitely outlines the vision of India's new education system. So we have to prepare ourselves to face the challenges. And that's why I'm also talking about the challenges in pharmaceutical education. So it starts from the accepting the new educational system. And what are the important aspects? As per the NEP, these are the 5 pillars. That is the affordability, accessibility, quality, equity, and accountability. And these 5 pillars, they explain the whole philosophy of national education policy as applied to pharmaceutical education. As per the information which is available on the portal of Pharmacy Council of India, from the annual report, that is the diploma institutions are 2512, degree 1146, M.Pharm 874, Pharm D 286, and Pharm D PB, that is 145. These are the figures which I got from Pharmacy Council of India. I might differ. This might be different so far as the current position is concerned, but authorized figures are these ones. And the courses as per the 2021 annual report of Pharmacy Council of India, these are say D-Pharm approved institutions are 3150 and admission capacity is 190 1,000. B Farm approved institutions are 2243, and the admission in capacity is 1,66,841 as per the official figures in the PCI portal. This means that if you happen to be a student 30 or 40 years back, you can definitely consider what are the changes, what the drastic changes have taken place in terms of the quantity of pharmacy students. The intake capacity has increased enormously, and then there is a question of quality versus quantity that we have to look into. When we take it to the current scenario, I think I must bring to your notice certain important facts, certain things which are boggling the mind of all the educationists. This is just a public notice issued by the University Grant Commission, and it was on August 2020. What it is talking, non-retention of certificates of teachers by higher education institutions. Why? Because many of the institutions, they keep the documents, original documents of the staff while they are getting appointed, and then it is on their mercy whether they will return it to the candidate or to the teacher or not. And that is what a serious concern raised to the University Grant Commission, and they are compelled to write such a notice to all the educational institutions. This is from the PCI advisory, and this is regarding one of the appeal of the Pharmacy Council of India, and this is regarding the payment of the salary to the people, to the teaching staff in pharmaceutical education institution. Means what? Means that it came to the knowledge of the Pharmacy Council of India that many of the private institutions, they are not paying the salary. Either they are paying less or they are not paying the salary to the teaching staff. And naturally, you can understand what was the fate of those people. And therefore, this advisory was issued by the Pharmacy Council of India. Another one, this is again appeal for salary to faculty staff during lockdown due to second wave of COVID-19. Again, it is unfortunate to say that many of the institutions, they were not paying the salary, due salary to the staff. They were curtailing the salary, sometimes to the 25% or 25% or whatever it is. So the teachers, they were suffering from financial crisis, and ultimately it came to the knowledge of the Pharmacy Council of India, and Pharmacy Council of India had to issue this type of notice or the advisory. In this way, it is written as the appeal. So they have not given any strict warning or anything, but they have appealed because that is the only way they could do. When we talk about the current scenario, most of us are aware what is really happening. So that's what I say, some of the true stories. Few days back, I was in a institution for accreditation visit. And while interacting with the teachers, when I asked one of the teacher, what subject are you teaching? The teacher told me the subject. Then I asked, what books are you referring? What books are you teaching to the students, and what books are you referring? 10 minutes, 15 minutes, the teacher was blank, point blank. Could not say whether the candidate, the teacher is referring to any book to himself or to the students. This is also the state of affairs in many of the institutions. I don't say all very, very good institutions are also there, but at the same time, this is also a part of the scenario. In certain cases, we have seen that the institution has spent just 20,000, 30,000, 50,000 rupees in purchase of books in a year. This meager amount of the books, this is also spent not exactly on the requirement of the books for the students, but other factors are there, which most of you will understand or will be knowing, whether you admit or not. In addition to that, whenever we go to the institutions, we find many, many things. For example, we are shown a list of 50 teachers. We are shown a list of 40 teachers, and all whatever is shown, sometimes it is not true. Sometimes we are led by the calculations so far as the student faculty ratio is concerned, and we are guided by whatever data is given, and therefore in the assessment, we have to depend on that. But at the same time, when we try to find out what is a real story, true story, mostly it is unfortunate thing. And who is responsible, that you can understand, that is basically the teachers. You can blame the management, but basically it is the teachers. To my mind, the greatest challenge in pharmaceutical education, when we talk about empowering academia for advancing pharmacy education, we are definitely talking about the challenges. And therefore, in those challenges, the greatest challenge to my mind, that is developing the global competence. Because when we are talking about the students working in India or studying in India, we are also thinking about the competency of the candidate, competency of the students. And that competency means that the candidate should be able to compete with anybody in the country, any institution in the country, and also with the students in foreign countries or foreign universities. That level of global competency is required, and then only we will be satisfied with the type of knowledge we are offering to the institutions and to the colleges. So one of the challenges, as everybody knows, that is the mushrooming growth of teaching institutions. I have not to say much about it because it's a open fact, it's a open secret. The number of institutions which are there in the institutions, that is really alarming. Although we say that we don't have enough number of institutions, although some people go to the court and they say that we should be allowed to open the new institutions, whatever it is. But yes, we understand from within ourselves, we understand that yes, the number of institutions is not to be challenged. It is there, it is already approved by the PCI. Is there any new requirement for the new institutions? That you have to assess yourself. So in this case, what is the real solution? Real solution is that the demand and supply imbalance has to be avoided. And how do we avoid this? So first of all, the demand and supply ratio is disturbed. If it is disturbed, then we have to avoid it. We have to remove it. And for that, we require the projections. What are the projections? What are the requirements? And what are the employment opportunities? I remember nearly 35 years back, there was an Institute of Manpower Research and Planning. They had conducted a survey and they had projected the requirements. Today, we don't have any requirement projection. That means how many institutions intake and how many requirement of the pharmacist in industry or wherever it is. So overall requirement of the prospective B.Pharm or M.Pharm graduates is not available, and that is the reason for the imbalance. Institutions, they are training the students. Students may or may not get the job, that is not their problem, but at the same time, there has to be some projection, and projection will come by some institution approved by the institution, by the government, that will help us in bringing about, bridging the gap so far as the imbalance is concerned. Another challenge is about the teachers themselves, the qualification of the teachers, the experience of the teachers, and more importantly, whether they are seriously concerned so far as the teaching is concerned. As many people are putting, most of the teachers, they have become the teachers not by choice. They have been compelled to become a teacher. And this is also a reason for dissatisfaction among the teachers. If the teacher has, if a person has become teacher on his own, it's a different story. If he is not appointed on his own will, or he was not getting any better job, and that's why he entered into pharmacy profession as a teacher, that story is entirely different. And that shows what interest he will have in his own profession. So unless the persons are serious, they should not enter in the profession. In one of my discussion with one of the stalwarts in pharmacy, we came to a conclusion that teaching, including pharmaceutical teaching, this is something like what we call as tapasya. It's not something that you are going for money. It is something which you must have some dedication, you must have inclination, and you must have some interest in teaching. And if you don't have that inclination, if you don't have that intention to become a teacher, or it is not on your own, it is being compelled to you naturally, you are not going to be a good teacher. And that is the reason, that is the problem with many of the teachers from within us. This is also a reason why the faculty retention poses a threat. Whatever number of teachers are there in any institution, that goes on changing. People from one area to other area, from one college to another college, from one college to university, etc., they keep on migrating. And this migration, that is the less of retention or the retention ratio, that is always disturbed. And that starts another story. A teacher leaving an institution, going to another institution, something like uprooting his own, say, development from one place and going to another. And then he, if he is research scholar, he has to start afresh in generating the facilities, resources, and then start afresh. This hinders the overall progress of a teacher, and also it comes in the way of the normal development of the institution. This is particularly applicable in case of the institutions which are in the remote areas. People, the teachers, they don't want to remain in the remote areas for so many reasons. One of the obvious reason is their own development. Another obvious reason is the education of their children. And then so many other things are there. The access to the place, the development of the place, facilities which are available, and many, many more things. And that's why that faculty retention is always a serious threat to the teachers working in rural areas, or the rural areas have got this great problem, great challenge to retain the teachers in their institutions. This is also something open secret, dilution of the standards. And one of the recent trend in dilution of the standards, that is called as the non-attending. Again, when I say it is open secret, there are institutions in which the students, they take admission by saying that we will not attend the college, and institution will help them in getting exams cleared and getting the degree and all those things. This non-attending, this is also a serious threat, although people don't say openly, but then they know that this is happening. In some institutions, in some places, or in certain states, this is prevalent. But then it is also, to me, it is also a challenge. When I'm talking about the challenge, I'll tell you something which is really true. And this is one of the things which is really true. Library resources. The other speaker was also talking about the resources. In terms of the library resources, what we have in our library, there is a requirement of the PCI. We should have so much number of the books aided in the library, and we try to do it. But really, are we catering to the requirement of the books to the students? That we have to ask ourselves. We have to ask the managements and the principal and the library staff. This is again a serious challenge, because we don't meet the requirements as dictated by the students. Major problem is that we don't have the latest books. I don't say in all, but most of the institutions, we don't have the latest books. And by latest books, I mean that they must have the latest editions of the books, and there have to be books which are coming up in the market. Although I say that number of books should be there, I mean really to say that they should be of quality, or the quality books should be there. And number of books, of course, that is commensurate with the number of students which are there in the institution. Again, another challenge to me, that is what is really happening in the laboratory. In the laboratory, in many of the institutions, when we go, we find that the group experiments are being conducted. That means same experiment is conducted by 2 students in a group, 3 students in a group, or sometimes 4 students in a group. Why it is done so? Because it requires less of resources, and it becomes a sort of economical so far as the management of the colleges are concerned. And what is the outcome? Outcome is that students do not get proper training. If they are not handling something, they may not get the training. In certain experiments, it is possible that the group experiment may be acceptable, but not in all. And this is what is to be taken care by the management and the teachers. So this is another challenge to me, because this is also posing the threat regarding the competency of the students which are passing out from the institution. Inadequate supervision, in certain cases, the number of batches of the students which are available and the number of staff which is to supervise, there is also an imbalance, and naturally this leads to the improper supervision. So far as the experimentation or learning of the students in the laboratory is concerned. In many cases, we don't find that the laboratory journals are properly kept, are properly maintained. Day-to-day, updating of the laboratory records is a requirement for proper functioning of the laboratories and proper understanding of the students and the proper supervision by the teachers, which is also a challenge in certain cases. Yeah, this is something which everybody feels like. What is that? Drug samples are the gift samples. Now, with the number of MPharm institutions are the intake and PhD students and their intake increasing in the country, all MPharm and PhD students, most of them, they will require the use of drugs for the experimental purpose. And getting the drug samples, this is a very difficult task. Considering the number of students which require the drug samples, considering the quantity of the drugs required and availability of these drugs, that is a big challenge. And this challenge is to be met with by adopting certain mechanisms or evolving certain mechanisms. And the reasons are there. These drugs are required in small quantity. They are usually costly. Usually suppliers are not there. Nobody is going to give you 20 gram, 50 gram, 100 grams of the drug. Purchase, mostly it is difficult to purchase them. These drugs in this quantity, nobody is going to sell, and there are certain legal issues also. If you want to import, then again, a lot of problems are there. You have to get it imported only when it is for the research work, and if it is not having any commercial value. So suppliers, they are selling in kilos or the bulk quantities. They are not ready to give smaller quantity. And if it is not available, how the students are going to the research? And if this requirement is not met, they will not be able to conduct the research to the required extent. However, research is going on. It goes on with the drugs. Drugs are being obtained, but then mechanism are I would say legal mechanism is not existing. And what I suggest that it is possible, then we can have some agency to coordinate. For example, the IDMA or the OPPI and AICT or PCI, certain agency, they should come forward and set up certain cell so that these requirements could be pulled up. Requirements for all the institutions, for all the students, for all the drugs that could be pooled in one place, and the agency could sort out how much quantity from which manufacturer or supplier could be given. That type of management and I would say MOU might be really helpful in in overcoming the problem or overcoming the challenge regarding the resource in terms of the drug or the drug samples. Academia industry interaction, this also is an important challenge. The speakers have already talked about. I also mentioned about Professor N. Mishra, in whose memory this lecture is there. This remains to be a serious problem, but at the same time, we have to evolve certain strategies to follow them. This is a question of partnership, and that partnership is an institute-industry partnership, and it could be a public-private partnership also. And if the partnership is there, that means two parties are involved, and the two parties are involved and they are really serious, then only this academia industry interaction could be possible. So there are many ways in which this could be realized, but at the same time, there are many challenges also, as the previous speaker has explained. One question is that of the feasibility. The type of research work which I want to do in my institution and the type of research work which industry requires, that may be different, and they have to come together with say understanding what type of research projects could be handled by the students in the industry, or they could be helpful to both of them, and that's why sort of say MOU may be required. Another way is that we have the projects directly from the industry, but they are done in the academic institution. This requires certain things, for example, the capacity building, and number two, what previously was mentioned, that is the trust building. And if the trust building exercise can be done seriously, then probably that industries might share their knowledge in order to get the research in certain areas, like say nanotechnology, nanomedicine, or for that reason, the medical devices, etc. In this case, the institution can be definitely helped with the help of pilot plant. It is available. Certain institutions, or few of the institutions in India, they have their pilot plant, and if it is available, then naturally it helps in translating the requirement of research from the laboratory to a large scale. So if pilot plant is say setup is available in the industry, that becomes a good help to bring about the industry and academic interaction. Then the resources which I talked about, that is the library books and the journals. And in this case, I do insist that the quality books should be there. Books are available in the market, right from 100 rupees to 1000 rupees, or 100 rupees to 5000 rupees. And to satisfy the requirement of the Pharmacy Council of India, the institutions have to purchase a definite number of books. To satisfy their requirement, the number of books requirement is there, but the quality books may or may not be there. Substandard books are also gaining popularity because of certain obvious reasons, but then that is to be avoided, and that is a challenge to me. In this context, the quality books written by, I would say, reputed authors, this exercise is being done sometimes by University Grant Commission, and they were funding the authors in the teaching institutions to bring about the books, and that's what they had brought, the university level books by Indian authors. There is a need, because this is again a challenge. We don't have the quality books. Our quality books are not enough in quantity. And if it is so, then how to solve it, how to meet this challenge? I suggest that although APTI is publishing certain type of books, but they are not publishing the textbooks or the course books. They may take up this activity. Similarly, the Pharmacy Council of India, they are not doing anything in this particular direction. So it's a challenge for them also to help the pharmacy institutions by bringing about this, including this activity in their spectrum of activities. E-books is also very useful device so far as information to the students that is concerned, and these books are a little cheaper and they are easily affordable, and at the same time the quality books may also be available in this section. In terms of publications, yes, it is a challenge. It is a challenge to all the teachers in the institutions. And why it is so? Because we should know which journal we should publish, which type of journal suits our requirement, whether it is specialized journal, whether it is general type of journal, that we have to understand. Then we have the e-journals. We have Me Too type of substandard journals. I can cite dozens of journals which starts with international journal of such and such, international journal of such and such, but it is not an international journal. By writing a journal as the international journal doesn't really help, because that quality doesn't come up by writing international or whatever it is. We have to look, I mean, as teachers, we have to look into what is the real picture in terms of the impact factor of the journal or the citation index, and whether it is a paid publication. I don't say that paid publication is bad. Paid publication is good. But then many of the very good journals, very reputed journals, they are also asking for the, say, payments. Because of their quality, they are getting the money and to maintain the quality of the journal. But at the same time, substandard journals, they are also asking for the money. And if you pay this much amount, your journal, your paper will be published. It will be published as such without any proofreading, anything, it can be published. That is the state of affair, which to me, again, it is a challenge, and all the teachers, they have to take care of these things. Financial support for publication. If you publish in good journals, sometimes you have to pay. Good journals, very good journals, they also require payment. And that payment should be borne by the institution, or the institution should be ready to accept that they will support the publication of good, say, papers in very good journals. Without financial support, also the journals can be, the papers can be published, but depends upon the area in which you are working, the quality of journals and the quantity of journals which are available in that area, and whether that suits your requirement, or whether it gives you impact factor, or whether you get good citations, etc., in terms of the quality of the journal. And there are certain issues like, say, IPR, patent, and plagiarism. This all, I think it will be difficult for me to go through. But at the same time, I should think about, whenever I do some research, I should have in mind whether it will have IPR, say, potential, whether it could be go for patenting, or whether it is attracting any plagiarism issue. If it is attracting plagiarism issue, I'll have to take care of that. And all teachers should understand what is the level of plagiarism allowed and at what level they have to stop. We have, in the market, we have got the edited books, we have got the monographs, and also there is now a requirement regarding the books in the regional languages, translation of the books. In certain cases, it is felt that these books should be available in the regional languages also. Central Hindi Directorate that can come along in bringing about the publications, particularly in Hindi. And again, there is a challenge regarding the publication. That is challenges regarding the publisher. If you want a publisher, naturally, publisher is going to dictate. And there are certain publishers whom you can dictate, and there are publishers who dictate you. So depending upon the quality of publication, reputation of your books, and your own reputation, the publisher will carry out your work. There is a serious question about the piracy. Pirated books are also available in the market. It's difficult to get hold of such persons, yet this piracy goes on. And Xeroxing has definitely helped the culprits in bringing about the pirated books. And in certain places, you go there, whatever book you want, you get it Xeroxed, and any book can be obtained as a Xerox copy or a duplicate copy, like in the market. To avoid this, we can also go for the self-publication, but self-publication is too expensive, and usually it is not economically feasible. It ultimately boomerangs back on the author itself. So to me, looking in the current scenario, the quality education is a challenge. Education is there, farm school education is there, but quality education remains a challenge. And what does it mean? When I talk about the quality education, everyone dreams of quality education. Parents need quality education for their children. Teachers need quality education for their students. And leaders need quality education for the future generations. So broad is the spectrum of the quality education. So when we talk about the education, we must talk about the quality education. And naturally, for companies, for their future staff. Now, I take you back to 2003. This was the UGC recommendation, that is the higher education in India, issues, concerns, and new directives. What the UGC told at that time, I mean the recommendations. Recommendation was that every university must have its own curriculum. Whether a uniform curriculum will be better or not, that you have to decide. Our teachers have to decide, but then it is a challenge. There should not be any mechanism for central curriculum framework at higher education level. That was the recommendation of UGC in 2003. What we are doing now, that's a different thing. But this is also one of the recommendations. Our context, specificity, and inquiry-oriented experience must be reflected in the curriculum. So this becomes a component of whatever curriculum we are designing for education in general and pharmaceutical education in particular. Learners' participation in the generation of knowledge must be the focus of constructivist curriculum. So the learners' participation is also important. Normally, this is not there. We talk about the contribution of the stakeholders. We do think about the recommendations of the stakeholders, but to what extent we are really translating all those suggestions, or to what extent we are really getting these suggestions, remains a question. However, the curriculum or the revising of the curriculum remains a big question so far as the current scenario is concerned. Then problem-solving abilities must be developed through experimentation with life-like situations. Real-life situations, they must be reflected in the teaching, whatever we are designing the curriculum. So if we think about the quality or the quality education, naturally, what is the mantra? The quality mantra is that quality cannot be tested into products. This is what we talk in the industry. Quality cannot be tested into products. It has to be built in by design. Same we can translate in terms of the quality education. And therefore, if we want to have certain qualities in the student, we must be able to build this quality with the help of design. That means the curriculum should be such design that it will lead to the satisfaction of the requirement. And this is the impact of QBD, quality by design. That is the changing the curriculum by the university, that is an impact. Health authorities change their assessment and inspection. Companies reorganize their science. So many changes do take place. And in this context, you have the agencies, accrediting agencies, national as well as the international accrediting agencies, which try to inculcate the quality environment in the institutions or in the pharmaceutical education. The faculty awards another way of, I would say, appreciating the teachers. Different agencies are available. AICT is also offering certain awards. And we have the career awards for young teachers, national doctoral fellowship, inspire faculty awards, and so many others by funding agencies. These are all to encourage the teachers to carry out their work in a better way. These policies for UG and PG education, they also talk about the competency, that is the global competency. And here, what is there? After ensuring world standards in the institutions through facilitating and enabling mechanisms, only then we will develop the competency, and that is the global competency. So these are certain ethics for the teachers, and we must appreciate the role of teachers. The real role of the teachers. I am teacher. Why I am a teacher? I should know very well what is there in my mind. The expectations from the teachers. Everybody has got different type of expectations from the teachers. So, society has certain expectations. Management have certain expectations. Colleagues have certain expectations. My own family, they have got certain expectations, and I have to carry out all these things in a unit that is a teacher. So how can the teacher make all these balances, satisfy all the requirements? That is for him to decide. And before entering into the profession of teaching, he should know these things. To all my colleagues, particularly the pharmaceutical teachers, I ask one question. And you can also ask yourself, why should students attend your class? In spite of the fact that we have got all the material available in the internet, books are available, literature is available, many things are available, many resources are available. In this case, where is the need for the student to attend your class? Can't we go for the online classes continuously? Is there any requirement? Or you have to prove your worth as a teacher, then only the student will attend to your class. Otherwise, there's no real need for this. At the same time, the teachers have to go for the identification of the slow learners and the fast learners, so that they can differentiate where to put more attention or where less attention is required. Or they have to divert the attention of the slow learners and fast learners for the betterment of their, say, profession. Teaching aids, we have to, many teachers are using them, but some of them may have to learn about the newer materials which are available for teaching, or the teaching aids. The books and notes which are available, to what extent the books or the notes are helpful, and to what extent they are not helpful to the student, to what extent you can contribute, you can supplement the information available in the books and notes, and how you carry out the evaluation in terms of the evaluation of the answer books or the practical examination, etc. That again, you have to leave an impact in terms of the quality of the examination. In terms of the publications, when I was talking about, there are so many journals, so many publications, which are also called as the Me Too publications. We should refrain from publishing in the Me Too journals. Always it may take a little more time, or it will require a little more efforts to publish in a good journal, but we must refrain from going for or opting for the Me Too journals. Student exploitation, this is a serious matter. I think all the teachers know, when I publish a paper and there are two authors, the first author wants his name, and that is the supervisor, which is, in my opinion, unethical. The person who is really carrying out the work, he should be the first author, and the person who is supervising, he should be second author. Normally it is reverse, and this is also not a good trend, and to me this is a challenge. Copycat paste has also facilitated the job of plagiarism, which should be avoided, because once this comes to the knowledge of the author or the readers, it becomes a serious problem to the candidate as well as to the supervisor. And we should try to have the, we should avoid the writing of the books like the cut, paste, etc. Try to do some serious efforts. Try to develop certain skills, then only go for writing. It's not that today I enter into the profession and tomorrow I start writing the book, and within a year I am ready with one book or the two books. We can also go for the review articles if it is possible, but review articles, these are by the experts. Unless we have developed the expertise, I think we should refrain from to do that. And book chapters is also another exercise which we can go for. All these are the challenges before the teachers. Taking care of the IPR, patents, and technology transfer. Skill upgradation, we have got the many facilities for the teachers, like this seminar, symposia, conference, FDP orientation programs. Teachers must attend to them. And the national and international level exposure will be useful. Industrial exposure, if I have devoted some time in industry as a teacher, naturally my spectrum is widened, and naturally I will be better suited for delivering the information to my students. Collaborations has been talked about, the industry, hospital, research institutions, that also goes a long way. And faculty exchange program, this is not much practiced in India. However, it is very good tool to develop the skill, to improve the skill, and to develop overall, I would say, personality of a teacher. Sabbatical leave also, this gives a facility to teachers to carry out the research in different areas. These are the regulatory agencies which have to take care, which must take care about these aspects. One is the service rules and conditions, whether they are really followed. Mostly, except in the universities, these are not followed to the desired extent. Then the promotion, then the financial matters, conduct of teaching and examination, which is there. And in terms of the PCI, that is the regulatory agency, they are offering all the courses. Recently, they have come with a exit examination, which I have my own reservations, whether it should be there or not. What is really happening? You are conducting the examination, you are approving the examination conducted in Thavati, and you are also approving the institutions. Now, is there any real need for the exit examination? We should judge yourself. Reducing the intake, that is a great, I would say, step forward by the Pharmacy Council of India. This has been done for the first time. I must appreciate the gesture that they are interested in developing the quality institution and the quality. What challenges are there so far as the teachers is concerned? How much salary they are getting, that is the money and compensation, whether they are getting enough comforts with the salary which they are getting, whether they are working for the name and fame, whether they are working with the dedication, and whether they are getting any social recognition. These are the factors which are imposing the need for introspection by the teachers. So these are certain things which I think I am proposing all of you to consider it seriously, and try to overcome the lacunae in the present system, and try to incorporate what is called as the quality by design, and that is going to be in the industry. Again, we talk good pharmaceutical quality represents an accurately low risk of failing to achieve the desired quality attributes. Same thing you can transfer in education, so that your student which are coming out of the institution, they should also not fail in any of the required attributes from the teaching. This already reflected in the PCI syllabus of Industry 1 and 2. And they have already mentioned what are the objectives of doing study in Industry Pharmacy 1, what are expectations from the students. Industry Pharmacy 2, what are the expectations from the students after passing this particular course. And that is what type of quality attributes you want to incorporate, what type of quality by design you want to incorporate among your students. This is again a serious concern. Most of the institutions, they do not have adequate documentation. That's why they fail in achieving what they really deserve. They deserve too much, but they don't have documentation. They don't have system of documentation. These are some of the benefits of the documentation, and we are following. Then we will be definitely benefited. And in the last sentence, what I can say, as I have been a teacher, I say that you should try to be a role model. Your students should consider you to be a role model. And this is the quote from William Arthur Ward about the teachers. The mediocre teacher tells, the good teacher explains, superior teacher demonstrates, and the great teacher inspires. So become the inspirer of the students, to the students, and be beneficial to the society. Thank you very much. I would like to thank the organizers for allowing me to be here to share my, I would say, opinion about the pharmacy education. And this is again dedicated to my student, Professor A.N. Mishra, who has been a very good student and who has been a very good teacher and very good research scholar and very good scientist as well. Thank you very much.
Sir, please have a seat.
Yeah, thank you.
Yeah. First of all, congratulations, sir. We heard this 40 years of your real ground experience in pharmaceutical education, and you have really addressed this from macro, this global competence, to micro, we can say resources, teachers' problem, students' problem. And you have not only talked about the challenges, but I can say you have tried to give us the solution also very quickly in a crispy manner. Just to add this thing, You have narrated all challenges, but the future challenge that particularly in our state that we can see that due to so many pharmaceutical industry, students, good students after post-graduation, after PhD, they don't want to join this academic, and it's so many times we are asking, they are saying that this respect, social in society, the respect of teacher, particularly in northern region, or we can say in certain parts of this India is not there. So I can say that in future, this is again one challenge for that. We will not get this teachers also. Right. They would love to go to the industry. Just to wrap up this thing, one is that you have mentioned about this project in industry. So many times that actually in reality, when students are going in industry that for project work, they actually working for 5 days for the industry work. That's not the really their project is. And whatever is the project, or we can say some small report is that they are coming with that. So this is again a one big challenge that they are going into the industry, but we are facing a lot of this type of problems also. Of course, they'll get good job in that thing, but this is another. So just to add that you have added, listed various this thing, these are the two challenges. Only this one question from my side that we are always thinking of that this Indian Journal of Pharmacology or this type of good journals that are published from India, whether that will be considered as international or not. Because when people are coming from the regulatory authority, they will only check that international and national. As being a 4 decades experience in this, how we can really define this national and international journals, as per your opinion?
Yeah, actually the test for the journal, whether it is a journal which has got the reviewers, number one, and whether they are going for, I would say, thorough revision. Thorough revision means depending upon the paper, thorough revision may be there. And every journal will have the impact factor. That impact factor that becomes an acid test. If a journal has got an impact factor of 20, definitely it is better than a journal which has got impact factor of 10. A journal having impact factor of 5 is definitely better than a journal having impact factor 1. And that's how you can grade them. So instead of calling that national or international, if you guide them, you guide your students that your paper which should be published. I mean, I would like that your paper should be published in a journal which has got at least 5 impact factor. Because gradually you can say, no, I am not satisfied. You have to work hard, and next time when you publish, it should be in an impact factor of 8, 10, 20, 30, 40, 50. That becomes a sort of test. So it is for the teacher to decide. Impact factor, no impact factor journal, don't publish any work, good or bad, never publish. If you publish in a good journal, you will get the credit, and your research will be honored, it will be recognized. Your student will get the advantage, will get the credit for that. Otherwise, there's no credit. So publishing a paper in a journal which has got an impact factor of 10, one paper, is more than publishing 200 papers in journals which have got no impact factor. That quality will come, and that quality is to be realized by the teachers or the supervisors, and they have to insist upon them to the students. This is my opinion.
Yeah, I agreed with you, sir, that quality, this thing. But normally regulatory bodies, universities, they are coming and they are. So I think for this solution is that this APTI, or we can say our regulatory authority, should list out that the journals, international and journal, otherwise they don't have to categorize, they have to write that this many journal with this much impact factor and this many journals with this without impact
factor. No, UGC
factor.
has already done that exercise. They have recommended certain.
UGC care list, but
yeah,
I think
yeah,
that also requires
but then whether it is UGC or it is AICT or PCI, you are the proper judge.
Yeah.
You know you know in your heart that this is good journal. You know that it's not a good journal. So the test comes from you only. You need not depend upon anybody saying that it's a good journal. If it has got an impact factor of 10, definitely it is a good journal. If it doesn't have an impact factor, naturally it is not a good journal. That is very, very simple to decide. And then gradually we can improve upon our publication in terms of the impact factor. Then whether, I mean, discrepancies may be there, but then it is a, I would say, rule of thumb, depending upon the availability of resources. If you can publish in good journals, better journals, best journals, that will go on. That is the way.
Yeah, thank you so much. And I think this session is open. Anyone have any questions from audience? I think with this, my co-chair wanted to say anything. Yeah. So we are hoping that, sir, after listening to this extraordinary lecture, that now new book, this QBD in pharmaceutical education by Dr. N.K. Jain.
Some books they are coming out.
Yeah, in pharmaceutical education related with this. So particularly for teachers' point of view, yes, I think. So.
I understand. I'm trying. Still, I'm say industrial pharmacy 1 and 2. They are out. Pharmaceutical jurisprudence and law and ethics. They are already in print. So I try to keep myself updated and try to keep my books updated so that they don't lose the relevance. Because publishing a book is different thing. Publishing a new edition of book and updated information, that is very, very important. That is, I think one should always try to maintain. Thank you.
Thank you so much.
Thank you, sir. Now may I request the session chair and co-chair, Dr. Tejal R. Gandhi and Dr. Anupama Koneria, to honor the speaker. Please move.
I am seeing after yes. I was just looking for you. In the
I now request Dr. B.M. Gurupadya and Dr. M. Deepalakshmi, the local organizing committee, APTICON 2022, to honor the session chair and co-chair. Please, ma'am and sir. Thank you, sir and ma'am. There are few important announcements for the benefit of the delegates. The certificates for the oral and poster presentation will be issued to the presenters in the third floor from today 7 p.m. From tonight 7 p.m. you would be able to collect the certificates for your oral and poster presentations, and it will also be issued tomorrow till 2 p.m. Also, the delegates who are interested to attend the cultural program may attend the same at Sri Rajendra Auditorium, JSS College of Pharmacy, Mysuru, and the cultural starts from 7 p.m. today evening. Thank you. Ladies and gentlemen, we have come to an end of the Day 2 scientific lecture session. On behalf of the local organizing committee, I take this opportunity to thank the eminent speakers, the chair and the co-chair of various sessions for their time and for sharing their knowledge with the delegates. I also take this opportunity to thank the delegates for their active participation. Thank you one and all.